Okay, good morning. I think that we will begin. Welcome, everyone. My name is Joseph Kearney, and it is a great privilege for me as Dean of Marquette University Law School to welcome you to today's conference. You will see quite little of me today at the podium because the role of MC will be filled by David Strifling, who is our Director of our Water Law and Policy Initiative and who has led the effort of putting together this conference. My own purpose, in addition to welcoming you, is to welcome and introduce the person who leads the larger Marquette University water effort. Since his arrival 2 years ago as president of Marquette University, Dr. Michael Lovell has encouraged all of us at the university, whatever our discipline, to engage with things water, and he certainly has supported the law school's effort, including this conference. So we are grateful that he would give us some words of welcome and context on today's event, after which Professor Strifling will take the helm, or the microphone at any rate. It's a great privilege for me to introduce Marquette University's president, Dr. Michael Lovell.
Well, good morning. I want to welcome you all to Marquette University. We are really proud to host this forum on American drinking water. And as many of you are aware, Milwaukee is really striving to become an international water technology hub. Through the Water Council, we have about 180 organizations that are working together to really be a thought leader, not just for our country, but for the world. And the Global Water Center, which is located about 10 blocks from here, has really become the epicenter of that activity where the world is starting to come to get their water problems solved. So at Marquette, we are excited to be part of this effort that the city is undertaking. Through technology in our engineering school, we've really become a leader in wastewater management. Here at the law school, we are really striving to become one of the leading law schools in the country around water policy and law, and we're developing programs, as you're going to hear later from David, that really focus on some of the key issues that the country and the world face around water. And our law school in general, as you can just see by today, all the people that are here, we really want to be a thought leader around topics that are important to our nation. And when you think about drinking water, 780 million people or more in this country don't have access to clean water. But in our country, we take for granted that when you go into your kitchen and you turn on your faucet, that you will have access to clean drinking water. But maybe we shouldn't take that for granted. I think we learned earlier this year in Flint, Michigan, and other places, that the infrastructure that our country's been built on around water is degrading and maybe is starting to fail us. And so today, you will learn about some of the challenges that our country is facing around drinking water. And you will hear some of the opportunities that we have, not only to make a difference here in this country, but around the world. We've gathered some great thought leaders and experts who will give you some interesting perspectives on where we are heading. And so I hope that today you walk away learning something, feeling like you know more about some of the challenges facing our country, and you also find it very interesting and have a very fruitful day in terms of what we need to know about drinking water in our country. So again, I thank you all for being here. I thank you for being part of this discussion, and I welcome you all to Marquette University. Thank you.
Thank you, Dr. Lovell. Good morning and greetings, everyone. Thank you for being here. I'm Dave Strifling, the Director of the Water Law and Policy Initiative here at Marquette Law School, and as Dean Kearney said, I'll serve as something of a master of ceremonies during our program today. Part of the mission of our Water Law and Policy Initiative is to pursue opportunities for information exchange and collaboration, and to provide a forum for public discussion and education on legal and policy aspects of critical water-related issues. We'll do that today as we discuss topics such as lead and aging infrastructure, groundwater, privatization of water systems, water pricing, and other things. We believe they are important matters on which we have a responsibility to engage and convene a conversation. And so toward that end, we have brought together a number of national and local experts, policymakers, and thought leaders here to Milwaukee and to Marquette Law School. They'll present a variety of perspectives and will help to educate all of us about these issues. And in the interest of making this a true conversation, at the end of every session, there will be time set aside for questions from the audience. Before I introduce the first panel, I want to make a procedural point or two and ask for your help in keeping the trains running on time here today. The law school's programs have a hard-earned reputation for keeping on schedule, and in large part, that's due to the cooperation of all of our attendees. We have two scheduled breaks. One is at 10:45, and the second is at noon, which is a brief, I'll call it a lunch break, but really it's intended just for you to grab a boxed lunch and bring it back to the room here for a lunch presentation. So we ask you to be back on time from those breaks so we can start up again promptly. And finally, last but not least, for those of you who plan to be tweeting from the conference, we have designated a hashtag MULawWater that you are welcome to use if you'd like. With that, let me introduce our first panel titled Lead and Aging Infrastructure. This session will explore the legal and engineering challenges associated with ensuring that Milwaukee water is safe to drink. According to recent estimates, over 70,000 lead lateral pipes serve Milwaukee residents, and the estimated cost to replace them is over $500 million. Other Midwestern cities such as Madison and Chicago have taken different approaches to addressing lead service laterals in their cities. And studies have shown that the release of lead from the pipes can occur when there are localized disturbances such as construction, and that presents a public health risk. Numerous recent reports have also discussed the risk of lead contamination in our nation's schools. So with that as general background, I'm going to hand the program over to our moderator for this session, Mike Goucher, who is our distinguished fellow in law and public policy and also was one of the conference organizers. So Mike, I'll let you introduce the first panel.
Thanks, Dave, and good morning to everyone. We're delighted to have you here at Eckstein Hall at Marquette University Law School. I'm going to take just a couple of moments to give you a bit of background before we begin and give our panelists a chance to get seated here. Our first panel, as Dave mentioned, will discuss the issue of lead in America's drinking water and the challenges we face due in part to our aging infrastructure. I think everyone in this room is aware of the problems in Flint, Michigan. In 2014, that city switched its water supply, and almost immediately people began complaining about the quality of their water, what it looked like, what it smelled like, what it tasted like. But as we also know, for months, city and state officials said there was no problem, that the water was perfectly safe to drink. Eventually, it was determined that supply lines had sustained major corrosion and that lead had leached into the water in Flint. And it was, I think we could safely call it a full-blown health crisis because, as Dave mentioned, we know the impact of elevated levels of lead in the blood in children and in pregnant women. We're talking about cognitive issues. We're talking about behavioral problems. It was a major crisis. Milwaukee and a number of other cities in Wisconsin face their own lead-related challenges. They have aging lead pipes. Dave referred to them, these lead laterals. They're not the water mains, but they're the pipes that connect houses and residents to the water mains. They're old. Thousands of them are old. Not all of our pipes are lead, but thousands of them are. They need to be replaced, and we have some questions about how we do that. How long would it take us to do that? Who would pay for the cost of replacing them? And in the meantime, just how safe is our drinking water? So having said that, let me introduce to you what I think will be a terrific group of panelists. Joining us today is the Mayor of Milwaukee, Tom Barrett. Mr. Mayor, we appreciate you being with us today. Seated next to the mayor is Kathy Stepp. She is the Secretary of the Wisconsin Department of Natural Resources. Secretary Stepp, good to have you with us today. Also with us, Fred Royal. He is the president of the local chapter of the NAACP. He's also a member of the citizens group Freshwater for Life Action Coalition. Mr. Royal, good to have you with us today.
Thank you.
And also with us is Mark Edwards. Professor Edwards is the Charles Lunsford Professor of Civil Engineering at Virginia Tech University. If you've been following the Flint story, you may be familiar with the work of Professor Edwards. He led the research and testing that exposed the serious nature of the Flint water crisis. Before that, he also exposed lead problems in our nation's capital, Washington, D.C. Professor Edwards is doing double duty for us today. He's also giving keynote remarks at lunch, and we are delighted that he could be with us. Won't you please give all of our panelists a warm welcome to Marquette Law School. Well, Professor Edwards, I think you came the furthest for today's conference. So let me begin with you and ask a question based on your research and your knowledge of our infrastructure in this country. Is Flint and is Washington, D.C., are they really just the tip of the iceberg? Are we likely to see more of these sorts of situations in our country?
I was just reflecting that it was a year ago today that our team decided to go to Flint, Michigan. And when we did that, it was on the assumption and belief that we were witnessing an environmental crime, a crime that was committed by city, state, and federal government against one of America's most vulnerable populations, Flint, Michigan. And, you know, in some ways it was a suicide mission because it was either expose this crime or sort of end our professional careers. And I guess no one's more surprised than me that I'm here today and made it through to tell this story. And I think that, no, I don't think that there's anything particularly unique about Flint except that the bad actors got caught and people realized exactly what happened.
So more to come?
Well, no, I think the odds are against something like Flint ever being exposed in the first place for the reasons that I mentioned. So it's more an issue of the miracle. Will that miracle occur where this crime is exposed, where the environmental policemen that we pay to protect us are exposed to be environmental criminals? The odds are against that ever happening.
Kathy Stepp, as Secretary of the DNR, help us better understand the extent of the lead pipe issue in Wisconsin. Where is it most common? How many pipes are we talking about? Give us a sense of what we're dealing with here.
If it's okay if I kind of tag on to
That's fine.
Yes. What Mr. Edwards just said.
It's a conversation. Feel free for all of you to jump in where you see.
I just want to express my appreciation for his work and his team's work. As regulators in Wisconsin, it's always a challenge for us. As you can imagine, we've got so many public drinking water systems, and to be able to properly regulate and monitor and make sure that the work that's getting done on the ground is indeed within the confines of the rules that are in place from EPA, as well as state requirements, different inspections, the methods and techniques that are being carried out on the ground during those inspections. I will tell you, you can imagine, I watched the Flint, Michigan crisis unfold in horror. It was something that I literally watched the C-SPAN hearings in front of Congress 6 times, to the point where I thought I was going to need an intervention to stop watching C-SPAN at some point. And my staff was getting very concerned about my mental health as a result of that. But I was very, very impressed with Dr. Edwards' team of being able to take on, and really it takes a tremendous amount of courage to speak truth to power and to be able to enlighten a crisis of such magnitude. And it really brought home to me the vulnerabilities that we're all facing with aging infrastructure across the country. And if there's any silver lining to Flint, Michigan, it's this. It's that people like you, everyday people, and policymakers at state and federal levels are for the very first time talking about drinking water in a really serious way. And that is the gift that I think will keep on giving. So I guess maybe I'm a little bit more optimistic on that side, because what it forced us to do internally at Wisconsin DNR, me to do as the head of the organization, is to make sure that our people are following what the federal rules are, that we're not trying to encourage or enable localities to be able to so-called cheat the numbers so that their reports look good. We really needed to know, and the governor insisted on knowing, to make sure that what's happening on the ground at our public drinking water facilities is the right thing, and that we're doing the best we can to protect those most vulnerable. I'm really proud of the program we've just instituted with the help of EPA and support of EPA, which is for the first time being able to use these public monies to be able to replace private laterals like what Mike was talking about. That is unique, and we were the first state in the country to implement this program. We've been able to help lots of communities across the state, not just Milwaukee, but Milwaukee and cities like it, Beloit, some of the more aging cities that we've got are definitely the most vulnerable, and we wanted to be able to do the most help that we could, prioritizing those dollars on sites that have more needs with more vulnerable populations, most notably schools, daycares, and in socially justice challenged areas of our state. And it's really important work. And again, I just want to express my appreciation for you all having this conference today. I think there's a lot that we can all learn.
So are we talking about, I think I saw a media report, about 140,000 total in the state of these lead pipe lines that need to be replaced?
That's correct. I mean, it's a tremendous undertaking. And that's just a small glimpse, frankly. And then when you take a look at it on a nationwide level and you talk about aging infrastructure, it's a huge discussion that needs to be and is now being elevated to the federal representation, which is a very good thing.
Let me move over to the mayor quickly. Mayor, talk about the extent of the issue in Milwaukee. We heard Dave Strifling say that, we're talking about $500 to $700 million to deal with about 70,000 lead pipes that need to be replaced.
That's a very accurate figure. And if you look at Milwaukee's total as a percentage of the state, the Secretary just talked about the state being approximately 140,000 homes. I actually thought it was a little higher than that, but you can do the math. If it's 70,000 over 140,000, you can see half the problem is here, or close to half the problem is here, is more what we've thought. So we understand that this is a real world issue. There's not a lot of theory here. We know what has to be done. We know that we have to find funding sources to deal with this very expensive problem, and that's the challenge. And I'm guessing if I were to ask even this audience here, how many of you live in a suburban area, there would be a number of hands that would go up. If I asked of that same group, how many of you at one time in your life grew up in Milwaukee or lived in Milwaukee, I'm betting that a high percentage of those individuals had lived in the city. So what has happened, and Beloit's another example of it, you have older cities where the older housing stock, roughly speaking, is now inhabited by people with lower incomes because a lot of the money has left. So how do you factor in the ability to pay, or how do you find the funds to make sure that those houses have those laterals replaced on the private side? That's, again, so people, maybe you all understand this. For me, I'm not an engineer. It took me a while to understand this. There is no lead in our water mains. Those are the expressways in my mind. Then if you get off the expressway, the laterals are the side streets that come off the expressway. We do have lead in a large number of our laterals in the city of Milwaukee. Essentially, if you live in a home that was built before 1951 or 1950, you can bet that you have lead in your laterals. You also, and this is something that makes it even more complicated, are probably going to have lead in your home, in the plumbing in your home, which raises another range of issues as to what we do. What we learned in Milwaukee on a limited test was that when we did construction, there was the disruption that occurred, and that's when we decided that we were no longer going to do these partial reconstructions, if you will, unless it's an emergency situation.
You saw lead levels go up in the water.
We saw what we saw, and I'll just to put this on the table, Carrie Lewis, who is here, who is our superintendent of our waterworks, is involved with this issue nationally. And she came to me roughly 2 years ago, maybe it was a year and a half ago, and said, we're going to be doing some work, and we want to, on a volunteer basis, test what happens when we replace these water mains, because we had just entered into an agreement with the state to replace 15 miles of water mains per year. We asked 21 homes if they would test their water. 6 of them agreed. And when we tested the water, what we saw was a spike right after the construction. Now, X number of weeks later, 4 or 5 weeks later, I don't recall exactly how many weeks later, the level was back down. But there certainly is a spike that occurs when there's that disruption that happens when you have construction. We immediately contacted then the homes that were affected and those who are in homes that have the lead laterals to let them know this. And the program that we had entered into with the state for 2016, we immediately said, all right, for 2016, we're going to continue our replacement of the water mains, but we're not going to do it in those areas that have lead laterals until we can decide what the best course of action is. So we put that portion on pause. We didn't end that portion, but we know that we have to find a way to finance this moving forward.
I want to talk about the fix in just a moment, but I want to weave Fred Royal into this conversation. Mr. Royal, as the president of the local chapter of the NAACP, but also as a member of the Citizens Group class, what is your concern right now about the water in Milwaukee? What is your organization's concerns?
Well, we already have identified 10% of our children to have some type of lead indication in their systems currently. So a lot of the discussion has gone towards lead paint, but we also know that lead laterals is one of those contributing factors. So knowing that water is much more soluble than paint, that would seem to be the easiest way for a child to have access to lead, unfortunately, both born and unborn. So we know that there are 70,000 laterals. The majority of them are in automatic districts 14, 10, and 7. And we're saying that this is, one, an opportunity to address lead in our children. 2, it could be a major windfall as a major jobs program for the 50% of black male unemployment that we have and 23% poverty in our city.
Mm-hmm. Let me ask a quick question of both the mayor and Secretary Stepp. And it's really the bottom line question in the discussion. We can talk about the cost of this, we can talk about the extent of the problem, but what people in this room want to know is my drinking water safe? Do we know it to be safe? Secretary Stepp, do we know that it's safe in not just Milwaukee, but in Racine and Manitowoc and other places where these pipes exist?
Yeah, we feel really good about researching that very question, because obviously that was one of the most basic questions that I had after the Flint crisis was uncovered, is where, I mean, are, by the way, those results reliable, to make sure that the reports that we had received from municipalities were true, right? So we feel very good about the information that we've got now. I think it's about 97% of the public drinking water supplies do not show any elevated levels of lead at this time. But again, that's all. I hate to even use those numbers because I feel almost like it's kind of minimizes some of the most impacted areas. So while 97%, and that sounds, oh, that's an A grade, right? You could look at it that way. But what about the 3% that aren't? Right. And we have got to get that to 100%. And I feel very confident that we're moving in that direction. But we're also waiting somewhat on EPA to update the lead and copper rule. The states and my counterparts across the country have been active in communicating through our organization nationally to make sure that EPA is engaging the states so that we can help educate them on what the real life practicality challenges are in being able to implement those, and making sure that they're not just numbers for numbers' sake, but that they're actually tied to health-based standards. And that's a really critical thing. And if that costs a lot of money to do that, then it costs a lot of money to do that. And if there's anything that government should be doing, in my opinion, it's the security of the American people and their health, safety, and welfare.
Mayor Barrett, I'll get you in one moment. Mr. Royal, you wanted to jump in there?
Just briefly, and that's one of the major concerns, is because we know the EPA standard is set by the industry, but the Center for Disease Control says there's no acceptable level of lead that should be introduced into a body.
Mm-hmm. Mm-hmm. Mayor Barrett?
One of the things I say, I've served at the federal level, the state level, and at the local level. And at the local level, there's not a lot of theory. It's, okay, what works, what doesn't work. My wife and I live on the west side of Milwaukee. We live in a home that was built in 1916. It's in Aldermanic District 10. So there we are. We moved in that house in August of 1999. At that time, our kids were an infant, 2 years old, 5 years old, and 6 years old. So my family is an example of a family that lives in one of these homes. Quite honestly, at least I never thought about the drinking water for years while we lived in the home. I will say that my wife, who's the boss at our house, immediately after moving in said, we're going to get the lead paint out of the basement, and that was done immediately. Only in the last year or two, after I've had these conversations with Carrie, I went home in my patronizing fashion and said to my wife, I think we should let the water run based on the conversations that I've been having with my water people and health people before we drink it. And my wife said, I've been doing that for years. So that'll tell you who the science expert is at the Barrett household. As we've had the conversations about this issue and this forum, I've asked, again, people from my health department, from my Department of Public Works, all right, do you drink the water? I mean, what better test can you have? They said, yes, we drink the water. I said, do you think it's safe? They said, yes. I said, would you have an infant drink this water? And they said, no. So there, I think, is the issue. And this goes to what Fred was saying. I would say for infants and young children, that's where you don't want to have the lead exposure. And that's where we continue to have some lead exposure in older homes.
Professor Edwards, I want to have you get into this because, we're talking about testing. We're relying on tests by the government that say, yes, your water is okay to drink. And I know, based on some of your prior experiences, you think we should be somewhat, maybe not skeptical, but we should think about that.
Absolutely. Let me just say, I never thought the day would come I'd be serving on a panel with a big city mayor who was explaining the lead problem to the public and actually getting it right. So I'm kind of in shock here. But no, this issue of safe, I think the health department really nailed it. I believe that the corrosion control, the chemical treatment that's being used by the city of Milwaukee is good corrosion control. It's helping.
The phosphorus is
right,
what we're talking about?
It's the addition of a chemical to the water that helps keep the lead out of the water and on the pipe. But this is a Band-Aid. It's a necessary Band-Aid. And I was just at a panel at EPA 2 weeks ago where the foremost experts on the lead and copper rule in the United States and lead corrosion were there, and we were just candid with the fact that in cities with lead pipe, based on our monitoring data, whether it's Milwaukee, Chicago, Philadelphia, no one feels that water coming from a lead pipe will ever be safe by modern standards. The existing lead and copper rule, it's outdated. This is a 25-year-old rule. We've since learned that there is more and more harm from low levels of lead exposure, and that this is really kind of the ultimate environmental justice issue facing our poor urban communities. And so that's the reality. As long as we have those lead pipes, no one knowledgeable will ever say that water is safe unless it's passed through a filter designed to remove lead, no matter how good your corrosion control is.
Yes.
If I could add to that, when we talk too about the additives that go into the water in order to help prevent lead leaching, there's a side effect to that, if you will. And I'm sure a lot of you that have been paying attention to water issues around the state have heard about phosphorus loading into the waters, what happens as a result of that phosphorus loading. You end up with algae, blooms of algae, sometimes harmful algae, blue-green variety. And that's a side effect of that. So for everything that we add, there's obviously going to be an output somewhere else, and that's another challenge. And so he's absolutely right when he talks about this as a Band-Aid approach, and while it does work for the immediate, now we have to clean it up on the other end, if you will, and that's a big challenge for us as well, so something to keep in mind.
Yes,
if I can, again, the professor can correct me because inevitably I'm going to make a mistake here, but as I followed the Flint situation, I think it's because we mentioned the word Flint, I want to make sure that we are clear about some of the key differences. But it was actually back in 1993 when we had the cryptosporidium outbreak here in Milwaukee that led us to have some major changes. And we added, beginning in 1996, phosphate if I'm saying that correctly. And what that does, my understanding, again, a layman's understanding, is in those laterals, it creates essentially a film around in the interior of the pipe that helps the lead from breaking off in. Then we add that as it comes out of Lake Michigan, and then there's a process as it goes back into Lake Michigan, not to reduce it entirely, but to get some of it out. Where my eyebrows went up when I was following the Flint situation was when I saw that they were not adding phosphate to the water. And I thought, oh my gosh, they're not adding phosphate, which to me, from again a layman's perspective, was probably the most basic part of all this. So I think the people in our community should know that at least, and please, Professor, if I'm wrong, help us understand, was that was one of the critical issues in Flint, that they were not even adding that phosphate. That's something we've been doing here for 20 years.
Mr. Royal, you wanted to get in?
Yeah, and even with that Band-Aid approach, unfortunately, the lead levels in the children of Milwaukee are higher than the lead levels of the children in Flint. And then another thing the city has recommended in this age of conservation is that you run your pipes, as Mayor Barrett's wife, Motherwood, kicked in and did, for 2 to 3 minutes. So imagine 600,000 or 70,000 homes running their water for 2 to 3 minutes as a preventative measure to remedy this lead potential in their drinking water. That's a huge waste of portable water.
Well, again, if I can respond again, Carrie is here. She can correct me if I'm wrong on this one. Because, okay, how much is it going to cost us? And if you run your water 10 minutes before you drink it, it costs, Carrie, what's the number? 16 cents. So again, I just want us to have full disclosure as to what we're talking about here. We're talking about running it for 2 minutes, so you can do the math there, 3 cents.
Let me move from the Band-Aid to, I guess, the surgery that I think people at this table would agree may need to be performed to address these issues. So, Secretary Stepp, your department, as you articulated earlier, has set aside, I think, for distribution about $11.7 million. Is that correct? That's the number that's going to be used to help fix these aging pipes?
That was the initial package that we submitted, and then when we got oversubscribed to the requests, to the available funding, then we went back to EPA and we got permissions to add to that dollar figure. So I think it's just over $14 billion now.
How much?
Million. Yes.
How much of the?
Yeah. Well, I would have solved the problem right here.
How much of the problem, realistically, can that address?
Well, it's really just scratching the surface, really. I mean, I wish I had a rosier way to say that, but it really is.
And I guess from your perspective, is there any feeling within the state legislature or in other places where there are pots of money, albeit limited, but pots of money, where there could be additional funds for efforts that would replace the aging pipes?
Well, there aren't currently, and that's why we had to go to EPA, to the Federal Drinking Water Fund, in order to be able to get access to those dollars. But again, when I talked about that silver lining, now policymakers are paying attention to these things. Their constituents are demanding that real answers and real plans be put forward in order to how to solve this problem for the long term.
So, Mayor, how much of the work could be done with the amount that you're going to get from the state?
Oh, I would say several hundred homes. And again, we have thousands and thousands of homes. And I have to say this because I have to say it. When the state got the federal funds, and it was initially $11.8 million, the city's allocation was going to be 6.8% of that. And again, we've got close to 50% of the problem. We contacted the secretary. We contacted Congresswoman Moore. Congresswoman Moore was just great, just phenomenal in helping us on this. To the secretary's credit and to our department's credit, they said, okay, we'll cover the preschools, the daycare centers.
That's a priority.
So that's a priority. Yeah. And so we'll get that. For the schools, the public schools, none of our public schools in the city of Milwaukee have lead laterals. So we're covered there. There's a small number, I believe, of private schools, maybe less than a dozen that have lead laterals to them. But the public school system, it's not an issue with the public school system. But I think that there is a social justice issue. If, again, the initial figure was 6.8%, now it's going to be higher than that. How do you say to poor people in Milwaukee, well, you've gotten enough money now, and we're going to share it with other parts of the state? And if I lived in another part of the state, I'd be arguing for it as well, just so everybody's clear about that. But I think that when you see the concentrated poverty here, and the fact is, I was just at an infant mortality luncheon yesterday. Milwaukee, among major metropolitan areas in this nation, has the second highest concentration of poor people. 72% of this region's low-income people are in the city proper, and most of them probably live in this area. So whether it was government decisions or private decisions, individual decisions, this region has decided that it's going to concentrate the low-income people in a very small geographic area. I think that with that outcome, there has to be a recognition that you cannot expect them then just to get a smaller percentage than what the actual problem is.
So where does the money come from? If you're talking about a $500 to $700 million fix, where does the money come? You just mentioned infant mortality issues. Right. You're talking about more police officers. Where do we get the money?
Now you understand why I drink Bloody Marys for breakfast.
You and Rice Priebus.
So what it means is we are looking at different models, and we are aggressively looking for funding sources, whether it's at the federal level, whether it's the state level, whether it's some other level. And we even think that there's a potential that some other level would be able to help us with this. But again, to put this in perspective, and I don't want to grab the whole panel, Whitefish Bay has instituted a program and to have the property owners replace their share. And according to what I've been told is they have close to 100% compliance. Now, why do you have close to 100% compliance? I'm guessing that part of it is because you have families who live there, and their reaction is, well, of course we're going to make sure that we don't have lead in our laterals because we've got kids here. Juxtapose that with the number of absentee landlords that own property in the heart of the central city. If it's a voluntary program, how many of those absentee landlords are going to say, okay, I am going to replace the lead lateral that's on the private side? That, to me, is an incredibly important issue on that. So I believe we are going to have to mandate this. We are going to have to find a way to fund this. And this is where I'll get criticized by Fred and others that we're not doing it fast enough. But the fact of the matter is, even if it's a Band-Aid, we have to recognize that a lot of the people who are going to be asked to pay for this are going to be people who are low-income people as well. That's right. The real-world issue that we face.
So, yeah, I think everybody should have some kind of shared costs in this, and that's the NAACP, not FLAC. But here's a solution, potentially. MMSD is asking for $240 million increase for capital expenditures. Costs $2 per person, right? Across their district to get $248 million. So why not add that type of funding at MMSD? If we can say that it's so important for Waukesha to have water without radon, how come Milwaukee County can't have water without lead?
I'm happy to respond to that. If you can get MMSD to get the Public Service Commission to approve that, we can have that conversation.
Let's put it to a referendum.
But a referendum, we're not talking about a referendum. We're talking about the state government that has not been particularly sympathetic to us on these issues. Again, I have to deal with the real world. And the real world is, our first conversation was, can we put this on the water bill? Can we spread this on the water bill? What we've been told is the Public Service Commission will not permit that. So we have to find a way, not on the water bill, to do this. And I can't say for certainty, but I got to believe that MMSD would have the same type issue. I don't know that for certain. But obviously, if we could find a way to do that, that would be something that would be attractive to me. I don't know that we can do that.
Secretary Stepp, I want to have you respond to something the mayor said. He was saying that proportionately, he was hoping that more of the money that you're distributing would go to the city of Milwaukee. Can you address that, please? And the decision about how it was distributed the way it was distributed.
Well, one of the requirements of the program that we got approval from EPA was we had to define certain guidelines that communities would fall into. And of course, that had a lot to do with income and different factors. And there are lots of areas of Wisconsin outside of Milwaukee that are suffering from these same challenges. So we had to do the best we could, a balance test, understanding that the highest concentration of need is in Milwaukee, but certainly knowing we can't even begin to solve, 1/4 of the problem with the money that we had available. So we needed to be as fair as we could, and we did definitely prioritize Milwaukee, and I appreciate the governor's support on that. I actually didn't have a conversation with Congresswoman Moore, but I know there were some other legislators. Senator Ron Johnson was one of them, in fact, that had called and said, is there something that we can do better for Milwaukee? And again, it's just the balance test, frankly. Milwaukee also has been receiving other portions of funding from the same pot of money, if you will, for different projects that they have been doing. So we've been very supportive of Milwaukee. Wisconsin DNR, way before I came in to this role, has been very helpful to Milwaukee as well. So it's not, again, it's just the balance test. I hear from people who live in Ashland who are suffering from these same challenges. There's Beloit, there's Kenosha, there's Janesville, there's Racine. There's communities all over the state that are suffering. And the challenge is, how can we do the most amount of good around the whole state with this one-time shot of money that we've got access to? They're really tough decisions.
And it would be mayoral malpractice if I didn't say.
You want more?
Well, no.
Yes, it would.
Look, it would be mayoral malpractice for me not to point out that, again, having close to 50% of the problem, having 10% of the funds, I understand political realities. But is it fair to the low-income people who live in the city of Milwaukee if this course would mean that it takes us 50 years to solve the problem here, and it takes 5 years to solve it in another community?
Well, again, I mean, and and you're absolutely right, and that's why I appreciate your position, Mayor, because that is your responsibility, is to speak loudly on behalf of your constituents. And of course, from our perspective, it's how do we solve a very gigantic problem that's in front of us that is across our state. And it's a very, very difficult thing to be able to do. And that's why this is a great first step. We really worked hard. I really want to give a public acknowledgement of our staff and our drinking water loan fund programs, our community assistance programs, who really dug deep and really just, I said, think outside the box, as big as you can imagine. What's the biggest thing that we could do right now today to make a difference in homes today? And this was a great opportunity for us to do that. And, hopefully we'll be able to see some of those results across the state as well as in Milwaukee here.
Yeah. I just wanted to comment that make sure everyone knows how high the stakes are here. This idea of half pipe replacement. So realize this lead service line that connects the water main to the house crosses the property line. And across the United States, what utilities are doing is actually charging their ratepayers money to replace their part of the lead service line. And we have known for 35 years that this half pipe replacement not only increases lead in the short term because you're disturbing a hazardous material, just like we don't go into a home and stir up lead paint and let people breathe it, but also in some waters, and I'm not sure if Milwaukee is one of those, but the lead release actually gets worse with time because the copper pipe that's oftentimes put in front of the lead pipe chemically enhances the corrosion of the lead that is left. So realize the situation here. You're charging your ratepayer about $4,000 to replace the city-owned part of the lead pipe. And in many cities, you're actually making the lead problem in water worse for the customers, not only in the short term, but the long term. And this was done in Washington, D.C. They spent $110 million and actually increased the likelihood of childhood lead poisoning in those homes by a factor of 2. And the EPA and the city wrote falsified report after falsified report claiming that the water was better after they did this half replacement, and we exposed that as a complete lie, and it took a CDC report to show ultimately, under pressure from Congress, that we were paying money to poison children. This is one of the most unethical, outrageous engineering science fiascos I've ever even heard of. And why do we do it? It's a solution only a lawyer could love. Why do we do it? It's so the city can say, your child might have been poisoned, but it wasn't our lead. We got our lead out. No disrespect to the lawyers here, but the lawyers really, really love this, okay?
We're in a lawsuit.
Okay, right. And so, you know, the stakes are so high. When people in Providence, Rhode Island found out that this was going on, I mean, they actually engaged in civil disobedience to stop this from occurring, and they eventually caused a consent order between the city and the EPA to not spend money to do stupid things. And I can't tell you how refreshing it is for me to see the city of Milwaukee take a stand here and say, no, if we're going to do it, we're going to do it right. It might take us longer, but we will not leave these half pipes in the ground where they will poison children for generations to come, because it's going to take that long before the homeowner themselves actually can get the money, realize the danger, and get that other part of the lead pipe out.
So Washington was stupid, in your words, in the way that it said it was addressing the problem. But let me talk about something that probably was not stupid. If you look at what happened in Madison, Wisconsin. So Madison had lead laterals, about 6,000 of them, and starting in 2001, they began to replace them. It took a decade to do, but what I'm wondering is, are there lessons to be learned from Madison, or because of Madison's demographics and economics, is it a different situation? Anybody can jump into this.
Well, let me just first say that one of the major reasons that Madison went the right path was because it was clearly in their financial interest to do so. If they did not remove those lead pipes completely, they would have had to do more expensive corrosion control. They would have had to add the phosphate to the water. It would have been more work over perpetuity to do the Band-Aid approach. And so because they had fewer lead pipes, and you just do the math, it was in their financial interest to do the right thing, and we have to make it in the financial interest of every city to do the right thing.
Mayor?
Well, the professor nailed it there. In Milwaukee, 44% of the homes have the copper laterals. In Madison, the number was 14%. Because of the geography of Madison, you've got the two lakes right there, Lake Mendota and Lake Monona. Adding the phosphate and then to having a process at the end to remove the phosphate, or at least to significantly reduce the phosphate in it, was very, very expensive. So it was a financial decision that made sense. So I would love to be in that situation. Lansing is another one city that's taken the steps. There, they've got 24% of their homes have lead laterals. So again, we have an older housing stock here. And I'm not using that as an excuse. I just want our community to know the scope of the issue and how long it would take us. So
how long would it take us?
Well, we don't know. We don't know right now. We're going to be as aggressive as we can. We have to be mindful of how we allocate the costs. How much do we require the homeowner to pay? Again, we will cover the lateral portion that's the public portion. By law, we're required to do that, and we're going to do that. The private portion, is there a cost share? For example, I think in Whitefish Bay, what they do is they, in essence, allow you to amortize it over X number of years. Now, again, if you're a homeowner, that's something you're interested in. If you're an absentee landlord, I think you're going to have to be required to do that. Otherwise, it's not in your financial interest to do it. And those are the homes where we have a lot of young kids. So we are, again, we've been working up different models. In our budget, we will have a proposal that will lay out an option to do this. But we're trying to see, with the capacity, the incomes in the city, knowing that there are at least presently limited federal dollars and state dollars, we have to find a way that we can do it. And again, I'm not going to lie that it's a Band-Aid, but I'd rather have a Band-Aid than having it bleed.
Fred Royal.
So Couple observations. If we're talking about whether it's economically feasible to save our children, for one thing, then the other observation is that the city, state, and the county could get in a room and figure out how to pay for a $500 million sports arena. But you can't get in the room to figure out how to replace 70,000 laterals. That should be criminal, in my opinion. And you've had over, if this was something that started having discussion in Madison in 2001, you had since 2001 to have some discussions on how much this would cost and how long it would take to get it done, and it hasn't been done yet. That's criminal. A issue with this magnitude, and you haven't placed it as a high priority of poisoning our children, that's criminal.
If I couldn't agree more. The challenge really has just been that there's never been light shown on it, that there's always been an issue du jour or something else that was distracting to policymakers. Water infrastructure is not sexy. And, you know, I mean, it's not interesting to engage with people when you're doing doors in an election season. Most people's eyes glaze over because, again, the average citizen thinks, what do you mean there's something wrong with my water? I turn on my tap and I don't taste anything different, and you know, everything seems fine. So until the Flint, Michigan discoveries, there wasn't anyone talking about it. I will tell you, in Wisconsin, I can at least speak to specifically in our state, it is something that we're talking about, and it's not just public drinking water supplies, it's private wells also. But we've got water challenges all over the country, but I can tell you, at least here, this administration has definitely placed this as a top priority. And I'm very encouraged to see legislators from across the state that are interested as well. I saw Senator Lena Taylor here as well, and I was remiss in not Thank you. I was remiss in not thanking her for reaching out to me very early when we first came out with the initial plan of how to disperse the funds and what portion Milwaukee was going to get and how we were, you know, using that measuring stick to decide who gets what. And Senator Taylor was very, very charitable with her time, very informative to our staff on where she thought we could make the most difference. And I just want to give my appreciation to her for her involvement in that. Thank you, Senator.
If I can, two things to respond to both the previous speakers. Fred mentioned 2001. You know, one of the things that you hear about politicians is they're total hypocrites. Let's get real here. In 2001, my youngest daughter was 2 years old. The next daughter was 4 years old. I was not involved in a conspiracy against my wife and my children. We have to be honest about this. No one knew the scope of the problem then. And where I would well, again, if I knew it, do you think I would have been poisoning my own children? Let's be real. Of course I wouldn't be. Let's fast forward, though, because I do want to differentiate us again from Flint. We were doing our testing before Flint broke. That's when we started doing it. So it was Kerry Lewis, who's on some hoity-toity board at the national level, that came back to me and said, we got to look at this. And that was essentially months before the Flint story broke.
I'm going to give Professor Edwards a final word on this panel, and then we'll take questions from the audience.
Well, let me just affirm that it was, this will be part of my presentation at lunch, that it's essentially, incredible as it may seem, official U.S. government policy, U.S. EPA, Centers for Disease Control, that lead in water does not matter. And that was the message that was being sent all the way up until 2014, and I will elaborate on that at lunch. There were actually people testifying under oath in 2004, you could drink all the lead in water that you want as a child and you will just pee it out.
The cigarette industry said that nicotine wasn't addictive either. Or the tobacco industry.
Let me take some questions from the audience, and here's the way this will work. If you're in the seating bowl, you will see these little microphones in front of you. You have to keep your finger down, not on the top, no, on the rim, and keep your finger on the rim so everybody in the room can hear you. If you're in the back, we'd like you to wait for Ryan, who's over in the blue shirt with the microphone, so we can hear your questions. I have only one request. No speeches, please. Let's take as many questions as we can from the audience. So we'll begin. I'm going to work across the room. We'll start here, we'll go back there, and we'll work down. Yes, and wait for Ryan and the microphone, please.
Hi there. So my question perhaps is for the professor. What is the status of development of lead testing kits? Statistics mean one thing, but everybody wants to know what's the water like in their house in terms of technology development, availability, market availability.
Okay. So I might surprise you by first just acknowledging from the individual homeowner perspective that in some ways testing is a waste of time. Here is why. The nature of this lead release from lead pipe is almost random. Imagine you have this lead pipe and it's lined with lead rust, and sometimes chunks of that lead rust fall off into your water, sometimes they do not. You can go to a house where a child has been lead poisoned by high lead in water, and in some cases, you can collect 50 samples. 49 of those look fine. You're under the EPA standard. One sample, 1 out of 50, might have enough lead in it so that if a child drank a single glass of that water, they're getting an equivalent dose of ingesting 11 lead paint chips in 1 glass of water. Now, so you understand the situation. That means, how do I test to detect this problem when it's this pieces of lead that may or may not fall off? The answer is you cannot. You cannot do it. So we have to, and this is why there's this consensus emerging, that as long as that lead pipe is there, no one should ever consider that water as safe, just as in the case of lead paint in the homes. As long as that lead paint is there, the hazard is in the homes, and if it cracks and if it falls off and your child gets into it, they are going to have elevated blood lead as a result. So, too, is the problem with lead in water. Now, that said, we have to do a lot better of testing lead in water during this Band-Aid time period, which, by the way, we're going to be dealing with these lead pipes, even most optimistically, for 20, 30, 40 years to come. I mean, it's going to take that long for us to replace some of these lead pipes. And so we have to do a better job of detecting those hazards. Unfortunately, the testing protocols that the EPA and many states have developed over the years have explicit instructions in them so that you will almost never detect the hazard. For example, sampling the water at a low flow rate minimizes the chance that you will ever get a chunk of lead coming off. And these are all parts of the ways that we've fooled ourselves that this problem has been under control and that the water is safe when it's not. Okay. Endpoint filtration, as long as it's an NSF 53 certified filter for lead, these are devices you screw onto the end of your faucet. They are very, very effective at eliminating this problem. In Flint, EPA tested hundreds of homes with the worst case lead in Flint. And these are homes where chunks of lead are coming off at hazardous waste levels, 10,000, 15,000 parts per billion. Never once did lead get through these filters. So we have solutions. Flushing can reduce the risk, but it will not eliminate it. These filters will definitely eliminate the risk for the small portion of water that you are using for cooking or drinking. So that's one of the things that's so maddening as a professor engineer working on this. People saying, oh, it's so expensive, it's so hard. If we can just get a filter on the tap of every one of these homes, people have an easy way to produce water that's safe for cooking and drinking, and eliminate this risk completely if those filters are used. It's $30. You do have to maintain them. It's not perfect. The other alternative is bottled water, but we do have ways of coping with this problem.
Let me go right there, yes.
This question is for Secretary Stepp primarily. You were asked before whether there were pots of money available at the state to deal with the lead problem, and you said you had gotten a grant from EPA, and that's well and good, but in the past couple of years there have been attempts and successful attempts to cut the DNR's budget and to narrow the scope of the DNR's legal authority to deal with these kinds of problems. So what do you think, or do you plan for the DNR to do in the upcoming legislative session and budget cycle to enable the department to advocate for itself, advocate for the public, and deal with these problems?
Well, my job is to try to come up with different funding sources, different ideas for funding sources in order to be able to address these problems. In fact, the filter idea is one of those that we're working out now at the state level. And so we're in discussions now with the governor's office about, what can we do today to help save families today in the meanwhile until we do these longer term infrastructure projects. So the cuts to our budget haven't affected that part of our department. So I feel very confident and very optimistic that conversations like these, again, are raising that awareness for policymakers across the state, where I think we'll be able to get pretty good support for that.
One more quick question on this side of the room, and then we'll finish up. Yes, Robert.
My question is for Mayor Barrett. Mayor Barrett, your administration, Milwaukee Water Works, raised our rates back in 2013, 2014 to almost 10%. One of the reasons why the raise of the rates was so that you can proceed with your water main project to remove the mains from the streets. We now know that you suspended it because of the fact that as you're removing the mains, you are disturbing the laterals in the neighborhood. But in the meantime, we find out also that your administration receives $12 million annually from the Milwaukee Water Works, and you place that money in your general fund. Is that money not able to support and work with removing the water laterals from the homes?
Let me just clarify. When we said we suspended it, what we suspended is replacement of mains when there are lead laterals. We have not suspended the program. In other words, we're continuing with the program because we have a lot of areas. Again, if it's 40% of the city is lead laterals, that means by math 60% is copper laterals. We've continued to do the work there. We also have continued to do the emergency repairs. That is a place, just so everybody is clear here, that we may still do partial replacements. If it's an emergency break, we may still do a partial replacement. Like other institutions, there are pilots or payments in lieu of taxes that go to the city. That goes into the general fund, and that money will be used for all city purposes. In other words, it can be used for police, it can be used for fire, it can be used for libraries, it can be used for infrastructure costs. So potentially, as we move forward, if there is going to be money coming directly from the city tax coffers, all money is fungible, so you could argue that that is used for that, or you could argue property taxes are used for that. You could make either argument.
Let me take a question from the middle of the room here.
Well, my question wasn't answered. I asked if we're going to use some of that money for the land.
Again, for all payments in lieu of taxes, the way the city financing works, and you can check with the comptroller, it goes into the general fund. It's not designated.
Okay. Let me go back up here. Yes, Magna.
Good morning, Magda Pack, bringing a public health perspective. If you could extend the supply chain a little bit, you've talked a lot about the source of water, and Mr. Royal, you've talked about children, but I don't hear a lot of talking about the people and who's affected and how to test and monitor and abate. So I was wondering if you could continue this conversation about infrastructure to the public health infrastructure, about who's testing children, who's at risk, what are the outcomes we're most worried about, and I'm just stunned that there's no one from a health perspective on your panel. So I would just encourage you to continue that line over there to say, okay, water comes out, it comes out, we're drinking it, then what, so what? Because the headline, poison children, doesn't make it. So what is our infrastructure around testing children, testing pregnant women? What is the impact on educational outcomes, on criminal justice outcomes, and the larger issue about the major inequities, because we haven't also talked about the racial disparities around lead. Could you address any of that, please?
Yeah, well, as I stated earlier, 10% of our children have been tested with lead in their systems. And we know that there are studies that link lead to violence. So as we talk about the increase in violence, August had the highest rate of violence in the city of Milwaukee. That should have some conversation around the need to replace these lead laterals, but it doesn't. The only thing we hear is hiring more police officers to occupy a certain zip code.
Mayor,
let me just also interject that the public health community, frankly, has been the problem here in identifying this problem. When I was in the U.S. Centers for Disease Control, published a report in 2004 after the Washington, D.C. lead crisis. Now, keep this in mind. What happened in Washington, D.C. was 30 times worse in terms of the extent of lead exposure than what happened in Flint, Michigan. The U.S. Centers for Disease Control came to town, wrote a falsified report that said lead in water did not hurt a single man, woman, and child in Washington, D.C. There was no harm from this exposure. And we had to fight the U.S. Centers for Disease Control lead poisoning prevention branch tooth and nail to expose this. And the public health community in this country has not been complicit in this problem. They have been the problem.
If I may, this is a graph of the city of Milwaukee elevated blood lead prevalence rate for children under 6 years of age. This is at 5, this is at 10, so this is a higher standard. Go back to 2004 when I came in. Here's the graph right there. From about over 30% to 10%. Do I want that number to be at 0? Of course I do. Has there been significant progress in reducing the blood level for children in this city? Absolutely yes.
Well, that focuses on lead paint. That doesn't
blood
focus
lead
on
prevalence
lead water.
rate. Blood lead prevalence rate.
okay, just
Let me just say, I mean, society has done wonderful things to help reduce lead exposure. So we banned lead in paint, lead in gasoline, lead in plumbing, lead in food. And if we did nothing at all, lead levels are going to come down, and they are coming down nationally. Could we do better? Absolutely. There's no doubt about that.
just a quick, you can respond, but make it brief, please. You don't have a question? Okay, that's fine.
I have another graph here that shows that in the white zip codes, there's very low amount of children with 6 and under, as your chart saying, with lead. In the Hispanic, it's higher, and in the African American community, it's high. In fact, the 53206, one of our most distressed neighborhoods, it's 19.9, according to your public health commissioner. That's 4 times as much as Flint, 4.9 to 19.9. So my question is, when we visit the water commissioner, she said about the $12 million that's going to the general fund. We asked her, why can't that go to the lead pipe replacement, which the city hasn't invested, to my knowledge, anything into it. Hundreds of millions go downtown, 0 goes to that area. And she said that it was a matter of policy of you and the Common Council to where that money goes in the general fund. Mm-hmm. And I'm asking you as mayor to start, I know it's not enough to do the whole problem, but start, make a commitment today as a policymaker to commit that $12 million to lead pipe replacement in areas like I just said that our children are dying and are toxic poisoning. Will you make the commitment today?
The commitment I'll make is that we will come up with a plan that over a number of years we will replace these. We are going to try to find any funding source that we can.
But the $12 million,
I'm going to say that we will look for other sources of funds first. Okay.
Let me take one final question. Yes, and right there, blue shirt.
I wonder if the city and state would consider a class action lawsuit to require absentee landlords to remove the nuisance of the lead laterals in their properties.
Do you know a good lawyer? We can chat. We can chat.
I guess we have time for one other question. Let me go down here, yeah. And on the rim, not on the ball, but on the rim. No, right behind her, right there, in the green. No, in the green.
I've got this working, but I'll talk loudly. Okay, if I understood the professor correctly, it sounds like filters work. They only cost $30. I don't see why we are not publicizing that or jumping on that as a solution. Any comments along that line?
Yeah, I mean, if you look at the cost of replacing the lead pipe, let's just say it's $6,000, and you say, how long could I buy filters for people? And, you know, they have to, I mean, it's not fail-proof because they have to be able to install them on their faucet, know how to use them. But these are, you know, this is quite simple. They are working. They are 100% effective when used properly and maintained. And if we didn't have such a simple and low-cost option, I would buy into these, economic arguments a little bit more careful. Obviously, the long-term solution, the lead pipe has to come out. But as long as you have that filter there, families can be 100% protected. They can get water for cooking and drinking that is safe. And realize you're just filtering the small volume of water that you need. It's not an issue in terms of exposure in showers or washing dishes. That is the problem.
Would you say it's true for babies? I don't know the answer to this question. What about for babies?
Oh, yes. No, these filters they remove the lead. That's what they do. They're designed to do, and they work very, very effectively.
And if you have an astute population of individuals who utilize those filters and will change them as they frequently needed to be changed and will use their money to purchase them in a city that has 23% poverty and often don't even invest in free fire alarms. So you're putting the onus on a community, and this is a systemic governmental issue that required these lead laterals to be installed. It should be a systemic governmental remedy to get these lead laterals out of our communities.
I would agree, just that let's realize, even if the money was available tomorrow and a program was started, it would still take years to replace these lead pipes, and we need to do something in the meantime.
I'm going to have to wrap things up there. Appreciate the passion in the room today, but also want to say thank you to our panelists, Fred Royal, Kathy Stepp, Mayor Barrett, Mark Edwards. Thank you very much. Appreciate it.
Great job.
The next panel can please stay in the room since we're going to take a break at 10:45. Not now. We're going to begin the next panel immediately. Thank you.
Our next panel relates to groundwater supply. Unsustainable use. Excuse me, please. Could I have your attention? Okay. Thank you.
Hi, Jill Barron. Nice to meet you.
We certainly appreciate the passion around our first panel and understand its importance, but we do need to move on in our schedule. Our next panel relates to groundwater supply. Unsustainable use of groundwater continues to be an important concern at the state, national, and international levels. In fact, new satellite data show that a majority of the world's largest aquifers are actually declining. And here in Wisconsin, testing has shown that groundwater in various parts of the state is contaminated with arsenic, radium, and other contaminants. This session will explore these developments and potential engineering strategies to address them. It will also address public activists and related processes that contribute to policy change in the face of environmental threats, with specific reference to Kewaunee County, Wisconsin. So to lead this discussion, I'm pleased to introduce Dee Hall, who is the managing editor and co-founder of the Wisconsin Center for Investigative Journalism. During her distinguished career in journalism, Dee has won more than 36 local, state, and national awards for her work. And the Center for Investigative Journalism has recently turned its focus to a variety of investigations related to water, making her a particularly appropriate choice to lead this panel. So Dee, welcome. I'll turn things over to you to introduce our panelists.
All right, thank you. Hello, everyone. That was an exciting first panel. I don't know if you guys are up for to keep the excitement going. So yeah, I am the managing editor at the Investigative Center. We have for quite a few years done stories about the quality of our surface water, our groundwater, and most recently our series called Failure at the Faucet, in which we looked at the quality of drinking water around the state. We did do a big two-part package back earlier this year about the dangers that were laid out in this earlier panel. But even before that, years earlier, we did a lot of work around the drawdown of groundwater in the Central Sands, and we've been focused on all kinds of water issues. So what I'm going to do first of all is have each of our panelists introduce him and herself and talk about the work that they have done around groundwater, and then we will get into some more specifics. So we're going to start here on your right. We have George Kraft. George, just tell us a little bit about your resume, and then later we'll get into the deeper issues.
Very good. George Kraft, I'm a professor of water resources with UW Stevens Point and UW Extension. My work is mostly in the public realm, doing outreach-related stuff in terms of groundwater sustainability. Largely in the past, this has been with quality issues like nitrate and pesticides in groundwater. And for the last 11 years, I've been grinding away on this groundwater quantity issue, the idea that when we pump groundwater to use for some kind of human use, it may not be there for other things like keeping streams flowing and lakes wet.
All right, thanks. And Brooke Mayer?
Sure. So my name is Brooke Mayer. I'm an assistant professor here at Marquette University in the Department of Civil Construction and Environmental Engineering. All of my work that I do and my research interests relate to thinking about drinking water quality and how we can treat it. So I've done work on kind of both ends of the spectrum, thinking about after we use the water, after it goes through our systems, specifically things like phosphorus and nitrogen and how we can remove them, but also recover them and reuse them. But then also on the drinking water side, thinking about particularly pathogens and a lot of work with viruses and how we can make sure our drinking water is safe from a microbiological standpoint.
All right. We have Jill Beeren.
I'm Jill Beeren. I am an assistant professor in the School of Education here at Marquette. I study communities that are under environmental threat and how those communities come to understand and come to terms with sort of the science side of those threats. So I work with public understanding of science and then environmental policy sides of those issues. And so previously, I actually was connected to the previous panel studying a community in the lead belt of Missouri that had a severe lead contamination problem, but more in their air and soil than in their water at the time. And now I'm transitioning into communities with water challenges, beginning with Kewaunee County in northeastern Wisconsin.
And I wanted to start with George here because George has the longest history of taking a look at the groundwater in Wisconsin. And I wanted to ask him, just give us an overview, if you would, about groundwater quality and quantity issues that we're facing right now in Wisconsin.
Very good. One thing I'm curious about, my panelists and I discussed in preparation, how many people here may not be comfortable with this groundwater thing in terms of knowing what it is and that sort of thing? Or is everybody here an expert?
They're all experts, I can tell.
Okay, let's do a little bit of bare bones groundwater stuff here. So groundwater is the water below the surface of the earth that inhabits the pore spaces between sand grains or the cracks in the rock. And this water can flow kind of freely under the influence of well pumping. And beer companies, and God love us, we're in a beer city here, but they haven't done us a great service when it comes to understanding groundwater. You know, we think all the way from Canada when the earth is pure and all that sort of thing. So where does groundwater come from? Local precipitation. So we get about 32 inches of rain a year in Wisconsin, depending where we're at. A couple inches runs off directly into lakes and streams. The rest of it soaks into the ground, right? What happens to it then? Well, the lion's share of it is taken up by plant roots and put back up into the atmosphere. About 20 inches or so goes that way. And if you've been doing the math here, we got about 10 inches here unaccounted for. That seeps through the soils, gets to what we call aquifers. An aquifer is just a kind of a rock or sandy deposit that can transmit water, and there it is. But it doesn't just sit there. It moves, okay? Otherwise, we'd be up to our eyeballs in it pretty quick. And groundwater's total purpose in life, once it's in an aquifer, is to get the heck out. So it's angling to try to get to the nearest stream and discharge, or in the case of having a Great Lake right behind us there, it's trying to get to Lake Michigan and get the heck out. Along the way, if it hits a depression, well, by golly, that is a seepage lake that's being fed by groundwater here. So in Wisconsin, when we're looking at lakes and streams, most of the time when we see that, we ought to be thinking groundwater, and we ought to be thinking about groundwater and surface water being a single resource. Now, in terms of groundwater issues, let's talk about this. We have quality kind of issues, and we have quantity kind of issues. Quality issues, and by the way, the taxonomy is imperfect here, so bear with me. But in terms of the quality issues, we have some naturally occurring problems. And by and large, Wisconsin groundwater naturally is pretty darn good if you contrast us with western states where often it's saline or has other issues here. And sure, we have some places where we have naturally occurring arsenic in groundwater, or naturally occurring uranium, or in the case of Waukesha, naturally occurring radium that's causing us issues. But pretty much the natural quality isn't too bad. But then we have human pollutants that get into groundwater, and dominantly we're talking about nitrate from agriculture, pesticides, residues from agriculture, pathogens, where I have people a lot more expertise going to talk about that shortly, and a whole set of issues that I don't know how to put it a better way except saying it's chunks. And this is where we have cow manure and the like, going right down sinkholes, and the tap water in some people's houses smells like a barnyard, and we do have that in some locales. Moving just briefly to the quantity issue here. So what we're concerned about is when we pump groundwater, we're taking water away from something else that it was doing. My neck of the woods in the central sands of Wisconsin, what that water is doing naturally, it's filling lakes and it's discharging stream and maintaining fish and trout. And oh, by the way, tourism economies and that sort of stuff. But there we're pumping water out of the ground at a rate where we're drying lakes and drying streams. And, we have a lot of denial about the issues, either among the pumping community, but also with our policymakers here. So that's kind of the long and short of where we are with that. Right now, our state is in a mood to further relax any restrictions on groundwater pumping. We'll see where this goes.
Do you want to, just to follow up on that, the Central Sands issue, can you paint us a picture, just describe what it's like in some of the areas where you've studied? What did they used to be like, and what are they like now?
Very well. So the Central Sands, we're talking Portage, Adams County, so Stevens Point, Adams County, Waushara County, and a few others around there. We've had tremendous development of the groundwater resource for irrigation over the past bunch of decades. It was warned already in the 1960s that if you don't manage this, we're going to have deleterious consequences here. So it's always the case, you pump a little bit of groundwater and you're not going to have much harm. Does anybody care if they're missing this much of the lake they like to recreate at? Well, probably not. But you pump a lot of groundwater, now you got a big problem. And people get kind of ticked off when their lake is this much lower or where it dries up completely. So we've had situations where places that people used to water ski, rent cottages, fish, all those kinds of things. These lakes are dry or turned into shallow marshes. We have headwater streams that we're at a Catholic institution, so I can say God's most beautiful creature, which is the brook trout, inhabit, and these things are drying up, and the fish populations are disappearing. So this is where we're going. We have some dozens of lakes that are most people I think would say substantially are impacted, and miles and miles of headwater streams that are the same. And we're kind of, our groundwater pumping continues to grow. We got a third of the high capacity wells of the state in this region, about a third of the groundwater pumping. And if you're feeling secure about where your little place in Wisconsin, its lakes and streams. So we're starting to stamp these central sand sorts of land uses around other parts of the state as well.
And we'll follow up a little later talking about the sort of the current controversies in groundwater withdrawal. But I'm just wondering if Jill could talk a little bit about the problems in Kewaunee County that she has encountered and how residents are responding to that.
Yes, I can. Dr. Lovell suggested, and previous speakers have suggested, that we typically in the United States take our quality of water at our tap for granted, but I would say that it would be a very unfair statement to make about Kewaunee County, Wisconsin. Particularly for those who are on private well water, a third of the wells since December of 2015 have been shown to be contaminated with various bacteria or nitrates. And the problem seems to stem to, and to be fair, I'm speaking off of talking to resident activists primarily to this point in my research. So I'm reporting to you what's been reported to me by resident activists and not necessarily a global perspective on what's going on up there at this point in my research. So Kewaunee County is home to approximately 20,500 people and between 70 and 100,000 cows. So if you take that into perspective, that's 3.5 cows per person in that area, and it's not a huge county. If you don't know where Kewaunee County is, it's the county on the peninsula leading to Door County, so the little peninsula that sticks up between Green Bay and Lake Michigan. So each of those cows produces about 120 pounds of wet manure a day approximately, and so that would be between 20 to 40 humans waste, right? So it's a lot of waste. And then you think about that waste isn't treated by the municipal sewer systems, but rather spread on fields all around the county. And those fields, what's become really evident lately is that that county is on a karst bedrock system, which is just a really porous system with very shallow soils on top. So they could be spreading manure, liquid manure, tons and tons of it, on maybe a foot of soil that goes straight into rock that goes straight into their aquifer. Does that make sense? So you can see why it presents a problem. Now, there's some debate as to whether this is what the activists tell me. It's not necessarily it's not necessarily the perspective of the farmer, right? But essentially, general consensus is that there's some real problems with this much manure spreading on a karst system.
Can you talk about, there's also another contributing factor, I think, up in that area, and that has to do with failing septic systems. Is that a concern that you've heard from folks up there?
So what I hear is that their septic systems have been checked and rechecked and rechecked and rechecked, and they have the most trustworthy septic systems of any county in the state. However, the same bedrock problem that allows manure to sink into their groundwater could potentially cause septic systems not to work like they're supposed to, because those also are spreading waste and filtering it through soil.
And if you know, what are the resources available for individuals if it turns out that their well is contaminated with coliform or nitrate?
So a few issues emerge from that question. One is a lot of residents don't want to get their wells tested because they are under the impression that the DNR will force them to replace their well at their own expense, which is a very, you talk about replacing a water main at $6,000, that's nothing compared to what they're looking at with replacing their well. So many people just exist on bottled water. That I talk to. So if I go into a home and they offer me something to drink, it's almost never water. And if I ask for water, they're kind of really surprised. So your question was what can they do? The DNR does have some testing and they will come and test, and there is a source of water at one high school in one side of the county that's been provided by the superintendent of that school, where they can go truck potable water into their home, or else they can buy water like you can down the street.
What has this question of, drinking water pollution done politically, socially in this area? What are the implications of that you see?
Well, there's two sides to every story. So every time you go into an a community under environmental threat, people take those sides, right? And so there's disagreement among people, but it's a very friendly community, and they tend to take those sides in a way where, we can duke it out at a meeting and still have coffee afterwards. So I don't want to give you the impression that these factions are at war up there. There are some political ramifications. Some of the activists are running for council and for state level office to try and sort of influence some of this away from sort of what they consider a free-for-all in terms of ag regulation up there.
If we can switch gears and have Brooke talk a little bit about the work that she has done and what she's discovered about quality issues in groundwater in Wisconsin.
Sure. So I'll start off, I think, with going back to the point that George made about we tend to divide water into these categories and talk about groundwater as if it's separate from surface water, and that's whole separate from wastewater. But in fact, we know that all the water is making a one big cycle, right? So it's all connected somehow, even though we'll kind of keep these up as we talk about them. But that means that things that are happening at the surface, whether it's human pollution or agriculture that Jill's talking about, or industry, those things go into the water, whether it's chemical or microbiological, and then they're going to go through the whole system. So they might filter down into the aquifer, they might go down through empty wells that we've used up. So they're all going to be linked up, and we tend to talk about groundwater as being much higher quality in general than getting from surface water. And so if we look across the U.S., I think about 2/3 of public water systems get their water from surface water. About 1/3 of it comes from groundwater, roughly. And so when we look at the regulations that apply to those two different systems, they're very different, whether you have a surface influent system or a groundwater. So if it's all groundwater, it falls under the groundwater rule, which was put into place, I think, in 2006. And it attempted to, first and foremost, look at microbes. And so, Dee, you mentioned coliforms. And when you think about microbes in the environment and what you're drinking, there could be things like bacteria, or here in Milwaukee, we're pretty familiar with Cryptosporidium from 1983, our outbreak. And then another major class that we have are viruses. And so these are kind of the big things that we think about. Most of the time, if you drink it, it could be a low infectious dose. Maybe if you get exposed to one organism or 10, maybe it's hundreds, it depends what it is. But a lot of them cause disruption with your gastrointestinal system. So it's a problem for a week or two, but they may not go past that, whereas some things then can go much, much further and even cause fatalities eventually. But when you think about how it's regulated, most of the microbes are really tough to detect and to quantify. And so a lot of the regulations are based on these coliform bacteria. And coliforms are used as indicators, so they're not necessarily going to be human pathogens and make us sick, but they're good indicators of some sort of contamination of your water system. So we'll actually measure these bacteria, but we won't necessarily go to the extent of looking at Cryptosporidium in usual circumstances. Or in my case, I work a lot on viruses. We almost never measure viruses directly in a treatment system, and the reason for that is they're very hard to detect. So if you think about the size of a virus, it's somewhere on the order of 100 times smaller diameter than a human hair. So very, very small, and you can imagine if this gets into your water, it can actually filter down through what we think of as a good protective layer with the sand and the soil and everything else. So these things can actually go tens of meters down into an aquifer, and then they can travel with the groundwater flow for tens, hundreds, maybe even in some cases thousands of meters down if you think about the aquifer flow. So they have a lot of transportability, they survive for a long time, but they're tough to measure. And so if you think about a bacteria, this coliform that we've been talking about, it's maybe 100 times larger than a virus. And so it's going to have a lot different behavior if you think about it in a groundwater system. It might get stuck on the soil, it might attach to something, whereas a virus might continue on through. And so from that perspective and setting it up, viruses tend to be kind of one of the bigger issues when we think about groundwater. And a lot of systems, if we think about a private system, if you have a well, you might not have any treatment on it at all. If you're in a public system, you might have some form of treatment. But if you think about then the downstream cause and effect of that from disease, there's a fairly high percentage that we can trace back to thinking about a virus origin for an outbreak type of situation. And so our regulations don't necessarily get to that. We're forced to kind of look at these indicator organisms, but I think it's something that we have to not ignore as we think about groundwater as being this safe source of water for our drinking water, that we actually have some of these risks that we might have to approach and think about in terms of disinfection and removal of these different types of contaminants, again, to these very, very small levels, small organisms, and small concentrations that could still pose a risk to human health.
I understand there's been some changes, there were some proposed changes in state law, and then those were not implemented regarding viruses or ways to keep them out of municipal water systems. You want to talk a little bit about that?
So I don't know a lot of the details there, but it wasn't implemented, and one of the main reasons I think goes back to the difficulties with actually culturing these viruses. So we can run fairly quick tests for something like coliform bacteria. It might be an overnight test, and we can actually grow it on a plate of agar. And everybody always laughs at me and my family when I talk about growing these microbes, and they say, why would you want to grow them? Why would you want to culture them? But the plain truth is we don't know if they're going to cause people problems unless we know if they're infectious. So there might be something, a virus or bacteria in the water that's dead, and it's not going to cause us any issues. So a lot of the testing requires this cultural ability. Bacteria, it's pretty easy to do that. A virus is very, very difficult. So we work with some of the human viruses and animal viruses in our lab. It could take weeks to actually culture a live infectious virus and tell you that it's there and how much is there. So just going back to detection and quantification makes it really difficult. So all of the rules or regulations that you think about more so go back to these indicator type of organisms.
And so really we don't have a specific virus rule in Wisconsin, do we? A regulation?
We don't. And actually, if you think about drinking water everywhere, whether it's groundwater or surface water, we don't regulate any specific virus. So all of our regulations in terms of drinking water are based on levels of removal. So we think about, for example, 99.99% of virus removal is considered safe. But that's all sorts of viruses. It's not necessarily a single one, whether it's norovirus or adenovirus. We don't separate them out. It's just looking at a treatment technology, say chlorine disinfection or UV, and we measure it in the lab and say this can get rid of X % removal of viruses given this level of treatment.
And so communities are not required to disinfect, is that correct?
They're not.
Okay. And that was there was a regulation that was passed, was set to go into effect, and then it was pulled back to require disinfection. Are there downsides to disinfection that might have created this this movement away from regulation?
Good question. I think one of the things that came up in the last panel is people think obviously about cost. But I think another thing that we can think about with disinfection, the cheapest form of disinfection that we could possibly do is chlorination. So bleach basically does a pretty good job at removing microbes, disinfecting them, but we also have to think about kind of balancing out chemical and biological risks. So if you put a chemical into water, it's going to react with whatever you have in there. If you put bleach in, it could react with natural organic matter, whether that's like leaves or organic litter or things like that, and it can actually produce other chemical species that then we would have to think about, are there risks associated with them if we have disinfection byproducts. So that would be another part that I'd think about for disinfection. But we can look across the spectrum and we could say, could you do UV disinfection so there's no chemicals, but then you have extra electricity costs. And so again, that cost efficiency comes into play there.
There was a study, though, several years ago that linked individual communities that did not disinfect with the presence of certain certain diseases caused by viruses. Isn't that true?
Yeah, I think here in Wisconsin, one of the research groups that's done a lot of work on this is out of Marshfield, Mark Borchart's group. And they linked, in their case, they did a lot of work on norovirus, but in undisinfected private wells, they could actually link the rates of acute gastroenteritis or getting sick to finding and detecting these norovirus in the well water there.
And I think there was a municipal study too, wasn't there? And maybe I'm getting two studies mixed up, but there was one in which 6 to 22% of the severe gastrointestinal illnesses that people had suffered during a time frame were projected to be possibly related to lack of disinfection. I don't know if that's, maybe we're talking two different studies by the same people. I wanted to go back to George here now and talk about the current controversy surrounding groundwater withdrawals as it relates to high-capacity wells.
Ooh, okay.
Bring out the pitchforks, everyone. No, this is something that is a big source of debate right now in the state of Wisconsin, and I'd like to hear a little bit about that and what is the state of the debate and in the state of the law as we know it right now.
So a high-capacity well is a well that could pump at least 100,000 gallons per day. Most high-capacity wells are quite a bit above that. Typical irrigation wells probably in the 500,000 to million gallon range, something like that. So for a long, long time in Wisconsin, it was pretty much if you could fork out a very minimal amount of money for a fee, you got a well approval. And some of my Department of Natural Resources colleagues will say I'm oversimplifying here, but rather than get to the nuances of the 1% or 2%, I think I'm accurate here that you pay the money, you got an approval to put in a high-capacity well. We had some refinements in about 2002, 2003. It was supposed to be the first good step in managing groundwater quantity in Wisconsin. A law was passed, but pretty much all it did was say you can't put a well within 1,200 feet of a trout stream without getting a review. Well, there's nothing magic about 1,200 feet protecting a trout stream. A well a mile or 2 miles or more could dry up that stream or a lake. So, we realized it didn't do much, but it was supposed to be this first good step. We've never taken the second good step, is what the issue was. And all along here, we're putting more and more wells in around the state, 100, 200 a year, and usually oftentimes we're putting these wells where we're already water stressed. A lake district went to the Supreme Court in 2010, 2011, and a unanimous Supreme Court decision said, DNR, you have a constitutional public trust obligation here to look at well applications to see if they're going to be harming surface waters. And for a time, the Department of Natural Resources decided to very consciously minimize its review of these kind of wells. So it's going to be very rare when one well dries up a lake or stream, okay? Usually it's going to be the cumulative effect of many of them doing that. And so another lake district then, that was already missing about this much of its lake, Department of Natural Resources was poised to give an approval to a large dairy in that area that was going to take that much more of the lake. And the Department of Natural Resources says, well, that much water is no problem. But these people around the lake says, wait a second, we're already missing this much. And what happens when the next guy comes and takes this much and then another one this much? You see where this is going, right? Pretty soon you got an inch of water left in the lake and you're still issuing well permits. So they did what's called a contested case hearing before administrative law judge. The administrative law judge said, DNR, that's ridiculous what you're doing. You can't manage groundwater this way. You have to look at these things and in totality, in the cumulative impact, see what's going on. And so the Department of Natural Resources started doing that, and we have what a friend of mine, Charlie Andrews, in the consulting industry calls 1,600 days of science, where we did scientific management. We didn't fix the existing problems on the landscape, But when new wells were proposed for an area, the staff at the Department of Natural Resources, and by the way, some of these are ex-students and people I have friendships with, they did a stupendous job inventing a high-capacity review process from scratch. These 3, 4, 5 men and women sorting this out, great professionals, determined how to do this. And so we had 1,600 days of science here. Interestingly then, several months ago, the Attorney General issued an opinion, and what the opinion said was this, that the legislature passed Act 11.
I think it was 25, but I'm
25. Okay, and it was right around this 2011.
21 from my audience.
21, and it was right about the same time as the Supreme Court made its decision, and that act says state agencies cannot do things that are not explicitly told to do them by the legislature. So the Attorney General held that, hey, the courts told you, DNR, to do this as the agency charged with enforcing the public trust, but this keeps you from doing this. And so for the last 60 days, we have now been doing the age of non-science again when it comes to high-capacity wells. We'll see where this goes. There were multiple attempts to pass groundwater legislation in the last legislative cycle that would formally roll back protections on groundwater pumping. Intentionally or not, some of these bills looked like they were also going to privatize the public's water. In my opinion, when you look at these things, we're told in Lee Berquist's excellent pieces the last couple of days that they're going to be back. We'll just have to see what happens in the next legislative cycle.
And just following up on that, can you explain why the Central Sands area needs so much water when you drive through there on your way up north, when you see these big pivot irrigation systems? Well, why are they irrigating whereas the rest of the state seems to be able to get by just fine by having the rain fall on the corn?
Sure. I mean, I don't like the word need so much. What is a need? But the reason that it's employed is to make money, and there's nothing wrong with making money, and you can do a lot better with irrigated crops in these sandy soils there that don't hold water very well if you irrigate them compared to if you don't. We would be talking about different kinds of agricultural systems than the ones we see. By the way, what are these irrigated systems? They're the number one irrigated crop is field corn, and that's followed by potatoes, sweet corn, and some canning vegetables, things like that.
And I wanted to loop back and talk a little bit about some emerging contaminants and what the situation is with these emerging contaminants. And one thing that we have written about at the Investigative Center are endocrine disruptors. Who wants to tackle that one?
I can talk about it a little bit.
Excellent.
There's a lot of people working on this big group of things that we probably call emerging contaminants or contaminants of emerging concern. You'll hear lots of different names. But some of the classes in them include things like endocrine disrupting chemicals or pharmaceuticals. I actually have a colleague here, Patrick McNamara, who works on these. But these things come in extremely low concentrations. So they might be called micropollutants, and that's because they're coming in at concentrations of microgram per liter or lower, which is, when you think about a single drop of water in, say, a swimming pool. That's a microgram per liter type of concentration. So they're really, really low, which makes it hard to detect. And so we didn't know a lot about them in the past necessarily, but they're coming to light as we have better equipment and are able to detect them. And there's a lot of research going on thinking about what they do. So there's some evidence that in the environment, if we think about fish or amphibians, that they can have impacts on them. And so endocrine system kind of controls a lot of things in the body. And so if you think about some of the studies that have shown that fish could actually switch sexes if they're exposed to high enough concentrations of these things. So we don't necessarily know at this point what they do to humans. They're in very low concentrations, so it's probably looking at, over very long time periods that we'd have to analyze this. there's a lot of work going on, but at the same time then there's big questions about should we get rid of these before the water goes into the environment, before it gets into drinking water. None of our treatment processes were designed with these things in mind because we just didn't know about them for a long time. So there's a lot of work going on into thinking about how we can remove them and then actually tracing them through. So these things are all dissolved into the water. So they're
So right now there are no like endocrine disruptor / hormone regulations. We're just looking at them right now to figure out what do we have and what do they cause? Are they problematical? Where do these come from?
So different sources. So there's a lot of them that are synthetic and can actually be taken, you know, if you take a pharmaceutical, some of it metabolizes in your body uses it, but some of it passes right on through. And so that stuff is going to get into the water system then and carry on. There are no regulations on them specifically right now in water, but some of the ways that people might actually look at, is a groundwater contaminated by human sources? You can actually trace, so I see a lot of coffee cups around here, right? Yeah. So you can trace caffeine and you can trace it down into water systems and look at concentrations of it and see if it's impacted by people. Same thing with, say, a birth control pill or something like that. Part of that's going to pass on through the body and then you can actually find that in the system. So the big challenge now is thinking about what kind of impacts do these have and how do we best get them out of the water in the first place?
My lab, we look for caffeine and nicotine as tracers and a number of other things. Sometimes we're trying to figure out is nitrate coming from agriculture, in which we use some pesticide residues as tracers, and then sometimes it's from septic systems, and we use the kind of things we're talking about. I don't think that among water scientists that we doubt very much that surface water discharges of endocrine disruptors have potential impacts. Have you seen much about the groundwater discharges, though? And I'm in the dark about these.
That is much more emphasis on surface water.
Okay.
And surface water is more regulated in the sense of, my understanding is municipal systems or public water systems that draw from surface sources have to go through more hoops than those that are groundwater based.
Well, but the volumes that are discharged at a point of surface water, and most of the literature I'm familiar with on this is European. I don't know what's been done in the U.S., but in large rivers in Europe, they are seeing sufficient quantities of these things where we're worried about impacts on fish and the like.
And Toledo was in the news a couple of years ago for its algal bloom that was a surface water source and got into the city water source. And the Bay of Green Bay has a dead zone, so-called. Do we know much more about the dead zone at all, about where it comes from, what it's doing or not doing?
So I'll step in here. So a lot of the issues that we see with algal blooms, whether it's around Green Bay or whether it's in Toledo, that's caused by algae growing, and it's growing too much, more than we want it to. And like any living thing, algae requires some key nutrients, and the two key ones are nitrogen and phosphorus. And so if you get either one of those in high enough quantities, you can actually create these big overgrowths of these algae. It looks kind of funny, it's bright green, but it can also have these other downstream impacts in that as these algae grow, then they're going to die, and as they die, they decompose and they change the water chemistry, particularly oxygen. So fish and other organisms have to have enough oxygen, but this dying algae can actually eat that up and consume it. So that's one big issue. The second one, Toledo, they actually had a type of algae that produces a toxin, and so that toxin is an acute poison basically to people. And so that was another issue there to think about, not just the environmental degradation of the water and the fish and the species there, but also how could they drink it. And one of the things about this toxin, it comes from these organisms that if you, say, do a traditional technology like boiling it, it might actually release the toxin from the organism, and it could make it worse. So again, a lot of work going on in how you treat that, but tends to be a much bigger surface water problem because they need the sunlight, they need everything else there. But most of these nutrients come from big sources are agriculture. So we put a lot of fertilizer on fields. About 40% of the mined phosphorus goes off and runs off in these fields into surface water. Another 40% goes kind of through the animal system and then is released out. And then we have a smaller fraction, maybe 15% of the phosphorus that's mined goes through humans and out in our wastewater. But all of that gets together, gets into the open water, and then creates these bigger issues.
And what are we doing about phosphorus as a state or in localities?
So there's a lot of work going on here specifically in Wisconsin with phosphorus right now. DNR and regulations have tightened up a lot, and they've reduced the levels that are acceptable in a discharge. So if we think about a wastewater treatment facility, it's dropped a lot. But we have big challenges in trying to get down to these very low levels, and we can think about things like filtration or selectively grabbing these things out of water. So the first and foremost thing is to protect it. Again, a big portion comes from agriculture, a big portion might come from cities, but also at the same time we use it as fertilizer. So some of the work that we do in my lab is getting this out of water, but also recovering it in a form that you can use it. So take it back and use it as a fertilizer and kind of close this loop. So there's some efforts that direction.
Great. Looks like we're almost at 10:30, and we were going to try to leave about 15 minutes for questions. I guess in fairness, we should start on this side of the room. Do we have a microphone going? Well, we did last time. I'm sorry, I can't see. What am I? Okay.
I'll try and be loud. There it comes. I'll speak from the perspective of an environmental laboratory. Just because something may be found in the water doesn't mean that EPA and laboratories have developed methods for testing things. So, for example, endocrine disruptors, nicotine, caffeine, Teflon compounds. These are things that aren't currently regulated, in part because the EPA hasn't determined how widespread they exist in the real world, and then once they've done that, finding out how to test for them. It's not as simple as a coliform bacteria where we can do a test in a 100 milliliter bottle, and if it changes color, that indicates it's there. There's something that we've got to put $250,000 into an instrument to test for Teflon compounds to see whether or not they're there. And then we're looking at these part per billion, or in some cases part per trillion levels. Another helpful guide of what a part per billion is 1 second in about 32 and a half years. So if you're 65 years old, 2 seconds of your life is a part per billion. That's a tiny amount. And in the Teflon compounds, we're looking into part per trillion levels. So
and are those just coming off of people using Teflon for cooking? Or we don't know?
That's one place we don't know. A lot of the testing that's done isn't forensic in nature. It can identify whether or not it's there, not necessarily where it comes from. That's where the tracer compounds are of interest, because you can see it at some times. Is this human-based or is this animal-based?
Any other questions? Yeah, right here.
Let me see if that's, oh, there we go. Guess I don't have to yell. So you guys were talking about cow manure filtering down into the groundwater and creating a problem with human drinking water sources, but what are the cows drinking? And is that creating any kind of questions, at least, or issues with the agricultural economy?
I think the cows are drinking the same water as the people, aren't they?
Yes and no. So a lot of the larger farms will have the same high capacity wells we were talking about in other parts of the states, and those go quite a bit deeper typically than your typical residential well, and so the cows actually are probably getting, on average, cleaner water than the people.
Good to know.
On the other hand, my dog would rather than drink out of his bowl, would rather drink out of a puddle in the yard, or ideally even the toilet. So I don't know if animals have the same sensitivity as we do, if nothing else because they have a shorter lifespan.
They're also unlikely to form a lobbying group that's going to have much influence, I don't think. Back, right, straight ahead here.
Besides regulations and regulating what's going on, mechanically and engineering-wise, what can be done to solve these problems, and how far away are we from actually having something out there, having physical mechanisms to solve these problems?
All right, so I'll take a first stab at that. So from the engineering and the technology side, there's a lot of really good treatment processes that do a pretty good standard job, but most of them are employed on a rather large scale. If you think about Milwaukee as a city, we have good utility scale, but if you think about a private well, it's going to be a lot more difficult. So then I think it might come down to more point of use type of technologies, maybe the filters that Mark was talking about, or a UV based system right at home. So we have some of that and it addresses a lot of concerns, but if we go to some of these emerging concerns that we've talked about, those things on the other hand, we don't really have a great grasp of how to treat yet. So there's a lot of work going on in research labs all over the place trying to get those technologies nailed down.
I was at a conference in San Francisco a couple of months ago, and there was a global look at, it was particularly talking about groundwater quantity management strategies. And these folks gave a good look at what's happening in some, 60 different countries. And pretty much they were throwing in the towel. And we're talking about allocating water anyway, that just a voluntary measure isn't going to work. There's always going to be a need for something, some institutional club, whether you want to call it regulatory or something else. Voluntary sorts of things aren't hitting the mark. Here's an example this week. Hey, correct me if I'm wrong, but triclosan, would you consider that an endocrine disruptor? Okay, so stuff in hand soaps that sanitizes, kills germs, has active ingredient in there that looks a lot, at least according to my colleague Bill Sanzoni, retired from the lab hygiene, looks a lot like, I can't think of what it looks like. Anyway, a nasty chemical. So that it has a chemical structure that ought to make you think that this isn't a good thing. And there's been reports on this stuff accumulating in Great Lakes and Great Lakes fish for better than a decade. Industry is kind of aware of this, but was it phased out voluntarily? No. So EPA said put a stop to it. A year from now, we're phasing this stuff out of soaps, and I don't think we were going to get there in any kind of a voluntary way.
Question back here in the green.
You talked a short time ago about limiting phosphorus into the lakes. In the earlier presentation, we talked about lead, and one of the Band-Aid approaches is corrosion control using phosphorus-based chemicals. Do we understand that these two things are in direct conflict? And we're talking about a Band-Aid approach in water that may be used for decades.
Yeah, absolutely. I think that's one of the big issues with, we have this Band-Aid because we need to first and foremost try to protect human health right there. But it is directly linked downstream to going into the wastewater. So yeah, they are in direct opposition. Hopefully we come up with better solutions than putting it in one end and trying to worry about it at the other end.
Brooke, I wonder if you have a sense for, or Jill perhaps, how much phosphorus is point source though versus non-point land runoff in a state like this?
So I can give rough numbers. I don't know about it exactly for Wisconsin, but if you think about roughly, probably on the order of 80% is coming from non-point source, thinking about agriculture and distributed loading versus maybe that 20% that's coming from a point source, like a wastewater discharge type of thing.
That's sort of like the pipe versus non-pipe in terms of discharge to the environment. Then the point source would be a pipe like an industry or a wastewater treatment plant.
So I think those last two questions sort of point to a larger issue that comes up for me a lot in Kewaunee County with residents, which is that a lot of engineers will come and give me something to clean up the water as it comes out of my well. But at what point is it not okay to contaminate this aquifer? And what are the larger implications of that? And we seem to have moved in environmental management in this subtle shift of looking for technologies to clean things up because they're inevitably going to get dirty rather than preventing the contamination in the first place.
Right here in the blue.
On these high-capacity wells, I assume they have water meters on them to measure exactly how much water they're taking out of the aquifer?
They usually don't have water meters. They do have to report their water use, and the reporting, I understand, has been pretty good for the last 5 years or so. But that reporting is usually done that the well owner will, when we're talking municipal wells, they know how much is coming out of there. But when we're talking about, say, an irrigation well or wells for a large dairy, they know what the well output is, and they'll look at the electrical meter, or they'll look at a clock, and they'll do the mathematics, and it gets us in the ballpark. My colleagues at DNR think, yeah, it's pretty good. Others are more skeptical.
Well, I guess the question is, as we're draining the aquifers, have you heard any discussion at all? I'm a private well owner. I live in Mequon. And every once in a while I hear someone suggest that everybody on a private well would have a water meter, just as homeowners on a municipal system do, to charge for the amount of water coming out of the aquifer, and thereby putting an incentive for using less water. Have you heard anything about that?
Did everybody catch the drift of the question? Basically, it's everybody ought to have a stake in the water game. I'm a private well owner. Yeah, I'd be happy to. I don't know if you need to put a meter on it or say, hey, family of 3, use this much water. It's going to cost you, I don't know, $50 a year or whatever the heck. With that money going to water management, most of our water bills are to pay for infrastructure. It's what we need to do. But in my opinion, we short shrift water management, and we need to raise a few nickels to do that. And boy, I'd be good with that personally.
Well, the other side of that is the high capacity well user doesn't pay for use of that water, right? So they're using these large amounts of water for essentially free as long as they're willing to drop the well. It's a major issue of contention in Kewanee.
Question right here.
In regard to the high-capacity wells, how much of that is going back into the aquifer? Isn't it going on the soil and then going back in?
There's a good question here. So, we got this water cycle with the irrigation wells. What does this really look like? I'm afraid this is a complicated answer, but I'll try to do something here. So I think that these producers are very efficient in putting on water, because if you put too much water in, what's it going to do? It's going to soak through the soil and go back to groundwater anyway. The plants don't get a chance to use it. So, I've seen numbers like 95% efficiency on the plants soaking up that water and sending it up into the atmosphere. Where there's a complication here is, you can imagine, we have a forested landscape here, and we have trees. And the trees start greening up, I don't know, mid-April. They go through the summer. Dry periods in the summer, those trees shut their leaves off and don't lose any water to the atmosphere. Rains, okay, they open up and use it for growth. Then we get into the fall, and trees then continue doing their thing before they senesce, and October 1, they may be done. Compare this now to an irrigated crop where you may have a nearly bare field until maybe May 20th. Here. And so during that time, that bare soil isn't using much water relative to the tree. Then we move into the summer, and we hit some dry periods here, and when the trees suck it up and don't use any water, we're putting water on these crops, and they are using water to beat the band. And then we harvest that crop before the trees are done doing their things, and we kind of go back to crop residue or dry soil again. So really we have to compare the whole water cycle. And it varies with dry years, wet years, but bottom line is, on average, irrigators might be putting on about 8 inches or 10 inches of water on their fields a year. My best estimates are the amount of water use, the true use, compared to, say, a a forest or a grassland that might have been the natural landscape is about 2 or 4 inches. 2 inches of water use on irrigated land explains all the dry lakes and streams we see in the central sands. That's all it takes. We need to ratchet that number down a little bit, but very shortly there's going to be an onslaught saying, an industry piece saying, irrigation wells take deep groundwater, they put it on the land surface, and all of it goes back into the aquifer, so we have more water in the streams than we used before. There's not this much science to support that at all, and there are stacks of science to say, no, irrigation uses water and lakes and streams are drier.
Other questions? Right here in the back.
Hi, Mike Taboris. Are there good examples of groundwater management anywhere? And don't limit yourself to Wisconsin, just something that's a model that would be followed.
Model of quality or quantity?
Oh, sorry, quantity. I was thinking.
Quantity? Yeah. Michigan, okay, let's look at states that are similar to us in terms of their hydrology. Michigan has had a program in place for some time. Most people get hung up because they got this whiz-bang online tool that expedites the permitting process, but the philosophy behind it is the important thing. Good parts of the Michigan model is that it only allows a certain amount of impacts on streams. Bad parts are it doesn't help lakes very much, and they grandfathered a whole bunch of things in, which would not be a good situation for Wisconsin now. Minnesota, it's my impression they have a much better law. They caught up, they were years behind us and recognized the problem, and then they leapfrogged beyond us in passing legislation that will deal with the groundwater allocation, and not only how to take care of new wells, but how to fix places on the landscape where we've dried up lakes and streams. They're very cautious. The regulatory agencies are very cautious in moving in this direction, but they've got the framework there, and we're doing it. So I'd say the Michigan and Minnesota models, particularly the Minnesota ones, are areas that we should probably look at.
Can I add there really fast? So not related to Midwest, but another example of groundwater management would be arid Southwest, where they've been forced to take a whole different view than we have here. So there are some places in Arizona, for example, where they have active management areas where you can't withdraw groundwater unless you prove you're putting the same amount back in. And that might be something like recharging wastewater or other sources there, but there are certain areas of the country where they're actually looking at that balance of what goes out, what goes in.
All right, I think we're out of time. I really appreciate everybody coming, and give some love to the panelists. Thanks a lot.
Okay, I see it's 11 o'clock, so we're going to get started once again. Our next panel, as we reconvene, has to do with water pricing and valuation. Now, many observers believe that water scarcity is primarily a problem of valuation, and specifically that the price of water is significantly lower than the value of water. So this panel will explore some of those issues and the tension between providing clean water to everyone and valuing it appropriately. The moderator for this panel is Dr. Andrew Meyer, Assistant Professor of Economics in Marquette University's College of Business Administration. Andrew's research interests include environmental and natural resource economics, behavioral economics, and experimental economics. Much of his work has sought to better understand how individuals make decisions that involve trade-offs over time in a variety of contexts. So he's very well suited to lead this discussion of water pricing and valuation. And I'll turn it over to him and allow him to introduce our panelists. Andrew?
Thanks, David. We have an excellent panel of 3 speakers to discuss water pricing and valuation today. Chris Gomans is an economics professor at Colorado State University. Christine Klein is a law professor at University of Florida. And Brett Walton is a journalist at Circle of Blue. Before I introduce our first speaker in a little bit more detail here, let me just say a few notes about the format of the panel. Each speaker will give a brief introduction to their area of expertise, and then after they have given their brief introduction, I will lead a panel discussion, and we'll save 10 or 15 minutes for questions at the end. So Dr. Chris Gomans is an associate professor at Colorado State University in the Department of Agricultural and Resource Economics. He has published extensively on water management and decision-making of residential water consumers. Much of his work has especially focused on water issues in the western United States. To lead off today, Dr. Gomans will give a brief overview of how water is typically priced.
So I'm curious, how many of you frequently look at your water bill and understand all the components of it? So I see a few, right? This is the same response that I get at water conferences. Nobody looks at their water bill, let's be honest. Water bills and what you see on your bill typically is based upon some sort of cost recovery principle. Beyond that, there's tremendous variation in the pricing structures that are behind what's on your bill across states, within states, across utilities, across customer classes, tremendous amounts of variability. The one thing that is common is that there's a disconnect between when people use water and when they're getting paid, because most people don't understand the rate structures or even know what they're about. I thought it'd be useful to lead off this discussion with a basic understanding when we're talking about the price of water, of what your water bill looks like. In general, if you look at the bottom of it, there's a total amount, right? And that either consists of both water and other services that the utility provides, or just water. So immediately there's a potential disconnect between your water use and what you see on that bill. That water bill, depending on the type of customer you are, right, whether or not you have a meter or you don't have a meter, may just be a fixed charge if you don't have a meter, which represents hopefully your average cost on the system. Right? If you have a meter, there's often a multitude of line items that you'll see. Typically, they fall into two classes, fixed and variable costs, right? For water coming into the house and water leaving the house. Right? For water coming into the house, you have fixed charges, which represent the loan payments on the infrastructure needed to deliver the water, etc. You'll have variable costs, so that the total amount of that portion depends on how much you use. And that's gained a lot of attention because there tends to be about 3 different types of rate structures you hear about. Increasing block rates, where the amount that you pay per gallon increases the more that you use. Constant marginal rates, or decreasing block rates, where the price you pay per gallon decreases as you use more water. From what I understand in Milwaukee, the latter two are what's prevalent for the water utility here. Right? You then have charges on your bill, if you're not confused already, you then have charges on your bill for water leaving the house, both a fixed component, again to cover those fixed charges, as well as a variable component. But in most places, we don't monitor how water leaves the household, so we need to come up with an estimate. So that amount is typically based on your winter water use. Right? All of this is confusing. And the point of all of this, if you're not confused and you don't understand it, none of that has to do with the cost of water. That's the cost of treating the water, storing the water, and delivering the water to your home. The cost of water, in many places, there is no cost of water beyond the permit that you pay to pump. Or in some areas, when you're applying to get a tap, you'll see a couple of different charges. A system impact fee or development fee, which is designed to cover the cost of putting the pipes to your homes, right? And other costs on the system. And then in other instances, you'll be responsible, and this is the case in much of the Southwest, in arid areas, for securing a water right to guarantee that the utility has the water necessary to provide you water into the future. And so in these instances, you have to pay, dedicate a water right or pay a cash in lieu of rate. And only in those instances do you really have a cost for water that ever shows up. It only shows up when you connect your house to the system. Your monthly water bill often doesn't have anything to do with the price of water. Okay? So this is a real challenge for utilities because there's a big disconnect between the water that you use and the perception that most customers have and actually how they're getting billed. Utilities have the unfortunate job of everyone expects them to provide clean, reliable water supplies, and no one likes to see their water bills go up. Right? I don't recommend this, but if you ever look at any newspaper articles on water rates, right, and you scroll down to the comment section, again, I don't recommend that, right? What do you see? Water's for free. Why do I have to pay for it? Water falls from the sky. Why do I have to pay for it? And that's the challenge that we face, is this balance of providing clean, reliable water supplies and keeping those costs down.
Thanks, Chris. Next, we have Professor Christine Klein. She's the Chesterfield Smith Professor of Law at the University of Florida, Levin College of Law. Professor Klein has published numerous articles and several books in the areas of water law, natural resources law, and property. Prior to her academic career, Professor Klein worked as a water rights litigator in the Colorado Office of the Attorney General. Today, she will give an overview of some important legal and regulatory issues related to water.
Good morning, everyone. Also, between my stint in Colorado and my teaching in Florida, I worked at Michigan State University for 8 years. So I have familiarity with a typical water law system of the upper Midwest. Well, interestingly enough, water quality, the pollution control, and water quantity, who gets how much, are regulated separately, completely separately. And I'll talk just briefly right now about regulating the pollution control aspect, the clean water aspect of drinking water. There are two main federal statutes, laws, that govern drinking water. The first is the Clean Water Act, which was passed in 1972. And do any of you know what the impetus was for enacting that law? What happened in the late 60s? Yeah, the Cuyahoga River caught fire. A river caught fire. So that kind of gave us a little wake-up call that something was wrong. So Congress passed the Clean Water Act, and it primarily regulates water from point sources, end-of-the-pipe contamination. So industrial, municipal, some CAFOs, confined animal feeding operations, but primarily governs end-of-the-pipe water pollution. And it primarily governs the discharge from the end of the pipe into surface waters. So it is addressed, the Clean Water Act, primarily to water dischargers, those who pollute from pipes into surface water. Now, that's called the point source part of the program. There's another part called the non-point source, which is the much harder problem of runoff from farms, from cities, from stormwater overflow. And that's the part we have not really done much with yet. So we've done a really good job of regulating point source, end of the pipe pollution. We don't have our rivers catching fire anymore. But now we have the intractable problems we were talking about this morning of runoff and non-point source pollution, and it poses political problems, regulating farms, regulating cities. So that's the first part, the first law. The second law is the Safe Drinking Water Act, and that came along about 4 years later in 1976. And that 1974, my math is off. And it was the historical chronology, we'll see, will play a role as to who pays for clean water today. So the Safe Drinking Water Act, rather than applying to the polluters, applies primarily to the water utilities who are delivering that water to customers. So they get the water clean, dirty, in whatever shape it's in, and they have to comply with certain federal standards for contaminant levels. So the cost falls on the utilities and their customers to clean up the water once they get it. And there is a cost-benefit analysis written into the law. So although the standards begin with human health protections, if the cost of regulation are too high compared to the benefits, or if we don't have the technology yet, then rather than setting minimum contaminant levels, we look at some sort of treatment technique. So I'll just leave that out there, and I'll draw upon that more later, but the Clean Water Act, which came first, regulates the polluters. The Safe Drinking Water Act, which came later, regulates the utilities that are trying to take that water and then pass it on to their customers.
Thanks, Christine. And our third panelist today is Brett Walton. Brett is a reporter for Circle of Blue, which is a leading journalistic organization addressing global water issues. He regularly writes about agriculture, energy, and the politics and economics of water in the United States. Brett also writes the Federal Water Tap, Circle of Blue's weekly digest of U.S. government water news. Here, Brett will talk about how utilities are addressing the pressures that influence water pricing that the utilities are facing.
Thanks, Andrew, and thanks everyone for coming out. It's refreshing to see so many people interested for water issues on a morning. I'm going to talk about 5 things that utilities are facing, 5 challenges. It's a handful in more ways than one. Looking at a national picture here. So there's incredible variety in water systems across the U.S. There are more than 52,000 community water systems that supply water to communities. They're an incredible amount for the size of our country. So there's always counterexamples, but these are 5 broad challenges. In general, we built our water systems to last, but we didn't build them to last forever. And now there's a time of upheaval for water utility business. One, because of conservation. So we've entered this era of conservation where people are using less and less water, and that's a good thing. You look at per capita water use in almost every major city, it's going down. Total water use in some cases is going down. So you have per capita water use being cut by half or more in Western cities, going from 300 gallons per person per day to less than 100 gallons in some cases. So that's a success. Indoor water use continues to go down through changes in plumbing codes and conservation practices. Indoor water use goes down. Outdoor water use accounts for half or more of residential water use, depending on where you are. So to water your garden, to keep your lawn green, that's where most of your household water use goes in general. Now that's a problem because the old business model for utilities was sell water and get money. You have an incentive if your revenue is from selling your product to sell more of that product. But now when you have people that are conserving water and you're selling less of your product, you have revenue issues potentially. And that's a second challenge, is conservation is leading to revenue issues, where this old business model of sell more water, get revenue, goes out the window. And you have to rework how you structure your water rates like Chris was talking about. So changes between these fixed and variable costs. How much do you pay upfront, regardless of how much water you use, and how much do you pay based on the amount of water that you do use? You need the revenue, utilities need the revenue because of old and aging infrastructure. People say this phrase all the time, old and aging infrastructure, which gets old eventually, but it's the truth that a lot of the stuff that we put in the ground in this country to deliver water is not functioning as well as it could or as well as it was designed to. And that costs a lot of money. An estimate that gets talked about quite frequently is the national cost to replace all of the pipes that deliver water to cities and individuals. And just an estimate of that cost to bring everything up to operating standard would be $1 trillion over the next 25 years. And that's just for the pipes, these buried assets that we don't really see. And a lot of these pipes are quite old. In Milwaukee, half of the city's water mains, these highways that we talked about that deliver water, were installed before 1954. 10% were installed before 1900. You have 10% of the water mains in this city, and there's more than 2,300 miles of water mains. More than 10% are more than 116 years old. Now, it's lasted this long, but some of these are breaking. There's water main disruptions. Streets get closed so work crews can repair it. It's a major disruption to city life to have these things break. And you have boil water advisories with contamination seeping in. So it's a problem, a disruption to city life that needs to be addressed. A fourth issue, so 1 was conservation, 2 revenue, 3 old pipes, 4th would be climate change. So the environmental conditions today are vastly different from when a lot of these systems were put in place in the 40s, 50s, 60s. So when we design and build new things, we can't just put in what we had before, because we have to design and build for what's going to come. And those conditions are going to be different. There's going to be more intense rainfall. There's going to be higher sea levels. A lot of the water system operates on gravity. And when you have your sea levels rise, then that gravity balance is changed. You have San Francisco is spending $20 to $40 million to rework its sewer outfalls so that you don't have saltwater corrosion into the pipes, and so the sewage continue, or the wastewater outflow continues to flow in the face of rising sea levels. So climate change will change the calculus for how we plan for all of these improvements to the water system. And lastly is something that's become more and more salient across the country in the last few years, and that's equity. We've talked about this earlier this morning with lead levels and lead pipes and social justice, where the conversation is twofold. One, how do we ensure equitable water access within a city, and then between cities, so that we don't have outliers that can afford to pay for water, can afford to pay for the systems that they need. And so we just don't have a rich can afford clean water and the poor cannot. So those conversations are developing at local, state, and federal levels. We can talk about this later as we get into the conversation. But those are the 5 pressures I see on water utilities today: is conservation, revenue, old pipes, climate change, and social equity.
Thanks, Brett. Thank you all for those introductions there. And so what I'd like to do now is move into the panel discussion portion here. And I'd like to make this a conversation as much as possible. So I'm not going to necessarily pose the questions to one particular panelist, but please feel free to jump in as you feel able. Also, I would encourage the panelists, if something comes to mind that you would like to ask of the other panelists, please feel free to do that. So one kind of background question that I was wondering as I was hearing several of the introductory presentations is, what has been happening around the country as far as trends in water pricing? I know it varies a lot based upon which region you're in, but is water that consumers are getting in their household becoming more expensive, cheaper, how much, et cetera?
I think it's the 2 general trends that kind of I observe. The first one is somewhat uniform, and that is that prices have been going up considerably. And that's not necessarily because of increased scarcity of water, but that's because of increased costs of aging infrastructure, increased costs of new regulations going on. The prices have been going up. The second has been a change in kind of how we price water itself. And now I'm talking about the variable component of how we charge people for water and coming into their homes. Along with the push for conservation, we've tried different means of trying to incent that. And one way is to switch to what I referred to earlier as increasing block rate structures. So I'd argue probably somewhere in the neighborhood of 90% of the public providers in the Southwest probably use some sort of increasing block rate or water budget pricing structure, so that the more you use, the higher the per unit charge for water is that you pay. And those are the 2 biggest trends that I've seen over the last 5, 10, 15 years.
Any other additions to the trends that either of you have noticed?
Yeah, so rates are increasing almost across the board, a lot to deal with increased costs. And a lot of this is to try and balance this revenue and conservation thing, where if we talk about fixed charges, kind of wonky terms here, fixed charges and variable charges, and fixed costs for utility. So utility has a lot of stuff that's in the ground that they're paying debt on, that they have to upkeep no matter how much water is used. And usually the money that they take in from these fixed costs, so that $10 a month you pay no matter how much water you use, does not cover the entire cost of those assets that are in the ground. So you now have the question for utilities is, do we increase that monthly payment that you have to pay from, say, $10 to maybe $20 to try and get in balance fixed and variable, where the money we have coming in that we know is going to come in every month based on how many meters we have will pay for the stuff that we have to pay for.
One broader sort of pricing issue that comes to mind, a broader, longer-term trend, is who pays for clean water. And again, as I alluded to earlier, you could pay for it at the source. So under the original Clean Water Act, it was originally the polluters, at the point source dischargers, that had to pay or take measures to limit the pollution. But now we had such great success with that the Clean Water Act has done its job with point sources. So now really who is paying? It's the utility customers, like you were all talking about. But now we're circling back again and thinking, well, wouldn't it maybe be more efficient to, rather than take pollution out, to not put it in to start with? So there's some different programs. I wouldn't say they've really risen to the regulatory level, but to protect water at its source. And that could be a partnership with the utility that uses the water and the upstream or upgradient farmers or people who might be polluting the water. One quintessential example is the New York City, which doesn't filter its water, and instead it has an elaborate system of reservoirs and aqueducts for over 100 miles, and it brings down this really clean water that it protects upstream in the watershed. And so you can, when you're thinking about utility costs, you can also play with not just treating the water, but preventing the pollution to begin with, and trying to have partners upstream to work with you on that.
And one thing to add to that is one of the big trends in recent years has been towards this one water concept, where water industry right now tends to be pretty provincial and segmented, where you have your wastewater utility and your stormwater utility and your drinking water utility and your farmers, and all these things are really separate, are pretty separate. But the thinking is to bring it all together into one water, where you have cases in New York of the city paying for best practices on farms upstream and watershed conservation practices in the forests that are more than 100 miles away, so that when the water gets to the city, it's clean enough that they don't have to filter it. For the lawyers and the public policy people in the room, there's a very interesting case in Iowa right now where the city of Des Moines has sued 3 counties upstream in their watershed for farm pollution, for the nitrates that are going into the Des Moines and Raccoon rivers. They have tile drainage there. I don't know if we have tile drainage in Wisconsin, but pipes that drain water out of farm fields and put it into rivers. It's not regulated under the Clean Water Act because farms, for the most part, were left out of that. But Des Moines is saying we have to spend money to take nitrogen and nitrates out of our water that we didn't put there. They came from upstream. The farmers should be a part of this water quality solution. And this lawsuit in Iowa has pushed water quality issues way to the top of the state agenda. So you now have the governor talking about using tax money to fund water quality initiatives, the relative merits of, the tax money now goes to education, but should we fund education versus water quality? But this lawsuit has really put water to the front of public policy in Iowa. And it's in the service of this one water concept, where it's not just the city has its problems and the farmers have their problems and we have some forests, but it's looking at it holistically.
Speaking of one water and just the way the human mind works, we love to put things into boxes. So thinking of Florida, the main problem in Florida, where we get 54, 60 inches of precipitation annually, is too much water. So a big issue in settling Florida was to get rid of all that pesky water. So what did we do? We had this flood control system, and as the water comes down the peninsula, it gets shunted out east and west to the Atlantic Ocean and to the Gulf of Mexico. Well, guess what happens? Fast forward about 50 years, there's Orlando, there's Miami, there's all these population centers south of where the water is getting shunted out. And they're thinking our problem is we need more water. Should we have a desalination plant? Well, we're taking fresh water and pumping it out to the ocean. So it's that idea that, one person's wastewater is another person's water source. So we are trying to think more holistically and getting the different water utilities and water users and water stakeholders to talk to one another and think how to manage it as a single resource.
Thanks. Christine, I wanted to follow up on what you were saying about the non-point source pollution. Regionally here in Wisconsin, I remember seeing quite a bit of news this summer about Green Bay and a lot of the agricultural runoff that's getting into Green Bay. And this is also happening in other Great Lakes around the region. And there was, I believe, some controversy. I don't remember which municipality exactly it was, but the utility was considering raising rates to be able to pay for the increased treatment costs. The way that the regulatory standards work now, would the responsibility for the increased costs fall on the consumers in that way? Or is there any room for the government to say that the agricultural industry has to kick in some as well?
It's a political issue of who should be regulated. And right now, some CAFOs count as point sources, but other than that, the agricultural runoff and septic systems and stormwater runoff from cities are subject to much, much less regulation. And just to put these algal blooms in context, it's not just a Great Lakes issue, it's happening in Florida. But if you think of the Midwest in general, our big breadbasket of the world, and all those nutrients, the nitrogen and phosphorus is running off down the Mississippi watershed. And in the Gulf of Mexico, we have one of the biggest dead zones in the world. And that's where the algae decays and consumes oxygen and takes oxygen out of the system. So if you look at a map, you can see this huge red dead zone in the Gulf of Mexico. So primarily at this point, the costs would fall on the utilities. I bet Chris could probably add some more to that. And then, as Brett was saying, there's case-by-case litigation to try and, sue the farmers in nuisance. But individual lawsuits is not an efficient way to run an entire water system.
Okay, great. A little bit different issue here. As an environmental economist, I think oftentimes about the market price of something. So you go to the store and you pay a certain price, that's the market price, versus the social price of that good. And the social price or the social value would include things such as, what we would call externalities, right? So accounting for the pollution of the good, et cetera. And so my question is, although water markets aren't necessarily well-functioning markets, I'm wondering if, in your opinion, maybe this is the best question for Chris to begin, do you think that the price that consumers pay reflects the true social value of water?
Let me start by saying that there is little to no economics that goes behind the creation of most water rate structures. A couple of years ago, joined my local water board, and we have about 500 customers, and I was told that our rate structure was created on a napkin at some point, which I have not found. Still looking for that. So again, what you see on your bill is more often than not simply reflecting the treatment, delivery, and storage costs. The actual cost of the water itself, both was either paid up front to secure the water rights, or it was never paid outside of the electricity costs of pumping it out of the ground. So there's a big disconnect between what you see on your bill and what we might say is the social cost of the water itself. Which is why some people, suggest that we need these rate structures which promote conservation, because the price itself isn't sufficient to reflect the cost of society of using that water in scarce areas. The real challenge that we have, and this was alluded to earlier, is that there's tremendous what we'd call economies of scale in treating and delivering water. Right? The cost of treating 1 gallon of water is extremely high compared to the average cost of treating millions of gallons of water, right? So we've got this balance. The more water we treat, usually, the average cost gets smaller. The more water you consume, the average cost goes down. And that's why historically we saw these decreasing block rate structures, right? As we start to raise prices, what happens, right? We're all consumers. We tend to cut back, right? As we consume less water, the average costs increase. And so we've got this dilemma. And you're exactly right. Traditionally, our solution to water problems was build more capacity in the system, build bigger treatment facilities, get more water, sell more water. Now we're starting to think about conservation as a component to our water supply planning efforts. And now this issue of revenue and the fact that we need to recover costs and the fact that we have these huge economies of scale comes into play and is a really big challenge, trying to reflect the cost of water as well as deal with the realities of the infrastructure costs as well.
I do want to make a distinction, and it's something I want to do more reporting on myself, and I think it's an important thing that needs discussion in the U.S. is this distinction between the economics and value. So there's the old maxim, we know the price of everything, but the value of nothing. The conversations in this country and internationally about the value of water tend to be based around economics and things that we can put a price on. So we have market systems to allocate water, we have water pricing for utilities, what you pay for your water bill. But the conversation, and we have some legal codes to do this, such as public trust document, but the conversations about what do we want to use water for, and is that valuable to us, are big conversations that are difficult and have yet to be had at a really serious level, state by state or country by country. And by that I mean, one, you have to define who is we, who is our. Is it within a city? Is it within a county? Is it a state? Is it a country? Is it internationally? The water we use has multiple local, national, international endpoints. So the water we use in, say, California to grow almonds, most of those almonds are exported and consumed in China. The water creates a value for a local community in the goods that are produced. It creates value where it's consumed. But do you have a conversation in California saying, do we want to use our water for an export crop? Do we want to use our water to have flowing rivers? Do we want to use our water to have clean, reliable sources for everybody, no matter their income level or status? And those are hard conversations because a lot of the ways we allocate water and use water were established 100 years ago in mining law and breaking open the Western frontier law. So changing those things will be difficult. Who wants to change them, how they should change is, I think, a very important conversation.
Well, think about this. If we have been paying the true cost or value of water, why are we behind $1 trillion over the next 25 years for our infrastructure? It's because we have not been paying the true cost as we go along. We're thinking very short-term, very piecemeal, but we're not thinking about the full life cycle costs. If we want to maintain this standard of clean, available drinking water throughout the country in perpetuity, what does it cost? Well, you have to build in those infrastructure costs. Here's something else to think about. Every year with my students in water law, I have a blind taste test, and we talk about why do you buy bottled water? And they say, oh, it tastes better. Well, that's a matter of perception, and they can't tell that in a blind test. Oh, it's more convenient. Really? Driving to the store to buy bottled water is more convenient than turning on your tap? It's cleaner. No, it's not. Bottled water is regulated by the FDA. Tap water is regulated by the EPA. They test for separate things. 40% of bottled water is tap water. Maybe with a little extra treatment, maybe not. And then I say, why are you willing to pay 600 to 1,000 times more for bottled water than for tap water? And it's because of all these fallacies. So if you talk about willingness to pay, with a lack of public education, we're willing to pay 600 times more for water voluntarily. But if you dare impose that through government regulation and raise your utility bill 600 times, there would be rebellion in the streets. So I don't know what to make of that.
I'll follow up on that. I'll follow up on that. We talk about water being such a scarce, precious resource. How many scarce, precious resources do you know of that nobody has any idea what they pay for it? Nobody has any idea what the price of it is. You can walk around town and you can see it just being poured on the streets, on the sidewalks, right? There's a disconnect there. And it does often go back to this price of water that we see being charged by utilities is probably lower than what it should be. Now, sitting on the water board with 500 customers, every bill that comes in, $1,000 bill, I think to myself, that's $2 for me, right? Maybe we can put that off till next month. Maybe we can put that off till next month. Because there is this connection between the cost and my bill, and it's a really tough one to deal with. But the reality is those costs are there, and they're going to be there. We can deal with it now or wait till it is a really big issue, and as we've seen with some of the water quality issues.
And really, who's going to pay down the road? Our kids and our kids' kids, right? And so do we care about posterity or do we care about us? And, you know, human nature being what it is, in reality, we care about us at this point.
Yeah, I wanted to build on some of the some of the issues that Christine brought up relating to the regulation of drinking water. And I wondered if you could tell us just a little bit more about how the regulation of drinking water works, and in instances that have been, well publicized, such as Flint, Michigan, where the regulation has failed, who's legally responsible?
Just briefly to talk about Flint, there have been criminal charges brought against people for doctoring reports, non-disclosure, negligence, and it's been brought at this point against fairly low-level and mid-level bureaucrats. It's definitely an ongoing investigation. There's suggestions by high-level investigators that they're working their way up. There's some indications there might even be broad conspiracy charges if more than one person conspired to conceal bad test results. But, again, I think the lawsuits in Flint are necessary. They send a message. They hold wrongdoers accountable. But that's not a way to structure our system overall. It just shows that there's a breakdown and we're going to try and have a reset. But the question is, what should the reset be and what should be our normal system for distributing water efficiently, fairly, and at an affordable cost?
Building on that idea of equity or fairness, people need water to survive, right? There is, I think this somewhat makes water a little bit different than some other things that we buy, right? I mean, we need water to survive. And so along those lines, I'm wondering, is there justification for government to be subsidizing some portion of water use? And if so, what's the appropriate amount?
Yeah, this is a conversation that's now reached Congress. We have a program in this country to subsidize energy bills for poor residents. That program has been going on since the late 1970s, early 1980s, when there was the Middle East energy crisis and the price of oil rose. There is no federal program for water bills. What you have now are piecemeal, utility by utility, state by state, county by county programs, where the laws that govern utilities and what they can do to provide assistance are different in each state. Some states prohibit utilities from cross-subsidy, from charging more for higher volume users or for richer people and using that to subsidize poor families. Some states do allow it. Some states partner with a private organization to provide low-income assistance. Some will say if you want to donate an extra portion or extra couple dollars per month to go into a fund for subsidy. So it's a conversation that's happening on multiple levels. There is arguments, the economic argument is that water bills should do what water bills are supposed to do, and that's recover the cost of your water system and put a lid on how much water is being consumed by a high price, and that other forms of government should be the ones that provide the subsidy. So it's a conversation about how best to go about subsidizing that. Congress has enacted the bill that was introduced by a representative from Ohio, is still in committee. It's not going to be heard at all, so it'll come up again next year, I'm sure.
I want to maybe I don't want to speak on your behalf, Andrew, but I want to draw maybe a distinction between economics and finance. So economists are very picky about how we use the term economics because I think most people think of economics and they think finance, and that's just an Excel spreadsheet with Excel sheet with costs and budgets and profits and margins and whatever they do. I'm not sure. Economists take a much broader approach to looking at resource allocation, and we try to, especially the field of environmental and resource economics, take into consideration a broad spectrum of values and think about how society values water in different areas, values energy in different areas, beyond just the cost of the infrastructure. So when I say there's very little economics behind most rate designs, it's because I don't think that a lot of the things that you're discussing are actually thought about and incorporated into those rate policies that are there. So in terms of equity, as I said earlier, there's a big push for these increasing block rate structures. And essentially, part of the motivation behind that is a desire to raise prices to discourage water use, but also to recognize that there's a certain amount of water that we feel is necessary for indoor use. So the way these rate structures are typically put together is the first block, as you'll hear them referred to, is designed to represent loosely what the average household uses for indoor use. So say the first 5,000 gallons a household consumes will be $2 per 1,000 gallons. And then the next say 5,000 to 10,000 gallons of water will be designed to reflect what they typically use outdoors, for example. So these increasing block rate structures are one way that people are trying to get at. There's certain types of uses that we think people should have access to water for those uses at a cheaper price than in general.
And beyond those concerns for the amount of water that's used, as we discussed on our first panel, infrastructure concerns are really important. And I think a great phrase we can add or be mindful of is infrastructure equity. And that is that low-income and vulnerable communities have poorer infrastructure sometimes than others. And the EPA has started a program under that title, Infrastructure Equity, and at this point it has to do with a state revolving loan fund, but at least it's some federal recognition that we need to think about equalizing the delivery mechanisms among communities, as well as charging appropriately for the volume of water used to meet basic necessities, but not to waste the water.
Just kind of following up on that a little bit earlier, the comment was made about even if we make certain devices free, so the filters on the taps, that we may not expect everyone to utilize them. I think there's a big gulf in the sophistication between large water utilities and special districts or rural water authorities, and it's a huge challenge. Our water district, and it's not that uncommon from other small ones, it's volunteers helping out one night a month to help. They don't have the sophistication, we don't have the sophistication to know that these programs exist oftentimes, or even know where they are. And so there's a big gulf between kind of getting those resources, getting the information about those resources that are available out to these rural communities, these rural water districts, which, to be honest, just don't have the sophistication.
Well, I do want to make sure that we have enough time to get to some audience questions. So I think at this point, I'd like to see if there are any questions out there that anyone would like to ask of the panelists. Okay. In the front here, I guess. Yeah.
Hello, my name is Paul Schwartz, and I was the former National Water Program Coordinator for Clean Water Action for 20 years. Working on the issue of innovation and water integration. And isn't it true that we're behind the rest of the world in, maybe in Milwaukee we're talking about being a water resource center, but in employing the best practices and the best ways of looking at how to do natural system sort of utilities to pull out the energy from water, to pull out the nutrients from water, to pull out, to not look just at wastewater, but wasted water. And that if we really invested in an integrated water system that was going to solve the resilience problems and the public health problems, we'd be looking at how to reinvest the 90 cents out of each dollar that comes out of the public's back pocket for water infrastructure in a way that provided more community benefits, more jobs, faster and better solutions with a bigger palette of built and natural solutions, and that would result in an abundance for our communities and change the economics in this broader sense that you addressed, including the public health economics that we were addressing around these sort of historic run to failures and historic infrastructure problems with lead. So instead of pouring money into the 19th and 20th century failing systems, redesigning and rebuilding and thinking about the resource flows into our communities and the waste flows out of them to change the whole system altogether. And I just direct that to whomever, because we've talked about the old structure and not building for climate change and for health and protecting the planet in a new way.
Yeah, utilities in general are conservative institutions, to say the least. They provide an essential service. And so any sort of innovation or tinkering with the tried and true is met with a heavy dose of skepticism and a raised eyebrow. If they've seen it done somewhere else and it worked there, then more willing to try it. But to take your entire wastewater system and go full scale into a fully green infrastructure with swales and wetlands to control flooding, that's a big step, a huge step for a water utility. So there's small steps that are being made for sure. So there's the East Bay Municipal, thousands of examples, but one in East Bay, California, they're getting almost, I don't know how much, but they have biogas digesters, and they're running on power they get from the sewage. So there's more of that. The wastewater industry doesn't call itself wastewater anymore. They call them resource recovery. And so, there's a tremendous amount of stuff to be recovered. So you have phosphorus and all these nutrients, and there are systems out there that do that, and some of the utilities are taking that and selling it as a product. So utilities are kind of reworking themselves as a service provider, providing technical support to smaller utilities. So there is this big discrepancy between a big municipal system and these 500, 200 person rural systems that do not have the knowledge or technical skills to be able to do this. So there's outreach from larger utilities to smaller. There's larger utilities saying, we have a resource coming in that we're going to capture and use. Not all of them are doing that, but the technology is out there that more and more are starting to use.
So when I hear you say research, innovation, we're all academics here. We love that. That sounds great to us, right? Undoubtedly, some of the blame is on the institutions and the laws that are in this country. In water, they're very slow to evolve. You hit the nail on the head. They're conservative. No water manager gets fired for doing things business as usual. They get fired when they mess up, right? That's not surprising. Some of the blame needs to go on customers as well, though. Right? At Colorado State University, there's an outstanding researcher, Sybil Charvel. She's been trying to look at alternative things to do with water reuse and extracting energy, a lot of things that you're talking about. The laws in Colorado are such that we have to worry about return flows, the water that, Western water, that's complicated, right? She's tried to just get trials, right? Years to try to get trials on the books. And it's not just the institutions that push back. It's citizens. It's downstream farmers. It's people that don't want change. At CSU, we have a pretty good relationships with Fort Collins Utilities, and we've tried to do experiments with rate structures that might be more efficient or often offer certain equity advantages to the rate structures we have in place. Don't do that. Don't make me a guinea pig. Don't try things on my household. Don't innovate is the comments that we hear an awful lot. So it's not only the institutions that need to evolve, but it's our thinking as customers of water utilities that we need to be open to and embrace evolution in our systems when it's an option.
I've seen a hand up in the back there.
When I hear you talking about the market as something separate. I mean, isn't a market just one way of rationing between those who have the money and those who don't?
I think I shouldn't be the only one who answers this, but the way I talk about it, and from my principles courses all the way up to the graduate level courses, we get confused with markets, that there's something inherently good or bad about them. Markets are an institution that we can utilize to to allocate scarce resources.
Which is which is a way of rationing.
Yeah. Sometimes they work, sometimes they don't. And in the case of water, when, for example, when we're talking about water rights, there's a lot of complexities to water rights, which suggests that water markets may not work the way that we hope that they do.
Yeah, and as Chris kind of indicated earlier, there are entire subfields within economics, of which we belong, where we're trying to identify the places where markets do not necessarily function that well and try to think of ways where maybe there is room for government intervention and how they can improve the outcome.
As a profession, and you could do a lot to inform the public that markets are simply one way of rationing, one way of allocating, and not something fundamentally about rights.
I agree, and I try to do that, and I think most of environmental and resource economics is about kind of understanding when markets work and when they don't work. And the question becomes, if you don't utilize a market, what do you use? I mean, one option is to put me in charge, let me decide who gets what. That probably isn't very popular. So then the question is, how do we allocate things? And that's a large part of what a lot of research in this area is dedicated towards.
Yes, sir, in the yellow.
Part of the issues are ownership about the environmental costs, not to the consumer.
But to the poor animals and the wildlife that are living in the vicinity of our water supply, and we pump it up and we take it away and we destroy them. I wish you would
Speak to the effects of fracking, the costs of factory farms of pollution, and cementing over our good farmlands so that the normal cycle of water does not take place. Our wetlands, when we can exchange even those we protect, now it seems they can be exchanged. A piece here that's needed for industry can be exchanged for another piece. That isn't what nature needs. We need to protect the environment, and I wish that's the cost you'd really speak of. We beat Perrier when they wanted to come in and take our water in Wisconsin, but this is a fight all the time. I wish you'd talk to it.
Well, so when we talked earlier about the cost of water, one of the reasons I was on your bill, one of the reasons I was trying to point that out is that reflects the cost of delivery and treatment, right? Undoubtedly, there's other costs that you mentioned when I pump water out of the ground or when I divert it from a stream. There's environmental impacts. There's any number of things. And those are not on your water bill. They're not.
Let me give one example. In Florida, we have the biggest collection of springs of just about any area in the world. So we have beautiful spring-fed freshwater streams, just crystal clear streams, or they were. And we have a lot of groundwater pumping. And what we're learning is that the groundwater pumping is drawing down the springs. And there is a connection, of course there's a connection between groundwater and surface water. And so there's been a big fight over, whether we should keep issuing permits. And so far it seems that the push is to keep issuing permits. But the cost of drying the springs is not just a touchy-feely kind of environmental thing. Florida's economy, if you want to, talk dollars to dollars, Florida's economy is based on tourism, which is based on the beauty of our natural environment. I'm sure Wisconsin has a similar value from the tourism dollars. So that's always the problem with the cost-benefit analysis, is that there's no ready market for environmental values. So it's easy to emphasize the cost of regulation, but it's hard to put a price tag on what's the value of a beautiful stream, of a healthy environment. And so we have to learn to speak dollars to dollars and quantify those benefits, even if that isn't what feeds your soul. So you have to talk dollars as a matter of strategy to play the game, to balance against the cost of regulation.
Sorry, in the yellow. Yeah.
They say we fought wars over oil. Some are predicting we're going to fight wars over our water. Do you believe that's going to be happening? Maybe not in our lifetimes, but our children or grandchildren, no?
We were just talking about that.
Yeah. Water wars is a very powerful rhetorical term. Researchers at Oregon State have looked back through the decades and tried to define what is a water war. And water war between countries, it never happens. There's more often cooperation between countries over water. So that gives me hope. And two, I think the bigger concern is local for conflict over water, where you have an individual whose water supply might be cut off, who has their livelihood at stake if they don't get that water. Whereas a country, the calculus is a lot more complex. But you do have cases of farmers, say in India, going, dying in struggles over irrigation canal rights. There's water being used as a weapon of war, so water infrastructure targeted in, say, Syria in bomb attacks. But as one country invading another and sending a military in to occupy another country for a river, it's much more indirect than that. There is conflict, yes. There is violence, more local level.
So I've had students that serve as ditch riders, so they kind of essentially follow where the water goes and stuff. And I've had at least one student who's had a gun pulled on him, if that counts. But in the United States, I mean, water's free. I mean, we're pretty far off from water scarcity in the context of some of these areas, that in the context of some of these developing countries where clean water isn't available and you've got to walk miles to get the water that is available. I mean, water's free here.
Sir.
When it comes to water bills in Wisconsin, we're kind of unique in the way that we regulate water prices. And we take into account the financials that you had talked about, what's the cost of the system and the distribution. But we also are required to look at conservation as a part of those bills. That's a part of the system. So people in Wisconsin should know that in their water rate bills, the utilities are required to say, is there a way we can optimize the use of that natural resource rather than just putting in another well or finding another source. And so I'm just curious, I think that's a pretty good strong regulatory point and system, and I'm wondering how much you see that in other places.
So to play devil's advocate here, so if I understood correctly, for Milwaukee, for commercial customers or the people that are on a quarterly bill cycle, and I apologize if I missed this, they still have declining block rate structures? I could be wrong.
In the city of Milwaukee, there probably still is. We have many utilities around the state that have moved to either flat or inclining blocks as well. That's something that we've worked towards.
So there's this tough kind of transition period from the, and you see a lot of irrigation districts still using those, from that sort of mentality of providing water at cost. The more water you provide, the cheaper the average cost is in a financial sense, to this push for conservation. A number of states, and I'm familiar more with the kind of the western states, have adopted state water plans or conservation goals. Colorado's adopted a state water plan and a conservation goal. The issue now is that there's no funding for that state water plan. Right? The other issue that I've seen an awful lot of, and I've surveyed a number of utilities, large utilities in Colorado, is the disconnect between the water planning, so the vision of where we're going to get water and all this, and the conservation departments. And you'd be surprised how many are completely separate. Conservation efforts, rebate programs that aren't built into the water demand forecasts, completely separate. So I applaud the state on that. I think there's a long way to go.
And I guess that was my point, is we talked a lot of time about what's on the water bills here, and a lot of those things are included, and we require those of the utilities as a part of new capital investments and things like that.
I believe we've reached the end of our allotted time here, but I do want to sincerely thank the panelists for their insights.
Okay, welcome back. I hope you are enjoying your lunches, and please continue to do that. But in order to keep us on time, I want to get moving with our lunchtime presentation. And to deliver the introduction for our keynote speaker, I'm happy to welcome Dr. Jean Hassenlop, our Vice President for Research and Innovation, and also a Professor of Chemistry here at Marquette. Jean.
Thank you, Dave. Well, I'm delighted to be here to introduce our speaker, but before I get into the formal part of the introduction, I'd like to spend just a couple of minutes talking about why this conference and this topic is so important to us here at Marquette University. Several years ago, we launched a new strategic plan for the university, which highlighted research and action as one of its key themes. Addressing the world's most pressing problems and creating graduates who will be problem solvers and agents of change in the world are central elements of our vision for the university. Our strategic plan also calls for research excellence in strategically defined areas. Now, for those of us that work at a university, we understand, as you might imagine, that defining these areas of focus can be challenging. We have a wealth of scholars in a broad range of disciplines, each of whom feels that her or his work is the most important work of the university. But what's really been interesting is that water-related research has quickly risen as a top priority. With President Lovell's leadership, the university created a new strategic innovation fund to help launch creative efforts of our students, faculty, and staff, and to move the university forward in new directions. In the first two rounds of the Strategic Innovation Fund competition, water has quickly become a defining theme, with research projects bringing together our environmental engineers and scientists, educational outreach programming around water issues for the students who participate in our Upward Bound program, increased policy work through the expansion of law school's Water Law and Policy program, collaboration between the Colleges of Education and Arts and Sciences on water issues in Kewaunee County, and even our Haggerty Museum of Art's support of a new public art project which will be mapping out significant water sites in Milwaukee. We've now occupied most of the sixth floor, as you heard this morning, of Milwaukee's Global Water Center, a site that provides unique opportunities for collaboration among universities, established water technology companies, startups, nonprofits, and government, all focused on solving the world's greatest water challenges. I'd also note that Marquette and the University of Wisconsin-Milwaukee lead many of the research efforts through a National Science Foundation, Industry University Collaborative Research Center on Water Equipment and Policy. And as a special note, given our conference here, the expansion of the Water Law and Policy program, and in fact Dave Striffling's leadership in so many of these activities, as well as organizing today's event, have been a critical element in our ability to expand the university's capacity in water research. I'm grateful for Dave's work, as well as the dedicated effort of our students and faculty, many of whom are here today. Now it's my true honor to introduce our lunch session, where we are going to reflect on the lessons learned in Flint. The session will start with an address by Mark Edwards, and following that, Mike Goucher, our distinguished fellow in law and public policy, will moderate the discussion, which I imagine, given the discussions already taking place today, will be quite lively. Our keynoter will be Professor Mark Edwards, the Charles P. Lunsford Professor of Civil and Environmental Engineering at Virginia Tech. As you all well know, Dr. Edwards has a distinguished record in tackling lead contamination in drinking water, including some really critical work on the water system in Washington, D.C. He received a MacArthur Fellowship in 2007 in recognition of his vital role in ensuring the safety of drinking water and in exposing deteriorating water delivery infrastructure in some of America's largest cities. As the MacArthur Foundation noted, his work in the lead crisis led to publication of a landmark paper documenting the harm to DC children resulting from government agency negligence. That work, in turn, triggered dozens of newspaper stories, congressional investigations, and hearings into the Centers for Disease Control's misconduct, as well as numerous awards that recognize his personal contribution in this, including an Outstanding Science paper in Environmental Science and Technology, a Praxis Award in Professional Ethics from Villanova University, and the first ever IEEE Barris Award to a university professor for defending the public interest at great personal risk. But he didn't stop there. In 2015, when he heard from Leanne Walters, a Flint, Michigan parent who was frustrated with the lack of response from state and local officials when she reported that there just simply must be something wrong with the water coming out of her tap, Mark Edwards once again took on the challenge and the personal responsibility for attacking the problem of our nation's water systems. He committed himself to once again doing science in the public sphere for the public good. There's an interesting recent piece in the New York Times Magazine from just this last August 16th that really reflects on how challenging and complex the issues are and how difficult it is to take on these significant issues of public health when there's so many stakeholders involved in them. And so I'd invite you to take a look at that to see a little bit more about Professor Edwards' work in this area. And with that, I will ask Mark Edwards to come to the stage and tell us a little bit about his reflections on the situation in Flint.
Thank you. I'd like to thank you for this opportunity, especially Marquette, for having me and telling the story, really the journey of Flint residents over the last 18 months, to put it in some perspective. And let me also apologize that I'm undoubtedly going to ruin all of your appetites here, and I wanted actually barf bags distributed, but the trays could double as that if you ever have to. But what I think first and foremost about Flint is it really revealed, as we all acknowledge, a dark side to U.S. drinking water policies. And to understand this, I'd like to go back a little bit in history so you can understand how it is in 2014 something like Flint, Michigan was inevitable. And we're actually going to start with the Romans. The Romans were the first to deliver water in quantity, and when I go on vacation, I drag my family to view these ruins and the British Museum to see the lead pipes. You cannot support civilization without properly operating potable and wastewater systems. It's simply not possible. And when the Romans neglected their infrastructure, their aqueducts, the population of Rome dropped by 95%. The Romans also were on the ball when it came to water quality. They were the first to recognize that if you wanted to have water that's safe for drinking, you could not use lead pipes. Vitruvius figured this out, 300 BC. And they also got around this by noting that if you did have lead pipes, never ever let the water sit stagnant in there, or else it will create more problems. But unfortunately, the world entered a dark age. The knowledge of the Romans was lost, and you fast forward 2,000 years, and it was possible to see advertisements like this in National Geographic magazine, talking about the health benefits of installing pure lead pipes in your walls, in your houses, to give you the best in sanitation, and bragging about the fact that in some cities today that the law requires that you use a lead pipe to connect your house to the water main. This was bad law. Consumers that have lead pipe today, by and large, did not have a choice in the matter. In fact, we just reviewed Milwaukee's history on this in 1880. A lead pipe was required unless you went to the trouble to prove that your pipe material was as good as a lead pipe. Who's going to do that? So this is a government-caused problem. These lead pipes are there not at the choice of the consumer. We did have knowledge that lead could endanger people, and this is the situation, as the mayor pointed out today. There's
there's no lead in the water that goes down the water mains or leaves the treatment plant. It's picked up in these lead pipes, lead in brass, or lead in homes. And through 1991, we had a law that actually put a maximum amount of lead allowable in the water, an MCL. But here's the great thing about it. They measured it in the water leaving the treatment plant. The very spot you're not going to find any lead. What's the point of having a law if you're not going to measure it where the danger occurs? So in 1991, we actually came up with a law that for the first time in U.S. history required testing of a contaminant to the tap. That's the 1991 lead and copper rule, and it's one of the most hated rules in the water industry because for the first time it did make that requirement. This decision to use lead pipes in many U.S. cities triggered one of the worst environmental disasters in U.S. history. This is a book called The Great Lead Water Pipe Disaster by Werner Troskin, and in it, he documents that this occurred not only in the United States, but also in Britain and France, wherever lead pipes were used, that death, miscarriages resulted, and really, as a result, what happened was 150 years of death, deceit, and denial by government agencies that they had caused this problem. And that pattern of death, deceit, and denial continued through the Washington, D.C. lead and drinking water crisis. Now, this was a time period of high lead in water in our nation's capital. It is now listed as one of the world's public health disasters and tragedies, and if you don't trust the U.S. Congress as a source, Wikipedia also says that, so it must be true. We think also that during this time, based on our latest research, that about 2,000 children were not born because lead induces abortions. It was actually the first way of controlling family size about 150 years ago. And the glasses of water that consumers in D.C. were drinking had more lead in it than abortion pills at the turn of the century. We documented higher incidence of fetal deaths, and thousands of children, age 1 through 6, we now know, had their blood lead elevated above CDC's current level of concern, 5 micrograms per deciliter. And this is an interesting case study because it represents misconduct by government agencies, scientists, and engineers. In other words, the very people we pay to protect us betrayed us. The environmental policemen, they were the environmental criminals, and they caused this to occur. And unfortunately, we never learned anything from this tragedy because the government agencies involved worked overtime to cover up this problem, and they did so very effectively. In this case, the Centers for Disease Control came into town and wrote what we now is a completely falsified report that literally claimed that not a single man, woman, or child in D.C. drinking that water had blood lead elevated above CDC's level of concern from the water. The CDC knew that it was misrepresenting the data. They knew about forged data. They knew also that some of the children that had high blood lead that might have been obtained from water were thrown out of the study. But it took 6 years of effort by myself and some of my colleagues in Washington, D.C., and one of them is right here, Paul Schwartz, here today, who went this journey with us, and it was horrible. I would not wish this on anybody, this 6 to 8 years, where no one would listen to us, but we ultimately got a congressional investigation, and the bipartisan conclusion was that this report was scientifically indefensible. And in addition to that, during this time, we also showed that the U.S. EPA, the water industry, and local public health agencies also falsified reports to cover up the harm that was done and to claim that this partial or half-pipe replacement idea, which is one of the stupidest ideas in human history, was actually a huge benefit. And it was only after congressional hearings this year that EPA finally took that false report off their website. They admitted they never had data for the report. It took us 8 years to prove that and get them to acknowledge that. So which brings us to Flint, Michigan, 2014, 2015. And people ask me, how did you know, what made you intervene in Flint? And after D.C., it was because We knew that if you do not learn from your mistakes, you're bound to repeat them. And what the agencies learned in D.C. was, frankly, they could get away with anything. Not a single perpetrator of that crime was ever held accountable. The only people who were fired were whistleblowers who tried to alert the public to the harm that occurred. 5 whistleblowers laid down their professional lives to protect D.C. residents and to get to the truth. They were fired. The environmental criminals that perpetrated this crime kept their job to this day. And so when we got the call in Flint, Michigan, I knew that this day was inevitable. I'd actually saved up and planned for this day. And I think it's an even greater betrayal in some sense because in D.C. you do have people with power. During that time, there were questions of President Bush at the White House press conference. Were you drinking too much lead in your water? There was high lead in the Congress, okay? But people in Flint, Michigan, they were powerless and no one was listening to them. So just to give you a superficial overview of what happened there, this started innocently enough, like most engineering and science disasters. We tried to do something good, change a water source for a short period of time. Someone forgot to do their job. What did they forget to do? They forgot to follow federal corrosion control law that says you have to add an inhibitor to the water to keep lead on the pipes and out of the water and protect your infrastructure. This is the law. Someone didn't do that. So here's the famous toasting. This is a historic day for us. That proved to be true, not quite for the reasons that they thought. And Flint residents almost immediately knew something was amiss because it became common knowledge that if you took a bath or shower in Flint, you were risking your health. And this is the kind of thing that was on social media at the time. Why am I in Flint not able to take a bath in my water? I've got to take a bath in bottled water. And people were complaining. This is Leanne Walters, Hero Mom, a good example of the courage exhibited by Flint residents. This is the water that was coming out of her tap. She would take it to the city, complain about it, and they would say, sorry, that's just iron. That's an aesthetic concern. There's no law that protects you from that. Little did we know at that time it also had hazardous waste levels of lead and Legionella, but she was told, this is your water, and you will like it. And she got involved with a great EPA employee. Most EPA employees are amazing people. They want to do their job. One of them was Miguel Del Toro, and he heard about this story from Leanne, and Leanne had figured out one of her children had been lead poisoned from water because she had twins. She had a living experiment in front of her, and one of the children was growing slower than the other. And she wanted to know why. She looked for lead in the blood. The child that was growing slower had elevated blood lead. She figured out the source was her water. She figured out that the state had lied to the EPA in writing about the fact they had corrosion control and this problem was under control. Leanne Walters, Flint residents, did all of this on her own, which proves to me one of the greatest scientific forces in the universe is a mother protecting the health of her child. Leanne was 10 times the scientist of the people who I'm about to trash before you. But Miguel is not one of them. Miguel heard about this. He is the foremost expert on the lead and copper rule in the United States. He wrote a note in April 2015 asking EPA to exert emergency powers in Flint to protect this family and the population. EPA knew that federal law was not being followed. In April 2015, his memo was ignored. He wasn't content with ending it there. He actually worked with us. We sampled Leanne Walters' house. We found the worst lead and water contamination in a home that I've seen in 25 years. I've seen a lot. We flushed her line 30 minutes, and it was still 500 parts per billion lead coming out of the tap, 50 times World Health Organization standards. Some of the water had 13,500 parts per billion lead. This is 2.5 times hazardous waste levels. drinking 50 milliliters of that water, one swallow, is enough to raise a child's blood lead from 0 to above the CDC level of concern. Miguel and I are plotting how can we get EPA to do their job. Miguel was putting his career on the line because the one thing that can get you fired at EPA today is doing your job. It's a proven fact. There's congressional hearings that show you can watch porn all day on your computer at EPA and not get fired. But if you look at scientists in EPA who do get fired, most likely the reason is because they did their job. But Miguel was near the end of his career. He threw caution to the wind. We're plotting together, like, how can we make EPA do their job and enforce federal law? This is June 2015. He wrote a memo that put it all on the line. It was released to the press, and Miguel made it perfectly clear that this was a pending public health disaster because Flint had no corrosion control. One child had already been lead poisoned. There's 50% lead pipes across the city. And unfortunately, after this memo was wrote, Miguel was told by the EPA ethics officer not to talk to anyone from Flint or about Flint ever again. Next day, he wrote a memo to his EPA colleagues saying, I'm really tired of bad actors being defended, bad actions being ignored, and people trying to do the right thing being subject to intense scrutiny, as if we were doing something wrong. I truly, truly hate working here. EPA is a cesspool. And so Miguel, he's off the case. Another whistleblower taken out of the picture. And so other EPA employees jumped into the breach. And here's an example of the type of person that replaced Miguel. Jennifer Crooks, U.S. EPA Region 5. Yep, another complaint about our favorite water supply, smiley face. Let me tell you, this Flint situation's nasty. People have called me four-letter words over the phone, yell at me, and call me a crook. I'm developing a thick skin. That's just what we need. EPA employees with a thick skin. No one like Miguel del Toro, no. People willing to be willfully blind, look the other way. And as a city is literally fighting for its life at this time, people are marching in the streets, children have rashes, this is the water that's coming out of the tap. Flint residents are being told that their water is safe to drink. And after Miguel's memo came out, the mayor of Flint read it, thought, hey, maybe there's a problem here in Flint. As mayor, I should do something about this. He reached out to the top cop in the region, Susan Hedman at the U.S. EPA, asked if there's anything about this he should be concerned about. She apologized for Miguel's memo. EPA stood silent as the state discredited him, called him a rogue employee, not acting outside his authority at the agency. And after hearing that from Susan Hedman, the mayor of Flint went on TV a few days later and told everyone that the water is safe to drink. And people blame this mayor to this day for doing that, but putting myself in his shoes, he did the exact right thing. He reached out to the right people, and he was lied to. And therefore, I'm going to defend what the mayor did. So at this point, I got really, really mad. At least my wife said, I believe her. And so, we decided to launch this intervention, this team that we had prepared because we knew this day was coming. We self-funded this relief effort for Flint, where we partnered with them. We ultimately, in the first few months, spent $250,000 of my money doing the analysis. We pursued science as a public good. What a concept. And basically, we declared war on unethical government science agencies in our unethical industry that I once belonged to, which is the water industry. And amongst the things we did, we allowed Flint residents to do the job that these agencies were paid to do but refused to do, which was to test the water to see if it was safe. And we very quickly realized it was not safe. It was a year ago today, as a matter of fact. I won't tell you the whole story. But within 8 weeks from the time we partnered with Flint residents to expose this, the impossible happened. We were told it could not possibly happen, that they could go back to Detroit Water. But they did find a way because they found the blood lead was rising in many Flint neighborhoods. And it wasn't long after that that people learned about what we felt from the start, which was an environmental crime had been perpetrated on the residents of Flint. And a federal emergency was declared, and funds were released. And to date, about $600 million has come to Flint to help with the relief effort. It's become the cause du jour of celebrities to donate water, and actually Flint residents have so much water in their house it's actually a hazard because some of their floors are about to break. We went into some of those homes last month, but children were tested for elevated lead in blood, and Flint is a disaster area right now because amongst the other things that happened as a result of failure to follow federal corrosion control law is they destroyed their water mains. And Flint currently has 100 times the main breaks of a normal U.S. city, and this is what a commute looks like in Flint today. And I can tell you right now that there's no way on earth that Flint can afford to repair the damage that's been done. We talk a little bit about how water is undervalued in this country. Just put this in perspective here. This is the rest of the world. Okay, Germany pays about $2 per cubic meter. The U.S., yeah. We're down there at 50 cents per cubic meter. Flint residents are currently paying the highest water rates in the country, $3.84 per cubic meter. Those water rates are projected to double in the next few years as they begin to address the damage to their infrastructure. Many Flint families pay more for their water bill than they pay for their mortgage. Okay? So at this time, my point in my career, I go, what on earth does it take to get someone fired from a government agency because of, here you had this case where D.C., no one ever said sorry, no one was ever held accountable. Flint, all these bad things happened, but then something interesting happened, and I'll play it for you here, if I can.
The saddest thing about this leak is how little it would have cost to prevent it all.
The fix was about $100 a day. All of this could have been avoided for just that small amount of money.
$100 a day. Why didn't you say something? I want to call out to all my people in Africa right now watching the Daily Show. Because my friends, for only $100 a day, we can save a village in America and get these people drinking the water that they so badly need for just the price of 5 cups of coffee in New York.
All right, now you're getting serious because the U.S. is now becoming an international embarrassment, right? So heads have to roll. Susan Hedman resigned the next week. To date, there's been 9 civil servants indicted so far at the Michigan state, and more indictments are going to be following for the Legionella outbreak that occurred. People started looking under rocks about what was happening in other U.S. cities, and something slimy crawled out in every case. So The Guardian did a study that showed how big cities all around the country were cheating on their lead monitoring to make lead in water look low when sampled for EPA regulations, but it was high when kids drank the water. CNN did an expose showing thousands of U.S. systems were still exceeding the lead action level despite the cheating. And yes, you look again, and lead is high back in the Congress. So if you're wondering in this election year why half of our government seems insane anytime, there's your answer. Lead has been high in the Congress, probably forever, basically. So maybe that's comforting to some of you. I don't know. So why? Why the deceit? So I got some ideas. Governments have a really hard time fixing problems that they created. Another problem is there's absolutely no way to make money from exposing and fixing problems with lead pipe and plumbing because it was a government-caused problems. And at the same time, we have a lead paint remediation mitigation program in this country that's a multi-billion-dollar a year government, private, and tort business. And you have, therefore, a massive conflict of interest, and there is zero chance ever that the danger from lead pipe will ever be exposed in this kind of climate when scientists and engineers have such a conflict of interest, even if they our government science agencies. And I have to say that Milwaukee has historically been a world leader in covering up water-lead problems. This goes way back to the time they were first talking about the lead and copper rule in 1989. Getting rid of that stupid law where you measure lead in the water at the treatment plant where you know you're going to find it. This study was published in 1989. Its conclusion was that household water in Milwaukee first draw concentrations above EPA standards of 50. Who cares? It may have little or no biological effect. It's one of the most biased studies I've ever seen, and this person actually argued that not only should we not have a new law measuring lead in water at the tap, but we should get rid of the old law as well. Just incredible. And this is feeding into this idea of we have to keep our attention on lead paint. And isn't it convenient that's where we also get all our money? Milwaukee, 2006, also participated in a HUD study. This is not that long ago. This is a decade. And this was one of the most disconcerting studies I've ever read. They were looking at where are people getting exposed to, children getting exposed to lead in water. The act of consuming tap water in Milwaukee was significantly correlated to the likelihood of having lead poisoning. Drinking 1 glass of tap water a day gave a child in this high-risk group a 45% chance of having elevated blood lead. If you drank 2 glasses of tap water in this high-risk group, your risk actually went up to 50%. This result was shoved into an appendix, barely mentioned, in order to keep the focus on lead paint and off water. Just incredible. But, you know, Milwaukee's doing a whole lot better today. I want to be the first to call out some of the positive things that are occurring. Obviously, we have further to go. But this, you know, if we're going to do these pipe replacements, by all means, let's not do it right. Let's not spend money to leave this problem for future generations. Let's not spend money to make this problem worse. And so I got to give credit to the health department, Carrie Lewis at Milwaukee, and also the mayor, because this is a state issue, okay? If this is not something that the state and federal government should step up and start funding, for the life of me, I don't know what it is. So we've written on this. This is one of the preeminent, I think, environmental justice issues that are out there, just in terms of who has to drink tap water, the risk factor from not being able to breastfeed your child and having to use tap water to make up infant formula in poor minority communities. This is why the dangers of lead in water are so disproportionately felt. And so this is another great advertisement from National Geographic saying, you know, the Roman Empire vanished, but those lead pipes are still there in the ground and able to function. And that is the truth. Unless we take those out, those will be there forever. And believe me, they will jump up and harm future generations. That is the story of lead pipe. And I just want to very superficially note that lead is just one of the best exemplars of our current problems, because we actually have a law that supposedly protects us on lead and water, but it's being ignored. And if we can't handle a simple problem like lead, where our knowledge about it goes back 2,000 years, how are we going to handle some of these more important emerging problems? It's really discouraging. One of those issues is Legionella, Legionnaire's disease. This is another environmental justice issue. Just to quickly talk about this issue in relation to Flint, again, this is arising from the fact that the Legionella is low in the water that comes to the homes, but it actually grows in your house. And if there's enough food in the water, you can get Legionella growing. And Flint also, on top of the elevated blood lead of many neighborhoods, Flint had one of the worst Legionella outbreaks in U.S. history that was caused by the exact same failure to follow federal corrosion control law. And I want to go over this mindset again of the state officials, because it's not limited to lead. 2014, they knew they had a problem on their hands. The city, county, state, and federal health officials knew that Flint residents were dying at abnormally high rates from Legionnaire's disease. And the MDQ employee said that we didn't want to make this public because it would inflame the situation, because the public is so concerned about the quality of their drinking water. No announcement was made. The CDC, who's the world's best in Legionella protection, they're actually great people there, wrote and said, we have to get on top of this outbreak. This is large, one of the largest we know of in the past decade, and it needs a comprehensive examination. This is 2015. The state responded by saying, what outbreak? The outbreak's over. And unfortunately, it wasn't. So if you look at that red line there, the outbreak had just disappeared in the winter during the colder months when Legionella doesn't grow, and it came back and it killed more people the following summer. And so when you hear about more indictments in the state of Michigan in the next few weeks, and you hear the word manslaughter, this is what's behind it, because people actually died as a result of this, 12 deaths. So we've got other issues. We've got a funding crisis that we all know about. Our infrastructure is failing. It's hundreds of billions of dollars, maybe $1 trillion. We've got old pipes in our homes that no one wants to talk about because that's the responsibility of the homeowner. But that bad infrastructure can also lead to lead and Legionella as well. And that's also disproportionately falling on people of lower income. We've got problems with unregulated well systems in the United States, where about 60% of the waters from wells are not meeting standards. And this is exacerbated. We're down in Louisiana right now, and these wells are contaminated, and people are not getting information on how to recover from fecal contamination of their well water. So with that, I'll just end this on a hopeful note. We did try to find the silver lining. We're all here today. We have to do better. Failure here is not an option, because what we're talking about really is one of the most fundamental cases of injustice that I think you could ever dream up, not just for what happened in Flint, Michigan, but Milwaukee, the post-industrial cities of this country, and also rural America is dealing with the exact same sorts of problems. All these people in infrastructure that have been left behind. So acknowledge some of my funding agencies, the people we worked with, and just open it up for questions. So thank you very much. Yeah. Yes, sir. I saved up the money because I knew this day was going to come, and we risked it all. We risked it all. I risked my career. Students, we volunteered 7 person years of effort through February of this year. And frankly, in a million years, I don't think the agencies ever thought anyone on this planet would do what we did. I think they're still kind of in shock. But we knew this was going to happen because, as I said, if you don't learn from your lessons, as we didn't learn from them in D.C., you are doomed to repeat them. Yes.
Did you have the full support of your university?
To the extent I was not fired, yes. Yeah. And that's, as a faculty member, that's all you can really ask for, We have academic freedom, but we professors, we're probably, I say it, we're probably the greatest generation of cowards this world has ever seen, because we are the last people on earth to exercise that. And I myself, I'm a coward 99% of the time. The world cannot tolerate anything less than that. Believe me, I walk the line, and I probably cross it a few times. So you got to pick your battles very, very carefully. But that is the danger of corrupt government science agencies, because of the power they have and the fact that we as professors are always sucking up to them. You will never hear, again, I think it's safe to say, another professor calling them out, as I did here today, and with good reason, because you're essentially committing professional suicide by doing so. But I'm sorry, I cannot live in a world where science and engineering, especially government science and engineering, is used to harm innocent children. And I will not stand by as that is allowed to occur. I will not. Yes. We do have a GoFundMe site. Yeah, that was really cool. So January this year, the emergency was declared, and we said, look, if you like what we did, give us money. And all these checks started coming in, and we've actually gotten back 90% of what we spent. Just, people giving us $50, $10, So, it always works out for me. I don't know. I guess I'm just lucky. And I really feel for all those people who do the right thing in this world. And the 99 times out of 100 that someone stands up, does the right thing, and they lose their job. And so I'm telling this story kind of in honor of them. Those people in D.C. who stood up, lost their job. No one ever said thank you to them. Because we don't value whistleblowers in this country. We do not. What we value is loyalty to your agency, loyalty to your institution, loyalty to your friends, and then somewhere further down on the list is loyalty to the human race. But even then, we don't like whistleblowers. We don't. And we're all paying a horrible price for that, people. We're really paying a price. Our children are paying a price. No one's kids are safe as long as EPA and CDC are allowed to behave in this way. And to this day, the EPA has refused to accept responsibility for what they did in Washington, D.C. They went to Congress. They testified that they had nothing to do with what happened in Flint, Michigan. They testified under oath that they didn't know if they could enforce federal law or not. They testified that the state strong-armed them. And as a result, the U.S. Congress actually passed a law, and you cannot make this shit up, people. They passed a law that said if EPA knows there's high lead in a city's water, they have to tell people. That's the depths to which we have sunk in this country, where you're passing laws to try to enforce common sense and get people to behave as human beings. And how we allow EPA to get away with that? No one ever thought that government scientists and engineers would ever behave this way with no profit motive whatsoever. There is no check and balance on their power. None. There's nowhere you can go to make them be honest and to make them face the consequences of what they did in Washington, D.C. and what they did in Flint, Michigan. Yes, sir.
Trying to tie together one of your end slides with a comment you just made in here. Private wells right now are nearly entirely unregulated. There you go. In the United States. There's a small amount of regulation regarding the sale of a home in Wisconsin as of October of 2014. Wouldn't it be political suicide for a regulator to try and introduce a requirement of private well owners to test their wells and therefore spend money they've never had to do before when they've never had to do it before? Wouldn't that person become a politician?
Well, we can argue. We can have a debate, and there will be people on both sides, as there always is, and, we'll either have a law or we don't. And I would personally, I think it would be a good idea. But, at the end of the day, we have these debates and we make decisions, and hopefully we decide to abide by those. One of the things that makes me so angry about what happened in Washington, D.C. and Flint, Michigan, is we have a law, and it was broken. Had the law been followed, what happened in Washington, D.C. and Flint, Michigan would not have occurred. And so, to me, it's kind of on a different plane. The people involved don't like the law, try to make me follow it. Good luck with that. So that's what makes the Flint story and D.C. story so especially troubling to me. We had the debate, it was decided, and the industry, the EPA, they just decided to ignore the law and cheat. Yes, sir.
Help me maybe help some other folks. What was the technical attraction of lead? Obviously, it had some technical, it was easy to work with or whatever.
It is literally the greatest plumbing material of all time, with the exception of the problem that it causes, it's a neurotoxin, and it adversely affects every system in the human body. And so when you make a decision based on engineering performance, without considering any public health implications, that's what resulted. And so it is a great plumbing material. It can deliver water in quantity. It has a lifetime, in many cases, of 3,000 plus years, okay? But 1 foot of a lead pipe, 1 foot of a lead pipe has enough lead in it to poison every drop of water above the current EPA standard that a family of 4 would use for 100 years. It doesn't take a lot of lead to do a lot of neurological harm. And so there you have the problem. Yep.
Thank you. Could you remind us who made the initial decision that they needed to change water sources, and what was the cause of that decision, and was it simply an economic decision to then not add the corrosion control to that?
Okay, so that's the $600 million question, and as you can imagine, no one wants to own that one. There were a lot of factors that went into that decision. At the end of the day, there was nothing inherently wrong with that decision. By the way, most people don't realize they had used Flint River water for 2 weeks every year. They had not used corrosion control during those 2-week time periods, and they didn't see the consequences because it takes time for that to wear off. So the idea of using it for a 2-year time period, given they'd used it 2 weeks a year to prove that it was a good backup water supply source, is not, it kind of shows that it's not inherently flawed from the start. And let me also say, if they had just followed federal law and paid that $100 a day to add the corrosion control chemical, none of this would have happened. The pipe leaks, the pipe breaks, the lead, the Legionella, none of it would have happened. It would have been a money saver as they originally projected. But the simple answer to your question is no one wants to, at this point in time, admit to being the decision maker on that switch. Yes, sir. We'll go.
Some time ago, I heard that lead in paint gives it a sweet flavor that children like, and they chew on the paint and eat it that way. Is that true?
Yes, that's true. And the Romans actually used to add it to their wine to help flavor it as well. So obviously, many people think the lead intoxication from pipes and adding it to all their food is one of the reasons the Roman Empire fell. But yeah, that's one of the reasons children like to, yeah.
I've heard it said that water in Flint, Michigan, in the river water had lead in it. And I've heard it said that no, the lead came because there's a high corrosive factor of the water, not treated. And that's where the source of lead was from.
Yeah, we measured lead in Flint River water. We didn't just look for lead. We did the most thorough independent evaluation of water in U.S. history. We looked for all opportunistic pathogens, DVPs. We looked for everything. No lead in the Flint River water. It had a little bit of arsenic, but it was removed by the treatment process, as is the case in many cities in the U.S. So the water from the Flint River might not look good, but given the treatment that they had, it could have been produced safe for human consumption, and they'd been doing it 2 weeks a year. Yeah, yes, sir. In the back.
The National Drinking Water Advisory Council has proposed to the EPA long-term revisions to the lead and copper rule. I would be interested to hear your thoughts about those long-term revisions to the lead and copper rule. I recently attended an AWWA regulatory convention here in the state of Wisconsin with Jill Jonas. They talked a lot about getting the lead out. I'd also like to hear your thoughts about what happens when we have partial lead service line replacements potentially for homeowners who cannot afford to replace theirs.
So as far as the NIDWAC recommendations go, as far as I'm concerned, if they are adopted, you might as well just tell people across the U.S. they're on their own. Okay? That law is the existing law is a total sick joke on the U.S. population. I mean, I don't need to say anything more, but in Flint, Michigan, where all this occurred, officially they never violated the lead and copper rule until after the state of emergency was declared. National Guard were walking the street, giving out bottled water and filters, and the state of Michigan and EPA could sit there and say, you never violated the lead and copper rule. And these proposals, largely in my opinion, reflect the agenda of the water industry. And just if those are adopted, just you're on your own, people. Okay, why don't we just tell people that? There's so many loopholes in there that it just made me sick to read it. The partial pipe replacements, one of the stupidest ideas in U.S. history, supported by these falsified EPA reports and water industry reports. If you doubt me, send me an email. I will document this. Giving it to Congress to claim that this harmful practice was actually a good thing in Washington, D.C., wasting money to poison children. Okay, you either replace the whole pipe or do not touch the pipe. That's my opinion, okay? And You know, I just don't know what to say about these people and my fellow scientists and engineers who really want to do this partial pipe replacement so they can claim that it's not the city and the government-owned problem. Yeah. Well, thanks. This might be the last time I'm ever allowed to speak in both. I never know, you know, when it's going to end, you know. Never know when it's going to end. Paul Schwartz, yeah.
I just, as an environmentalist and someone who worked for one of the big green groups in Washington, D.C. on drinking water policy for many years, I would say that the environmental groups who are on that advisory group are culpable and in bed with the water industry, as well as the environmental justice representative and the public health representatives. And they all sided with industry representatives out of Philadelphia and Boston and state agencies that had care over this. And that there was one lone voice, Dr. Yana Lambrini-Du, who sat because we bullied our way onto the work group. And that there is a very powerful dissent that you should look up and support in the public comment periods coming up in 2000.
Yeah, I'll second that. The dissenting opinion is the way to go. Yes, Ms.
It is so we could rile the troops up a little.
Oh yeah, you want any of this stuff? Email me. We're doing open science. Just take our stuff from our website. We'll just free. Yep. FlintWaterStudy.org. My email address. Just look me up online. edwardsm@vt.edu. Yes.
You have to do a lot of background work on sampling protocols and that sort of thing. Do you have a protocol that you would recommend for a homeowner with a lead service that feels they're at risk?
Yes, we do, but with the caveat that no matter how much I sample, I will never, ever say that that water is safe. In essence, what you're doing is you're drinking water through a 30-foot straw. And if pieces of that lead rust fall off into your water, and it might not happen today when I sample, it might not happen tomorrow when I sample, but it could happen when your child drinks water the next day. And so, to some extent, we have to sample because we have to do the best we can with the Band-Aid approach. We need to do better at that. But no one that has a lead pipe, I don't feel, can ever ethically be told that their water is safe to drink. As long as those lead pipes are there, it is a risk, just like how we treat lead paint in homes. As long as lead paint is there, it is a hazard. We have to take it seriously. Yes. Yes, sir.
Would anything like what in situ form does with slip lining, the mains, can that work?
Yes. Yeah, we have all kinds of solutions. You can blow in epoxy, line these pipes. These coatings last for decades at least. We know that much. Yes.
I talk with children globally about water. Flint is always brought up. What message or set of tools can I provide or be part of facilitating for K-12 education? They're our next-gen problem solvers. What can we do right now to accommodate their needs, their set of tools for what they're going to have to do?
Okay, so one of the first things you could do is look at the bright side. There's a lot of problems that we're going to need them to solve because our generation is not going to do that. Yeah, but I think just instructing them about the importance of water in our lives. I mean, we talk a lot about problems with water access in third world countries, and I would argue, given what I observed in Flint, Michigan, that it is far worse to have a water problem in a first world country because you do not have ways to adapt. What do you do when the water coming out of your tap in Flint, Michigan, by the way, you're paying the highest water rates in the country, and we now know that water was not suitable for anything but flushing toilets. That is a fact. And you can't boil the lead away. And that's what happened, is that civilization as we know it ended for 97,000 Americans. And they lived through hell for 18 months. And I can tell you, many of them will never drink tap water again, no matter where they live. They will never take a bath or shower again. And so in some ways, this is actually a worse problem. not to minimize what happens in third world countries, but for the trauma of going through this and being lied to by your city, state, and federal government, that is not something that's going to be overcome in the lifetime of many of these Flint residents.
With Mott Middle College. I was able to host town hall sessions virtually for students across the country to meet face-to-face virtually these high school students. And I feel this is the strongest story of all, is when a sixth grader from Chicago Public Schools said to a 16-year-old in Flint, "What can we do? We're in Chicago. What can we do to help you? Can we send water? Can we send money?" And do you know what this 16-year-old young woman said? "It's not about helping us, it's about helping you. You need to be involved in your community, vote responsibly, and stay in school and be educated about decisions you make. That won't happen to your community if you..."
Amen. Yeah, no, that's...
a 16-year-old...
This is one of the key reasons we need to recruit more members of these communities to science and engineering careers. Too many of us are willing to be willfully blind if it's happening to someone else, and it's just unacceptable. Yes, sir.
This is a little off the track, but the Flint River for years and years and years was basically a sewer dump. You could see raw sewage floating down the river whenever you crossed over the Flint River Park.
Right.
The Buick factory was nearly adjacent to the Flint River, and I'm sure there was industrial runoff of some sort, and AC spark plugs.
Yes.
Now, that led me to think that perhaps there were some difficulties that arose from this situation due to the soil underneath the water.
Right.
Maybe the water had been cleaned up, but how do you clean up the soil?
Well, we reproduced this in the laboratory, and, we tested the Flint River, and I know the Flint River has this bad history, and it's been a dumping ground, but the reality is that the water treatment that was being used at the treatment plant did remove all the contaminants to levels that are current federal concerns. So maybe that's not good enough. But, the point is the water was meeting federal standards that came out of the treatment plant. This switch could have worked. It would have worked if they'd used the corrosion control inhibitor. Yes, absolutely. Yeah, we measured the water when we went there, yeah. Far back, yes. I'm going to lose the mic.
Could you address what the incentives are here? From my own personal experience, I can understand working in a bureaucracy and just not wanting to call out. But you're talking, where are the incentives down? Who's making money, or who's gaining power? Nobody wants to do this.
So the first part is that there's no money to be made in this problem. Lead pipes are a money loser. Okay, you can't sue anyone to get these problems fixed, or at least no one's figured out a way to make that happen. And then
not taking care of the people in Flint.
Okay. What you have here is a culture of corruption. People ask me, how could something like Flint have occurred? And I only ask you to look at what happened in Washington, D.C., where good, heroic, ethical actors stood up, tried to alert the public, and they were fired. And the environmental criminals who perpetrated this crime and covered it up kept their job. And to this day, they have never apologized. Not a penny has been given to the children of Washington, D.C. or their families for the harm that was done to them. And I think it's one of the most fundamental betrayals of the public trust in U.S. history, frankly. But if this is how you run your agencies, okay, we can talk all day about ethics and following this code and that code, but if you fire good people and promote bad people, when something like Flint, Michigan happens, why are you surprised?
What you're saying, and I agree. They shouldn't have been fired. They were right. The people who were wrong were backed up the line and were a part of a culture. Whose culture? Who benefits?
Well, you know, I can tell you, frankly, it's all of our culture. You know, when EPA goes to Congress and lies and said they had nothing to do with Flint, Michigan, and nothing happens to them for such a bald-faced lie, we're all responsible for that, okay? They didn't apologize in D.C. They're not going to apologize in Flint. And let me just say, the normal EPA employees are amazing. I've seen them in Flint. They are killing themselves to help Flint residents recover. I can't say enough good about the frontline EPA employees. But when you have these corrupt agencies, and let me just say, you know, we're in uncharted territory here where if you look at projections of the federal budget, we have less and less discretionary money. And these agencies are fighting for their future funding. And this is creating financial incentives for them to look the other way when there are problems. So there's a lot of explanations, but I think it falls on all of us. Why do we allow them to behave in this way? Why? I don't get it. Yeah. Thanks.
Our last panel has to do with the privatization of water systems.
A little less intimidating there. I assume this water is safe to drink.
Yeah, well, I filled this up from out there. So
I knew it. I knew it.
Okay.
I didn't realize how
as I was starting to say, our last panel has to do with privatization of water systems. So a number of recent reports have addressed or identified the staggering costs that lie ahead for our water systems. With the AWWA's estimate of $1 trillion already having been cited today.
Anyway, I was at grad school.
Excuse me, 1 second.
70s, so.
They're moving the scrum off the field.
$1 trillion being the most commonly cited, but there have been other estimates of the same magnitude. EPA's says we'll have to spend over $300 billion over the next 20 years, for example. And of course, we've already seen several of our panelists struggle to identify where the money will come from to fix problems such as replacing our lead laterals in Milwaukee. Now, some have suggested that involvement by private entities, either in partnership with public entities or as direct owners of water systems, may be one source of those funds. And in fact, privately owned water utilities are a fact of life in many parts of America, with most studies estimating that in the range of 10 to 15% of utilities are owned by private operators. Now, this recently became of special interest in Wisconsin because during the last legislative session, there was a bill on the table that ultimately did not pass that would have eased the path to privatization for public water systems in Wisconsin. And I should say there is at least one privately owned water system in Wisconsin, in Superior, and I expect that we'll talk a little bit about that today. But so proponents of private ownership cite the increased cash flows and efficiencies stemming from private ownership, while opponents have raised concerns over increases in rates, the potential for monopolies, and the lack of transparency that sometimes go along with private ownership. So this session will explore what the ramifications are of private ownership of water utilities. So I want to introduce our guests. First, we have Kimberly Wright. She's the Executive Director of Midwest Environmental Advocates, a nonprofit environmental law center, and she has received a law degree and a Bachelor of Science in Rural Sociology from UW-Madison. So welcome, Kim. We have Richard Little, who is an infrastructure policy consultant. He's the editor of the journal Public Works Management and Policy, and he previously served as the director of the Keston Institute for Public Finance and Infrastructure Policy at the University of Southern California. Welcome, Richard. And finally, we have Robert Griffin, who's a professor of journalism and media studies here at Marquette in the College of Communication. And he's a fellow of the American Association for the Advancement of Science, recognized in part because of his research program in risk communication, especially environmental risks, and his investigation of the public's use of information to make risk judgments. So the format for the panel today is I'll ask each one of our panelists to make a short introductory statement of 5 to 7 minutes or so about their background and work in this area, and then we'll move on to some moderated discussion between the panelists, and finally we'll wrap up as we've done in the other sessions by taking questions from all of you. So maybe you could start us off, Kim, and tell us about your experience with privatization.
Sure. At Midwest Environmental Advocates, we support citizens that are working for all of our public rights in the water. And we don't do a lot of lobbying, so my part in this story is a little unusual. So I set up Google Alerts, even I know how to do that, set up Google Alerts on legislation because I don't follow legislation, as part of my job. And one day I was sitting at my desk and a Google Alert came up for a bill on easing privatization of our state's drinking water. First, our current law does allow the sale of public water supplies if a community feels like that's the best choice for them. But our current law requires a mandatory referendum, so this great public asset in a community, the people who own that asset have a say in its future. And also our current law requires that the Public Service Commission provide all of the information on the costs and the conditions of a potential sale before that referendum happens. So here I am at my desk and I see this bill, and it's at the end of last session where there were a lot of, in my opinion, assaults on our water through legislation, including a bad groundwater bill, you name it. So my good conservation partners who follow legislation as part of their work, I called people and said, are you working on this? And people were so embroiled in all of, fighting off a lot of other bills that no one was really doing much about this. So just to let you know, I wondered who wanted this bill. It was introduced by freshman Assemblyman August Tyler from Lake Geneva, and when asked, he said, well, and he received money from Aqua America, who ultimately wanted the bill, and he didn't really have a good reason. Also, the League of Municipalities had registered in favor of this bill, and that seemed really odd to me as well. So one thing led to another, and when I saw the League of Municipalities had signed on, I just started calling this informal but somewhat formal, it turns out, network of partners, but primarily citizens groups around the state. Your Good, Milwaukee Water Commons, that a few people, but then I got this call from an international organization, and I wondered how do they know about this? And it was someone that lives here in Milwaukee who's very active, but Corporate Accountability International, a group that works trying to reform World Bank policies that push privatization, had called me, and they ended up being really important. They right away, and all of this took place in less than 2 weeks. So right away, Corporate Accountability used their staff to hold regular conference calls, and we just kept bringing people in, mostly citizens groups. And so the bill had already passed the Assembly by the time I found out about it. So just from this kind of statewide, there were Facebook pages and lots of informal communications. And in my work, I work with people who have water problems all over the state, and they are, in my mind, champions, real champions for all of us. And they're people who have animal manure in their private wells. There are people who have heavy metal in their wells from the runaway frac sand industry in western Wisconsin most people don't know about. So all of these leaders, we just got everybody on the phone, and everybody called everybody, and just got the ball rolling. And by the time the Senate had their vote, one Senate office received 40 calls before 9:30 in the morning. And I have to say that journalists played an important part. Mike Goucher very early on had me on to talk about this bill when I really didn't know a lot about it. And then, journalists all over the state, Chuck Quirnbach, Susan Bentz, some of your own here, Lee Berquist, journalists started telling the story. And I think what really caught on is I don't know how much more cynical you can be to impact the publicly owned drinking water supply of a community without their consent, just to shove them aside and to do it on, at a corporate entity that makes a lot of money. I will say also immediately when people around the country heard about this, I had citizens calling me from Indiana and from North Carolina in particular, where Aqua America had taken over water supplies, a lot like some of the slides you just saw, where the cost of their water went up, 3- and 4-fold. And in one town in North Carolina, they couldn't use their water because it was so heavy in iron that it would ruin their washing machine and their dishwashers and stain everything they had. And they were told by the company that, just like you heard, we're not breaking any sort of standard. We're meeting all the drinking water standards. And, there wasn't a proper standard for iron. So at the end of the day, the story for me is both we have to be very vigilant and policy really matters for our water. But I also, we look at the world through this political lens and this legal lens. And ordinary people have an important role in protecting our water commons. And I see it every day in my work, but this particular incident really, really underlines that for me, that this was something so serious that people just got together, made it work, and it ended up being kind of a Cinderella story, but we certainly need to be vigilant.
Thanks, Kim. Maybe I could turn to you now, Rich. I know you've written a bit about privatization or public-private partnerships, and you haven't ruled them out entirely. Maybe you can say a bit about your background and if you think there are any situations in which they can work.
Okay, but first, a deference to my neighbor here. I feel like Ernie Banks, who just got thrown an 80-mile-an-hour fastball, and I have to do something with it. I agree with all that. But we just spent an hour listening to the care that the public sector took care of the water supply situation in Flint. So I don't think that there's magic in public or private, and which is why I'm pretty much agnostic on that. But now that I've said that, I've been around infrastructure essentially my whole career. I spent 15 years in local government back in Virginia, working on capital improvements and trying to figure out how to pay for them over long term. I was in charge of putting capital programs together, and I discovered that politicians have no stomach for long-term capital programs because it implies that the actions they take today may have consequences tomorrow, and they try to keep that a secret. An example of that is when we were doing this, one of our board members asked, because we were in a big building surge in the early 80s, we were building a lot of fire stations, libraries, everything. It was a very growing county at the time. They asked, well, what's the operating impact of this down the road? So a couple of us got together and scratched something up and, kind of figured that, labor, electricity, that sort of thing. Well, after a couple of years, we actually got pretty good at this. And not surprisingly, the numbers got pretty big. It costs, I'll pick a number out, I don't remember exactly back then, it was about $1 million to build a fire station, but you look 10 years down the road, and it costs a lot to operate that fire station. So with that information, we were told never to put those charts in the document again. So that's how we dealt with that. From there, I've pretty much spent the last, I'm looking at my numbers here, about 20 years kind of doing policy work around this issue. And it always comes down to why are we in this situation? Why do we have $1 trillion backlog for water? And I don't know if it's $1 trillion, it doesn't matter. I was saying to someone earlier, there's a law of large numbers in mathematics that I don't remember what it means. But in politics, it means if we throw out a really big number, we never have to address it. Because who can deal with $1 trillion? I was trying to figure out how many zeros is in $1 trillion. It's 12. But that's a lot of zeros to figure out how you deal with, so because we can't deal with it, we can't break it down into bytes. Even talking about the Milwaukee, the 70,000 homes, it's a lot more manageable if you divide 70,000 into what it's going to cost to fix it. But if you're dealing with $500 million or whatever the number is, it's a lot more difficult to deal with it, so we tend not to. So really where I've ended up on all this is we have this real crisis of not investing. And we heard from the panel before lunch about water pricing. Do we charge the full cost of water? And that's a very elusive sort of term, what the full cost of water is. Full disclosure here, I believe that every human being on the planet has the right to an adequate supply of pure drinking water. That's not debatable. But it's very difficult to work that into an Excel spreadsheet, as one of our earlier speakers pointed out. I mean, but if you go from that premise, okay, well, how do we accomplish that? Well, one of the ways you do it, we've heard a lot in the last couple of sessions about old infrastructure and why we don't have the money. Well, the problem is that as you build these systems, you don't need to replace very much early on. It's kind of like you buy a car. First 5 years these days, almost nothing goes. So utilities, particularly utilities that are controlled directly by local government. Now, I'm kind of used to two models. One is sort of the water authority model, which is a quasi-public but independent. Otherwise, you have them directly controlled by the city. They're in the line of the organization. Well, having these types of entities actually save money and put it aside for a rainy day. You know, you can't leave politicians in a room with big bags of cash that you're going to spend further down the road, because they will find something to do with it. Usually spend it next year and cut taxes and become heroes. And that's probably overly simplified, but that's one of the reasons why we generally don't have sinking funds to replace pipes 20 years down the road. It's not impossible. Some places actually do this. There are some, this is another announcement, there are water utilities, public and private, that actually have good sinking funds, and they take care of these issues. They are not in crisis. But overall, that's kind of where it is. The PPP issue, and I'll quit here in just a second, it really came to the fore back in the early 2000s when Dick Daley in Chicago sold the Skyway and Mitch Daniels in Indiana sold the toll road. And what they got were not even big bags. They got used trunks full of money. Daley got $1.8 billion. Daniels got $3.2 billion. They gave the concessionaire the road. Along with that, they also gave him the mandate, well, you run it, you fix it, you get to keep the tolls under a oversight sort of arrangement. Those were two extraordinarily good deals from the public side, because the concessionaires in both cases have gone bankrupt at least once, because the things didn't materialize. But it was seen as a way of generating money. The city of Milwaukee, I don't know if it was the current mayor, but I think it was based on when he said how long he's been in office, they were going to sell the water system back in 2008, again, for a big bag of cash, and they were going to turn the water over. I got involved because I was asked by the National Association of Water Companies to analyze the analysis that was done by a group called Food and Water Watch. And again, they were going to use that money to create a rainy day fund, if you will. And I had no view on that. I figured if that's what the city wants to do, that's up to elected officials. But I analyzed the report, and it was, they went in, Food and Water Watch went into the analysis with the idea that all private ownership of water utilities is bad, ergo this proposal must be bad. And they tried to do it by showing that the numbers were bad. It was a very flawed analysis, but it got me more and more involved in this. And what it comes down to, I don't think it's quite as important who owns the waterworks as how it's operated and what kind of oversight we have. I'll Sorry, I spoke 2
Richard,
minutes
not
too
at all.
long.
Thank you. I want to follow up on some of that, but first let me turn to you, Robert. I know that your research program has dealt with consumers' trust in institutions and how they process risks when they receive information, either from public or private institutions. So maybe you can talk a little bit about that.
Okay, I'm here. I'm not going to get in the middle between these two, by the way. I'm here for nostalgia, color commentary, and as warm-up act for Charles Franklin over here, who's going to give us more information later on. I'm going to shift just a little bit because of something that a number of things that Mark Edwards said rang extremely true. One of the first research projects that I and my colleague Sharon Dunwoody at the University of Wisconsin-Madison got into capitalized on Milwaukee's water woes in 1993, way back when. That was both a combination of the cryptosporidiosis outbreak in the spring, and at the time Milwaukee was working with the matter of lead in the tap water. There was a Milwaukee promotional saying at the time saying Milwaukee old world charm, and somebody came up with saying, yes, old world charm, third world water, and that got a lot of people's attention. So this, I think, will serve as background for all of this, including information on trust and so forth. We got a grant from the National Science Foundation and from the Environmental Health Center of the National Safety Council. The first one was interested in the cryptosporidiosis outbreak and how people reacted to that after the fact. And the National Safety Council was more interested in lead in the tap water when not many people really were. And they asked us to piggyback some items dealing with people's responses to lead in the tap water on top of this cryptosporidium study that we did. So we hired a firm to do a sample survey of 600 residents in the Milwaukee area to get information on their trust in the various agencies, where they seek information, what they do with it. Our research is a little different from a lot of research in that we're not so much interested in what information does to people. We're more interested in what people do with information. And that provides a whole different look at the system. So we did this study. It was in the summer of 1993. I can't believe this. This is nostalgia now, but believe me, it has some impact. And as Mark was saying, at the time, the EPA was mandating, starting in 1992, that water systems that had service areas affected by higher levels of lead, and Milwaukee did at the time, had to do public information programs, and that's about it. It was a little more complicated. They had to send information to news media. They had to provide information to various clinics and things like that in the process and provide a report back on how everything was going. So this was the scope of the public information effort. We were wondering how well the match was between people being aware of and sensing a risk from lead in the tap water, and for one thing, being in areas of the city where this risk was higher. Frankly, there was no match between the two. There was no correlation at all between being in a place where the lead service lines and lead pipes were higher incidents and people feeling at risk at all. We also found that all the public information efforts through the mass media and so forth had no relationship really with people's awareness or with their behaviors. There were a set of behaviors that people were given with lead in the tap water. Don't run the water before drinking it. Don't drink hot water out of the tap. Replace your service lines and things like that. What was interesting to us, and there's a theory that goes behind this in communication called diffusion of innovations. It's important to know about this stuff. That the one communication source that correlated best with people taking efforts to do something about lead in the tap water was people relying on health professionals, interpersonal communication. These folks had gotten this information and where possible related on to folks. Okay. Now that doesn't solve the problem of the fact that less well-off people and minorities usually have less access to health professionals. Among those groups, those who did rely on health professionals, that was for information, that was a big plus. But of course, some of these factors still remained. Some of the other things, though, as background for this, and then I'll kind of move on a bit to one or two other little things having to do with the cryptosporidium outbreak. When we were gathering information for this grant, this is all refereed publications. This stuff has all been refereed and published in academic journals. We talked to the folks at the Milwaukee Health Department saying, look, we're doing this study with a federal grant on lead in the tap water in Milwaukee. And they said, what are you interested in that for? It's paint we're interested in the most. And of course, I can see that being the case, but it was kind of a dismissal. You know, we're not that interested in it. So they gave us some information, and I suppose they couldn't see what was going to happen from that, but that rang very true with what happened. And the other factor, that gets a little bit more into trust and people's reactions, risk of any kind is it's uncertainty, it's amorphous. You can't, by taking a preventive action, it's difficult to see an outcome. All you know is maybe something didn't happen, things like that. So people rely on other sources of judgment. Typically in organizations and agencies communicating about risk, they'll give you some kind of a risk estimate on how likely you're going to become ill from doing like lead in the tap water, drinking it, or smoking, whatever it is, and tell you how serious it might be. But most people don't think that way unless they are deeply involved in the situation, and they'll think about that. Most people respond to risk on emotion, anger, and worry, or on their perception of what other people think or do. These are what are called heuristics, and they're ways in which we overcome uncertainty by relying on other factors that we can understand. One thing that happened with the combination of cryptosporidiosis and lead, this is all in the same survey, what was interesting is even controlling for social structural factors and so forth, and even though there's no relationship between these two, people who had gotten cryptosporidiosis were much more concerned about lead in the tap water than people who did not. It just transferred. The lack of trust in the water system in Milwaukee went on for years. And part of it was what the surprise element of what had happened when crypto broke out. All of a sudden it was there. So even people who felt efficacious, that they felt they knew what to do about lead in the tap water, they knew what to do if crypto were ever to break out again, they still felt fearful because they felt that the powers that be in charge would not alert them in time to this going on. So this is one of the factors that has to do with the trust. Trust is part of efficacy. We all require a sense of being able to protect ourselves. If we can't protect ourselves, which is the case in a public situation like this very often, you have to rely on others to protect you. There's an entire literature within risk communication which says that when that is violated by organizations who are trusted, the outcome, as you might expect, is what's known as outrage. People really get ticked off. And when that happens, frankly, they, to use the analogy, they shoot first and ask questions later. Information seeking stops, and they just go with their gut. So anyway, there's some background.
Very good. Thanks, Robert. I'd like to pose a few questions to the panel and open up the conversation here. First thing I want to do is follow up on something you said, Rich, as I indicated previously. You said something like, I'm agnostic on public and private. And so my follow-up is, maybe this is actually for Kim to start out, why do we care, public versus private? Why not just set the rules of the game and enforce them? And whether it's a public operator or a private operator, the rules are the same.
Well, the rules generally are the same, and I think that if we roll back 115 years or so, there was really a modern miracle performed. To a large degree, waterborne illness and death disappeared in this country because engineers, mostly engineers, but with public health people, figured out how to make clean water, how to separate drinking water from sewage, and remarkably, cholera, dysentery, a whole bunch of diseases just sort of disappeared. And we ran the systems for a long time. They became very large, as the speaker from Colorado State pointed out. There's enormous economies of scale in water systems. They got very big. They were the quintessential cash cows because there's very little marginal cost in adding things. And of course, if you look at big municipalities, they're always annexing because, oh, we can provide service. So we throw another 15, 20,000 people into the mix. The revenues that came in were enormous. And as I said, those revenues didn't go into 30-year treasuries, so that we could spend them when we needed them. They went into all sorts of things because what you do with a cash cow is keep milking it. Well, now we've gotten down to where it's kind of, Mark Edwards said this nasty word. Everybody's had their own shit moment. It's like, wow, this stuff's falling apart. We do construction and half the town gets poisoned with lead because we've just shook it through. We need to replace this. How do we do it? We don't have the money. The ratepayers are going to hang us if we try to raise rates. Well, let's see if we can do a concession. And we'll bring somebody in, and one of the things we'll tell them we want them to do is bring the system up to modern standards. Well, that $1 trillion deficit doesn't go away. We've got a revenue problem that PPPs are a financing solution. PPPs don't create money. They create a financing mechanism. You still need the money. And what the Brits found when they privatized all their utilities, the rates went up. Now, part of that might have been because there was profit seeking. I'm not going to say the private sector is all charitably inclined. But yeah, I mean, they're making system improvements. So they're making the right system improvements. We can parse that forever, but they're bringing the system up. I've always said about PPPs, if the public sector had done what the expectation would be, that if you're running the waterworks, part of what you're supposed to do is keep it in a good state of repair. Governments tend not to do that well. When I was at the National Research Council, we did a whole bunch of stuff on why the government doesn't keep public buildings up. Because they have no incentive to. It's money thrown away. You build a building and then you run it into the ground because you're not making money on it. And again, it goes back to money. So we've underinvested in these systems because we spent the money somewhere else. We want them, or we realize we have a problem, and to a large extent, I think, the public sector is seeking, particularly on these concessions of existing systems. I'm not talking so much about the 500 customers out in Colorado or Idaho somewhere, but these big concession deals is the public sector doesn't want to deal with it anymore. And, I was thinking this morning when we were talking about how to solve those 70,000 homeowners, that to me is more a financing problem once you decide what you want your policy to be. If you want to fix the problem, say you want to fix the problem, then there's a lot of smart people who can figure out how to do that. But if you're going to dance around with, it's not going to happen overnight. And none of this stuff happens quickly, but make a decision that this is what you're going to do. And once you do that, it gets a lot easier, but we tend to be unable to actually reach complex public policy positions. And that may just be a sign of our politics today, but that's the big problem with this. We don't know what to do. Well, it's kind of like give it to Mikey. Let the private sector figure this out. And there's no right answer. There's no right answer.
Kim, I'll let you weigh in on this.
Yeah, I don't think I'm agnostic, but I'm probably not that far away from you. The AB 554, the law I described, what's troubling to me is our current law gives great information to a community before a change is made. They have to know the costs and the conditions of any kind of sale. So I don't have enough, I'm not an expert. I'm not going to make that decision for a community, but I think the community needs to be part of that decision making. Mm-hmm. So the idea that a bill came out of nowhere and, was dropped and voted on, and there was no statewide conversation. That's what's concerning to me. But I also, from the stories that I've heard and just that I've read over the years, I'm really concerned about accountability. And if we do need to make a huge investment, I don't know where the room for profit margin is in there. And from the stories I know of community water, I don't know of good stories. I know there must be some positive stories, but I know, just talking to people about paying $400 a month for water and not being able to use it, those kinds of stories. So that accountability, if we can't hold our own government accountable, I think we have a little better chance there than we do a private corporation.
Robert, let me come back to you. I know that your research has looked at least a little bit on how our understanding of a risk drives our perception of that risk. And I'm curious whether your research showed whether ordinary folks really understand how water systems work and how that drives our perceptions of the risks that are involved.
I don't have that directly in terms of data. I think most folks are most interested in what comes out of the tap. This is just inferring from the things that we do know on this. The kind of thinking about a water system that would require a person to understand where the water comes from and everything else requires a very deep interest and a deep, what research is called systematic processing. And that is getting into the details, understanding them, using them to make a decision. Most of us, even though we hate to admit it, don't do that most of the time. It takes a lot of time and effort, and if we're cognitively efficient, we save those efforts for things that really, really matter. So if something with dealing with the water system has become very important to the individual for various reasons, it could be political reasons, there could be controversy about it, that will drive people, some people anyway, to try and learn more about the situation. What comes to mind when you're saying that is actually, it's not directly related to the water system in this way, but it was another study we did with folks here at Marquette, Vladimir Novotny, who used to be in the engineering department, Dave Clark, who's still in economics, and some other folks, having more to do with river flooding, another water issue, rather than tap water. And this was after the two 100-year floods in the late 1990s. Once again, we got a grant from NSF and EPA to take a look at this. Vladimir did stuff on the engineering part of it. We did public perception. And what particularly happened, if some of you who aren't from the area, the Menominee River, among other rivers, flooded during that time. There are a lot of reasons for that, having to do with the kind of banks that were there, with cement-lined banks and everything else, and the runoff of those springs. But homes were flooded out because they were built too close to the river and too close to the floodplain in places like Wauwatosa. And so there was a public policy concern that came up. Well, if these people are flooded out, whose fault is it? Is it theirs for building too close to the floodplain? Is it the managing agencies who should have done something before this to manage flooding? Who's at fault? And so part of our research looked at how people's perception of the cause, now this is getting back to what you're asking, if people understand how a water system works for tap water, maybe they can understand how things are caused. The same thing happened here. We're looking at people's perception of not only what caused the flood, but what caused people to lose their homes and things like that. And there are various rationales that people had, everything from blaming the Milwaukee Metropolitan Sewage District and the urban planning people to the people who built there, everything to just luck and climate and so forth. And these kinds of attributions come from different sources I won't go into, that people would, some of this is political, some are socially driven understandings. But what drove, in this case, anger is, and coming back to what we were talking about before, is when people attributed this to the lack of action by government agencies, that drove a lot of anger, a lot of outrage. Among that group, they were more likely to actually get active contacting these agencies, and letter writing at the time. They wrote letters at the time, it was way back when. So anger really propelled that kind of outcome. But if people understand, back to your original question, it would take quite a bit to get people to try and understand how a water system works. If they did, it's quite likely that their responses to waterborne problems may be tempered by that fact. But that's just a supposition in my head.
Richard,
and it just struck me that we haven't heard this term today, but it almost seems that the problem is almost more this idea of regulatory capture and the corporatization of government. When you've got legislators who will carry a bill that they probably even haven't read to the legislature because who's supporting them tells them to do it. I mean, that's a fundamental governance problem, and to me, so much of this public-private is almost a red herring that you get around, because I dare say if Flint water had been provided by a private entity, there would have been people dragged through town in chains from that water company and held up on the public dock to be shamed, because it would have been okay to call private people out for what happened. But as Marquette would say, I mean, nothing sort of happened. And the reason nothing happened is because what government does best is protect itself. I don't care. That's an apolitical thing. I don't care who's in charge. Government agencies tend to protect themselves. That's not what should happen. But it does, and it gets wrapped up in what's the most fundamental kind of thing. I don't think we'd be having this meeting if we were talking about cell phone service. It's not nearly as important to people. Or maybe it is. I don't know. Maybe we got a lot of Pokemon.
Depends on the generation, maybe.
But that's what it is. I mean, this is such a fundamentally important thing that has just gotten confused about who's in control. And even when we think the people who should be in control are in control, bad things happen. We've seen that. I mean, some of the worst things that have happened have been when it's been in public control. I don't, and I've spent a lot of time researching this, I haven't found a lot of real public health disasters that have come out of private ownership. There have been pricing, problems, particularly globally, more so than here. But it's not these massive public failures and then cover-ups.
I want to give the panel a chance to comment on one of our themes that's emerged today, and that is social justice. Do you think that privatization, where it's proposed, has a disproportionate impact on certain parts of society?
Want me to start?
Anybody can take it.
Well, go ahead. I talk too much. I don't get out much anymore, so you all.
Yeah, again, I mean, based on my universe, my limited universe, I do think those with the least ability to pay are, likely to be hit the hardest. And just on this idea of public versus private, just some of the stories I've heard about increased costs also are that citizens really don't have anywhere to go. I mean, so when there aren't big disasters like Flint, when your washing machine is being destroyed by too much iron, your mayor doesn't really have much to say about that. Your alder may not have much to say about that. So, the more disempowered you are, the less voice you have, I think.
What I wanted to say, though, is the idea, PPPs are public-private partnerships. And you can't, as the public sector, you can't just throw this ball to a private entity and say, see you, thanks for the money. You've got to stay involved, and the successful P3s, and I say successful, maybe it just means that nobody's screaming, but the successful ones have that kind of interaction. It's not the selling of the waterworks, and I don't think that's feasible at all in the U.S., except maybe some really tiny little systems. But the concession model can work, but the government's got to put the time in to say what they want. I mean, they've got to, I always thought one of the things that was driving, and this was based on my California experience, but driving Milwaukee is I thought that maybe the city wanted to get out from public pension and public employee costs, which are not trivial in publicly run enterprises. And again, without saying whether that's good or bad, but if that's what you want to do, make that specific. That there are cities in California that 80% of their budget goes to pension costs. That's just California. That's a little extreme, but that happens. So maybe it's okay that you actually want to get out from under this, but make it explicit what you're trying to accomplish. Because people would say, is a P3 right? And I would add, well, what do you want to do? What do you want to do? Do you want to just get a bag of money and run away and let somebody else deal with the problems? Or do you want to try a different model for how to operate the system and serve customers? If you want to take care of people at the bottom of the socioeconomic ladder, you can make that explicit. That people up to a certain point, and somebody pointed this out, it's $50 a year for low-income people. That's what the cost of their water is going to be. And you raise the rates on that. You can protect people, but you've got to be explicit about it. The market is not going to protect anybody unless you tell the market what the parameters are. The market left to itself is very cold.
Robert, let me follow up with you on this question of effective communication by public institutions that Richard mentioned.
Yeah,
what can institutions do to more effectively communicate with stakeholders, whether it's private partners, citizens, others in the community?
Well, right now, I was looking at some Gallup data earlier today across time, and public faith in institutions, public or private is not exactly at an all-time high. So anytime you're suggesting a change, if you want to move from public to privatization, it might be one thing if people overwhelmingly trusted private institutions and, as is the case now, don't trust the government very much, but that's not the case. So with any kind of change comes a perception of risk, what's going to be different, and very often people would rather stay with the status quo than make a change if all else is equal. Right now, I think in terms of looking at how people might respond to privatization, I would take a look at some kind of study, or we're not going to do it, but somebody do a study that looks at people's perceived risk from that kind of a change. Do they feel more at risk if the water utility, the water system is public or if it's private? Do they feel they have a voice? At least I think most people probably feel, regardless of the political system, that at least if a water system is publicly operated by a utility, at least there's some feedback, some way of keeping tabs on it. And I think the perception of private industry is that they are not responsible to the public, they are just responsible to themselves. And I think rightly or wrongly, I think there's a perception there that would have to be overcome. And the big thing has to do with perceived risk. If people feel, as we found, again I'm extrapolating, as we found from the cryptosporidium study, and I think it's still valid, that once betrayed, people still are concerned, and people who felt that, yes, I would know what to do if a parasite got in the water again or something like that happened, so they felt confident. Nonetheless, they felt very worried that, in this case, the utility was not going to tell them that something was going to happen. Well, how would people perceive a public or private water system under those circumstances? Because I think that drives people's anger, it drives their sensitivity to things. That's just my impression of it.
I have many more questions, but I want to make sure to give the audience a chance. So in the back there, yes.
So my question is about publification, really, not just privatization, but the distinction between in the municipal water system, we have a publicly held delivery system, treatment in the mains, and privately held laterals, internal pipes in the home, and everything else. And all of the discussion this morning about how do we deal with lead assumes the city or some municipal entity is going to pay for lateral replacements, which are traditionally the province of the private homeowner. So I guess the question becomes, I guess, what's your perspective on that? If the public's being asked to fix the problem of lead in the homes, are we then saying the public sphere now extends into the guts of the home, into perpetuity?
Well, from my perspective, if you're looking at what is a serious public health issue, I think good responsible government has something to do there, whether it's all borne by us as the body politic or borne individually by the property owner. It's probably somewhere in between. As I said, when I was listening to that this morning, there's a way to do that. There's a way to share the cost. I don't think it's a binary thing that it ought to be just the homeowner or just the public, because when it's just the public sector, you get a lot of free riders, which is human nature. But I think there's a way you can work that out depending on who owns the home. Is it a homeowner in there? Is it an absentee landlord? One of the things that no one mentioned this morning, that if there's a mandate to fix the problem and it's put all on the private sector, the absentee landlords, what happens when they walk away from those properties, maybe tear them down, and Milwaukee discovers it now has a 50,000 homeless problem that they didn't have yesterday? I mean, that's the thing. But I think government ought to be clever enough and nimble enough to figure out how to solve problems. This is a real problem. Government should solve real public health problems. We've done it in the past. And I don't want to think we've gotten stupider over time. Maybe we have. But these are not insoluble problems. It just takes some will to fix it. You know, and we elect people every 2, 4, 6, or 8 years to solve problems. And quite personally, I get very frustrated when these people tell me why they can't. You know, if you can, I'll get somebody else. That's what I like about having things in the public sector. They're, you know, infinitely changeable, which, you know, if you don't like what your current government's doing, change it. That's what I like about our system. So I don't think it's insoluble. It's just, do we have the will to do it? And if we have the will to do it, I think we can. That's the details. The hard part is deciding what you want your policy to be.
Yes, sir.
The Milwaukee area has an example of a public-private partnership, which most of this discussion has been public versus private. And that's the Milwaukee Metropolitan Sewage District contracting out the operation of their treatment plants to American Water. And it's a public-private partnership that works. It takes a sophisticated contract to do it, and it allows the sewage district to spend more of their focus on taking concrete liners out of rivers and non-point source pollution. Could some of you comment on really that kind of public partnership with a private company? Because from what you're saying, let's not deal with the public versus private. Well, why don't we do the best of both and combine them? That is what I thought the point of this discussion was going to be.
Yeah, that was my very next question, so thank you for asking that. Anybody want to weigh in on that?
Well, like I say, I talk too much, but yeah, you're absolutely right. I mean, your sewer system, which has a private operator of a publicly owned system, seems to work pretty well. I mean, nobody was talking at any time today about how bad that is. You can do the same thing with water. You can do the same thing with most public services. It's how you structure it. You get the contract right, and you pay attention. It's not a fire and forget kind of thing. You have to stay engaged. And particularly on these smaller systems where they need sophistication, it's hard for a tiny water system to have somebody with a graduate degree in chemistry to take care of all the complex stuff that we heard about today. If you put a bunch of small companies together in private ownership, maybe they only need 2 chemists to service 25 companies because it's not a full-time job at any one. You can get those kinds of economies of scale. And I was so taken today that Mark Edwards had these things, you know, about water systems. I mean, water supply has not changed since Roman days. You know, you catch it in the mountains and run it by gravity down to town. You know, somebody from Rome could come back and run most of our water system because they have not changed. And part of the challenge, too, is what are the new technologies? How do we bring new technology online? We're not, somebody raised the question here, how do we go from this to that? Well, we do it slowly, unfortunately, because I don't know how many people here remember the old ABS problem with plastic pipe. That was the next great thing for inside water, except when you run chlorinated water through it, it fails, which was a real problem because thousands and thousands of homes had this kind of pipe. So it is a very conservative industry, but that's not to say we can't make progress, and the progress I personally think is all on the governance and institutional models. The engineering is a lot more trivial. It really is. You know, it's just making up our minds that we're going to, number one, do things differently, and we're going to spend the time to do them right. And that's, I sound simple-minded, and I probably am, but it's not a hard problem. We just need to do it. You know, instead of beating our breasts about what we can't do, it's like if you want to do something, figure out how to do it.
Yeah, and I certainly don't have the technical experience, but I think where this accountability comes in, no matter who is running a system, is that the public has to know what's going on. The transformation I see is when I'm in a community, most people assume their government's protecting their water, and I think that's a really fair assumption for people to make. And when I'm working with people who have problems with their water, they get sophisticated, you know, quickly, and they start translating those problems and their concerns into a vote or into accountability. So to me, I don't know, it sounds reasonable what you're saying, you know, have problems and fix them, but without accountability, whether it's a private or a public entity, you know, the public absolutely has to know what's going on so that they can hold everyone accountable.
Other questions? Yeah, we'll go to you.
Capital raising problem. And then, of course, after that, a capital allocation problem. Who can raise the most capital? Everybody that got up there today said, we don't know where we're going to get the capital. I think that's where we're ending up with. That's the first stage that we've got to get through to go beyond that.
I agree. Anybody want to respond to where the money might come from? That seems like it's the million-dollar
question. Ultimately, the money's going to come from there's only two places money comes from. It's taxes or fees. I mean, so you can raise capital, but you pay it back. And either it's the direct users who pay it back through fees, or we all pay it back. And both models work. I mean, we finance a lot of public stuff through general taxation. You know, we used to finance highways through the gas tax, but that became unpopular. Now we're moving into magic money. But you're right. The private sector can generally raise more capital more quickly. But of course, they want to be compensated for that. And that's one of the arguments against some of these arrangements that, oh, the public sector, because they borrow tax-free, can borrow at such a lower rate, it makes no sense. Anecdotally, I did some work on the Long Beach courthouse out in California, which ultimately went as a PPP. And the state office that crunches numbers for the legislature said this was a terrible idea because the state could borrow money, you know, they could issue bonds and all this. And I asked somebody, so if we go through the budget, when will this courthouse be built? Well, probably never. But the fact, and the one thing that's not factored in with private capital is you actually get improvements sooner. You know, if you want to build schools, if you want to fix the water system, the capital can be there, you can start the work. Paying it back is ultimately going to come directly from the users or from everybody else. And again, that's another policy choice that elected officials get paid to make. But it's, you're right. I mean, first you get capital, then you get the revenue to pay back the capital, because it's not a gift. The private sector isn't in that for eleemosynary purposes.
I think we've just about run out of time, so I'm going to have to stop it here. Please join me in thanking our panel.
We'll put on eleemosynary.
And I'd like to transition now to our final session. The Marquette Law School poll is one of the most extensive statewide polling projects in Wisconsin history. And even though we're in the middle of a very heated, of course, election year, I'm very grateful to say that recent editions of the poll have included a number of water-related items. So to explore the results of those questions, I'm very happy to introduce Charles Franklin, our professor of law and public policy and director of the Marquette Law School poll, to bring us pretty close to the finish line today. Charles?
Sorry, no horse race today. So just get that disappointment over with right now. I want to play a little bit off of what Bob Griffin was saying about how people perceive these issues when it directly affects them, when it doesn't directly affect them, and put that as the perspective of looking at the results we're going to see today. Because most folks, most of the time, are not directly being inundated by some horrible water problem for them. And so their perceptions of this is based on news media, on prominent events, and every so often a real disaster in their neighborhood. But I guess it's a good thing that mostly it's not a real disaster in your neighborhood, but the bad side of that is the personal experience is so important for becoming informed and learning about what to do and seeking cues from other people. So let me walk you through this. We did polling in August, asking some of these questions at the beginning of the month and some at the end, but there's no reason to believe that opinions are changing real fast on this. So the first is the question of where do you get your water? Private well or a public water supply? And you can see that almost 2/3 get their water from a public supply, big urban areas and so on, but private wells still make up 1/3 of the public. And again, I've been thrilled with the panels because some of these things have been touched on. Private wells may not have nearly the kinds of treatment standards or testing standards, and yet 1/3 of the public gets their supply from there. As you'd expect, there's a huge difference depending on where you live. People in urban areas on the left get almost everybody, 90% gets their water from a public supply. It only drops off to 80% in suburban areas, but it's an incredible 72% with private wells in rural areas. So you get a very natural division of the state between basically urban plus suburban that are pretty similar, and the rural areas of the state where there are dramatically different situations and potentially dramatically different impacts on individuals who do or do not have a public system for addressing their water issues. And we've seen this in some of the rural counties where groundwater issues are affecting private wells. So look for that as an issue in the future, but it really affects a particular segment, but an important one, 1/3 of the state. Whether or not you even know you have a problem is a big deal. Have you ever had your water tested? I confess slightly to my surprise that more than half have had their water tested, at least at some point, but 41% say they've not. It won't surprise you, I think, to see that most of the testing goes on with private wells. 81% of private well owners, private water source, have had their water tested. Less than half, 42% in public supplies have had it tested. I expect a lot of people are like me. They trust that my public water system is doing the testing, and there's no real need for me to privately get that tested. But in the private world, the private well water, which I hasten to add I grew up with, that explains a lot, is much more likely to do that testing and perhaps detect problems with their own supply. This also varies, as you'd expect, by region. The urban areas, less likely, people who live in urban areas, less likely to have done testing. And again, the rural areas where most of those private wells are, most likely to do testing. So there's a bit of an asymmetry here in the likelihood of awareness of what the issue is. If you have a private well, you're getting it tested, you live in a rural area, you may actually be better off in finding out whether you have a problem than in an urban area. What about the awareness of contamination in your area? This is something that makes headlines from time to time. And going back to Bob's points earlier, what does this mean to people? So 14% of our samples said that they had heard or read something about contamination of drinking water in their community. I suppose you can ask whether you think that's a lot or a little. It's certainly a big deal for the 14%. But what it means to people seems to differ quite a bit, depending on the impact that it has and maybe even the framing of it. So, for example, 14% say they've heard of a contamination issue in their community. In Waukesha County, that's 25% that have heard. But there is a radon problem there. We are going to take Lake Michigan water to abate that problem. And yet only 25% say their community has a contamination problem. So this is a good example of something with a chronic but not dramatic impact that doesn't percolate to the surface of thinking about this as a contamination problem in my area. You know, the great thing about the Black Plague is people drop like flies. It's really hard to miss it. But when we have chronic low-level problems that are hard to detect and hard to see the symptoms of, it's fairly easy to ignore. Now, the radon issue in Waukesha County has been much talked about and much written about. So when we ask specifically, have you heard about the problem with radon in Waukesha water, 61% of Waukesha residents said they had heard about that. Still 61% despite all of the discussion of it. But I think you see here this point about how we go from a generic background problem that maybe I've heard something about to a specific problem in my community that I may or may not think of in terms of contamination, to with a little bit of prodding. You know that thing about the radon you've heard about? Oh yeah. 60% have heard about that and maybe thought about it a little bit. But this also goes a long way to explaining why chronic background problems don't rise to the level of major political issues when they remain just sort of chronic in background. Speaking of political issues, I want to mention that the way in which politics divides opinion on these water issues throughout our surveys differs a little bit from what we see in a lot of the election surveys. First of all, there's very weak partisan effects on whether or not you've had your water tested, whether or not you're aware of contamination in the county. Very small differences across Democrats, Independents, and Republicans about that. But when we go to the question, which we talked about on the last panel, of private ownership of the water supply, guess what? Big partisan differences. Just 30% of Republicans would be concerned about private water supplies versus 57% of Democrats who were very concerned about that. So this is something that we also see often, that when we're talking about fairly objective conditions like having your water tested, knowing about a contamination problem, party doesn't play much of a role. But when we move to policy issues where ideological views and partisan views can be brought to focus, like is private ownership good or bad, then we see pretty big differences arise. So this has implications as well of what do we do about ameliorating chronic conditions, which may not tap the partisan dimension as much, but which certainly do structure other kinds of things like private ownership. People do not hear more about contamination depending on where they live, at least not in our data so far. Rural areas are just as likely to say they've heard of contamination, or perhaps no more likely to hear of contamination than others. This may represent the sort of geographic specificity of contamination. So perhaps you live in a county that's having widespread problems, you'd hear about that. But if you're in the 71 other counties, you wouldn't necessarily be focused on that particular issue. And some of the rural counties do have groundwater problems, others do not. Something to look into more is the question of what's the relationship between the objective water issues that a county is experiencing and whether people are more aware of it. But I think the Waukesha example shows you why that might not be the most amazingly powerful force. What about the Flint water system? You can see here that half, really quite a striking number, half of the public has heard a lot about the Flint situation. 28% some, that's 3/4 that have paid a decent amount of attention to that issue. I think this is the example of how a local issue became such a national issue and a focus of national attention. But an open question of whether people think this carries over to the situation in their communities. Certainly the first panel today talking about lead laterals is a great example of how this is relevant to our community and our state more generally. But concern about water safety in your community is kind of flat. Basically, if people just sort of were flipping a coin, they'd get roughly this distribution, 1/4 in each category. 21% very concerned, 23 somewhat. Is that 28? Not at all. In other words, people don't show a particular high level of concern or particular low level of concern about their community. I guess my takeaway from this is that a little less than half seem to be concerned, and just barely over half seem not very concerned, but there's no real strong spike here to show high levels of concern or particularly low. On the other hand, when we ask about water contamination issues in low-income communities, there's considerably more concern about the water quality in low-income communities. So maybe this is in part the effect of Flint as an example of bad things that can happen. But it also has a sort of side effect that it could be that you can look on this as concern for those who are less well off than the average citizen, that water quality in low-income places is an issue. But it can also be seen as an idea that water quality problems are somebody else's problems, not mine. That my community is pretty not concerning, but on the other hand, low-income communities really have something to worry about. So this, too, could lower the level of background concern about water issues and perhaps lead some suburbanites, for example, to believe that there could be nothing wrong with the water in their community, but, you know, look out for the poor community 2 counties over. How about regulation and our views of the job that the state of Wisconsin is doing with water quality, water safety? Here, I think you're just basically seeing middling responses. 10% say an excellent job, but 9% say a poor job. Sort of equals on the ends, not massive concern nor massive complacency. And in the middle, is it good or fair? Well, there's a little more good than fair. So on balance, slightly positive, but hardly a ringing endorsement. On the other hand, the feds are worse. Coming back to Bob's point earlier, here's the real question. How many of our respondents has ever encountered either a state water official or a federal water official, or knowingly have been directly affected by those policies or those enforcements? And this really was where I thought what Bob was saying was particularly important, is that we have evaluations of good or bad, but unless you heard some of the talks today, you might not be hopping up and down upset about poor enforcement of water quality standards. Likewise, if it's your drinking water that you can't drink, you might get a lot more concerned. So this just means that when we talk about this in the public arena, it's much harder to link it to actual performance of government entities, when for most of us we don't have direct contact with that. And when we do, it's almost always because something bad has happened, at which point it's rather late to demand action. One of the themes from, again, the previous panel and maybe running through some of the earlier talks today, is the question of how do citizens hold government accountable for these kinds of things, regulatory poor performance, or for that matter, reward regulatory good performance, when there's such a gap between the individual's experience of these issues and therefore holding an elected official over whom you might have some influence, holding that elected official responsible for getting the bureaucracy to work better when it's even more of a distant stretch. So I think this is nothing new in the world of governance, but it certainly draws our attention to the problem of how does a representative democracy pressure elected officials for action on chronic long-term difficulties as opposed to simply be driven by a crisis in Flint or a crisis in Waukesha. Finally, the last thing, also from the last panel, I didn't plan it this way, is concern about private drinking water companies. So here, not quite half, 45%, said that they would be very concerned with a private company taking over the water supply in their community. That drops off as you go to the right, so 70% are either very or somewhat concerned. Perhaps this is an indication of why the legislature backed off on moving on this bill. But it raises the question, and again we talked about it on the previous panel, of is it an unmitigated good or an unmitigated bad to have private suppliers? This certainly shows that there's a public opinion concern about that. And to move forward on this, either direction needs to take account of the public's latent concern with the idea of no longer having public control over those water supplies. And at the very least, the need to convince people on this issue. It's not an easy one to go by. And as I mentioned earlier, this is one of the areas where there is a bit of a partisan gap of opinion. 30% of Republicans saying very concerned, so not no Republicans by any means, but 57% of Democrats saying that. So that's the rundown of this. If there are any questions, I will take them. Otherwise, I'll give it back to Dave. Yes?
They have not mentioned once that water is part of our public good. It is what we all have to have, and that's why who wants that controlled by a company that wants to sell it as a commodity for profit?
Right. Water as a public good is really interesting. We got a little bit of discussion of that earlier today about pricing of water, right? Likewise, we don't normally charge for breaths of air. It's treated as a public good. We can all consume it, but as the air quality issues show, we also have an issue with that. There was a hand somewhere over there. Yes?
You asked about where people get their water. Did you ask or do you know from others polls where people get their information about water quality?
No, we don't have any.
Or risk.
Sure. Where do people get information about their water, its supply, and so on? Well, I'm sure it's down there on the bottom of your water bill, and if you go through all of the itemization, you'll find test results. This is, again, an interesting point that it's an issue which is obscure under normal circumstances, right? And so all the more reason why we see disasters driving public opinion on this more than sort of a routine level of concern. I have no answer for how to fix that, but that's the issue.
Do you have any information or did you ask anything about those people who are concerned about their own, any level of concern about their own water, what they intend to do about it?
No, we did not ask what you're going to do about it. I think that, too, goes to the issue, and it's a good question for a subsequent survey, of who would you go to if you had a problem? Would you go to your city council? Would you go to your alder? Would you, the county commission? Would you go to the bar and kvetch about it? I think this is a chronic issue, right, of how do you translate concern into action in this sort of a public good setting. So, yes.
Also, for a future survey, to balance out water, you just mentioned air. Could you ask people how concerned you are about the air you're breathing and how clean it is, and then you could probably balance off the answers between the two?
I think that's an interesting question, because public goods and how do we price them? It was, again, the discussion earlier today, you put a lot of cost pressure on industry to clean up the air, right? I went to college across the street from a steel mill and literally had flecks of steel precipitate on my arm one summer. Well, those mills are gone and the air's a whole lot cleaner, but there were real costs to the society in the transition. Likewise, we heard earlier about how point source pollution was pretty well regulated by the Clean Water Act. So now we have other sources. Farmers here, big factory farmers in particular, are really concerned about having access to high volume wells. There's a downside to that as well. And this problem of who pays for public goods and how do you price them, I'll leave for the economists to talk about, but from a public opinion and public policy perspective, it's a big deal. And as a purely practical answer to both your and the previous question, the way you do that is when we see these issues become connected to political campaigns and political choices. Right at the moment, I don't see that as ratcheting up, but it certainly only takes a Flint water crisis to raise it to the agenda of an awful lot of voters in Michigan, for example. So I think my time's out, and so Dave, I will hand it back to you.
Thanks, Charles. In wrapping up today, I don't propose certainly that we have solved any of the grand legal or policy challenges that face us in the water sector, but we have accomplished something, I think. We are interested here in the law school in serving as an intellectual commons, and we have been that today. In convening this discussion, we've seen a very robust and lively exchange of perspectives from a variety of different experts. We've heard about the challenges associated with lead and aging infrastructure, of groundwater management, of water pricing and valuation, of privatization, and of public perception of risk. And so speaking for myself, at least, I've learned a lot. And so for all of us here at the law school, I want to certainly first thank all of our panelists who came from near and far to be part of this. Our organizing committee, which included Dean Joseph Kearney, Gene Hassenlop, Mike Goucher, Charles Franklin, Alan Borsuk, and myself, our event staff, and most of all of you for being with us here today, because if there wasn't interest from you, we wouldn't have programs like this. So thank you very much, and I hope to see you again at some of our programs in the future. And you see that we wrapped up on time, so thanks for helping us with that.